You have my permission.
Good afternoon, everyone. Thank you for joining the Finance Committee. Today is Thursday, March 7th. And we welcome you to the committee. I'm going to read the bill order. These are all Senate bills: 796, 813, 1056, 1000, 874, 399, 699, 815, 952, 911, 823, and 987. That's the planned order, but things change. You'll see people coming and going. It's not because they don't want to listen to you. It's because they're in other committees presenting their bills. So if they're not here at time for their bill, then we'll go to another bill, but that's the planned order. We have 114 witnesses today, I think. And so we're going to ask that you really stick to your 2 minutes when you come up to testify. And senators, we had a little rule the other day that worked really well. 1 question to 1 panel member. We'd like to get out of here before 8 o'clock tonight. So we're going to be very thoughtful in our questions. And I thank you all for being here. And we are going to start, like I said, with Senate Bill 796, Senator Simon Ayer. Senator, do you have a panel that you want to bring up?
Yeah, I think their staff sent that down.
I see Jillian Aldridge, Rachel London, Sharon Maneki, and Bruce Bariano.
Okay, that works.
That works. Okay, so would you like to come to the table with the senator? Start when you're ready.
All
You
right,
have as much time as you need. Everybody else gets 2 minutes.
I will keep it brief. For the record, Senator Simon Ayer presenting Senate Bill 796, Maryland Disability Service Animal Grant Program. And I put in not a lot. I put in many bills over the years, and some were helping constituents with things, but I'm excited about this bill. It's a bipartisan bill, if you'll look, and it'll have a tremendous boost on the quality of life for Marylanders. I have successfully worked to bring all the stakeholders together and worked in a collaborative manner with the Department of Disabilities in drafting a grant program. There is no opposition and no mandated funding in this wonderful legislation, and it lines up with Governor Moore's philosophy of leaving no one behind. This bill is modeled after the successful service animal program in the Department of Veterans Affairs, where it has been running since 2017 and implemented without any increase to staffing. The Veterans Program specifically focuses on helping veterans with unique issues such as PTSD using highly trained dogs and expanded to horse therapy. This bill, Senate Bill 796, would create a similar program in the Department of Disabilities as it relates to service animals. This program would bring together the strength and outreach of the department and the expertise and knowledge of the nonprofits who train these service animals. Unfortunately, as we know, service animals can be cost prohibitive for many who need them. Additionally, there is more demand than resources. As some nonprofits have shared, it can have up to a 3-year waiting list. If interested, the ADA website details many of the amazing duties these service animals can accomplish to help those with disabilities. Now, specifically to the bill, it establishes the Maryland Disability Service Animal Grant Program, partners the state's centralized outreach to people with disabilities with nonprofit specialized training of service animals. The department would, and have great flexibility, select 1 or more nonprofits to participate in the program, accept and refer applicants to the nonprofit organizations, and provide grant money to the nonprofits. The nonprofits would match a service animal to the applicant, train the individual with a specific service animal, and provide the applicant free of charge. This bill establishes the framework and a vehicle for acceptance of different funding. Funding can come from private donations, state appropriations, and other sources accepted for the benefit of the program. As with the Veterans Program, there was no funding mandate, and the framework was set up in the first year so we could provide thousands of dollars from private donations to help it start. It is truly an example of working together is more beneficial than working individually. I have submitted friendly sponsor amendments clarifying a definition and tweaking the wording in one section after working with the advocates in the department. And finally, in the fiscal note, while it's not huge, it's similar wording to the bill we passed in 2017 for the veterans, where it was actually zero cost. To be clear, this bill has no cost, as it is just setting up the framework, just as we did with the first year of the Veterans Program. Additionally, there is no additional staffing required as seen with the Department of Veterans Affairs. And lastly, other costs in the fiscal note assume similar future budgeting that is given to help the veterans. I'm already in positive discussions with B&T for funding next year, but this year is just the framework with no mandated funding. Therefore, in closing, it is exciting to be able to help people and to implement a demonstrated efficient program. Again, this is not theoretical. This program works. It's a win-win scenario, and I ask for your favorable and quick consideration. Thank you.
Thank you, Senator. Who would like to go next?
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. For the record, I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We are a statewide public policy organization that creates change to make it possible for people with disabilities to live the lives they want with the support they need. This program is surely another way that can help. You have my written testimony, so I am really just here to say we also strongly support and appreciate Senator Simoner's willingness to see those amendments as friendly and to submit them, and that the council strongly supports this. My council member next to me will have better explanation of why. Thank you, Madam Chair.
All right, good afternoon. My name is Angie Aldridge, and I'm a member of the Maryland Developmental Disabilities Council, but I'm here today as a mother of children with disabilities. My oldest, who is with me today, began to have health problems about 3 years ago, to the point where she was unable to leave our house or attend school in person. As we navigated her various medical conditions, we began to consider other creative options that could help her, and one of them was a service dog. The problem was finding an organization to help us obtain and afford the dog. Most service dogs cost between $15,000 and $30,000, which covers the cost of the dog, training, and support over the dog's lifetime. It does not cover vet bills, meds, food, or any other additional costs associated with owning a dog. After submitting applications to several U.S. service dog agencies, none of which were in Maryland, we found Canines for Change in Michigan, and their cost was $13,000. We held a fundraiser over Thanksgiving weekend and raised about 75% of the needed funds. Several more months went by, and we were able to contribute the remainder through additional donations. My husband then traveled halfway to Michigan to pick up Roxy, the yellow lab, who would become Jillian's best friend and who's here with us today. Roxy came with obedience training and specific training for Jillian's needs. We then had to work through FaceTime with the trainers in Michigan to help us learn how to work with the service dog. Doing this remotely proved rather difficult. Fundraising was hard. Driving hours to get our service dog was hard. Remotely training and certifying without local help was probably the hardest. For many families, these are the barriers that make getting a service animal impossible, leaving many people without the life-giving assistance they can provide. Roxy was a game changer for our daughter, and we hope others can experience this too. Thank you.
Does Jillian want to speak?
My name is Jillian Aldridge, and I am 12 years old. I want to tell you how important Roxy is to me and my ability to do normal things. My health problems made me anxious. I didn't feel well, and it always took me forever to recover from illnesses. The treatments were long and could take months before improvement could be noticed. At my worst, I was unable to go further than my room and bathroom. I panicked every time I had to leave the house. Everything felt impossible. Most of all, I was lonely. Without being able to see people at school and in public, I had no one to talk to. At the end of May, my service dog, Roxy, arrived. Suddenly, I was never alone. When I panicked, she was right there, interrupting my panic behaviors and cuddling me. One of the most significant things Roxy is trained to do for me is to go get help. If I'm having a panic attack, she can go get someone and bring them back to me. One of my biggest diagnoses is orthostatic tachycardia. This means my heart rate is really fast. This can make me feel dizzy, nauseous, or lightheaded. Now that I have Roxy, I feel more confident going out in public because I know that if I faint, Roxy will go get someone to come and help me. I needed to have a PICC line placed in my arm, and then several weeks later, I then had to have a port placed surgically in my chest. We had to drive to DC and wait for hours. I wouldn't have been able to do it without Roxy. She distracted me, and she laid in the hospital bed with me while we waited. She's helped me be able to go so many places, including coming here today.
Jillian, thank you for that. And I see how well behaved Roxy is. So thank you for bringing her to visit today. One more witness.
Madam Chairman, members of the committee, I'm Sharon Maneki. I'm with the National Federation of the Blind of Maryland, and we are very excited to be here for this bill. The Department of Disabilities will run the program, and that's really the appropriate place because they have the most knowledge about disability. And as the other folks said, there is no school for the blind to go to in Maryland. So this will be an opportunity. It will be an opportunity possibly for trainers to come in and allow the person to get trained in their community. And it's a great bill. So please vote in favor of it. Thank you.
Thank you. I have one more favorable. I'm not sure if she's part of your committee, but let's hear from Danielle Maccan and then we'll ask questions. Danielle?
Good afternoon. Can you hear me?
Yes, we can hear you, Danielle.
Thank you. So thank you for listening to me today. My name is Danielle Maccan, and I have been a guide dog handler for more than half of my life. I'm currently working my 5th dog. Her name is Cammie. And I just want to ask that you please vote in favor of this bill because it's important, as others mentioned before, to have follow-up services close by. When Cammie and I came home from training, we did train out of state, but when we came home from training, I lived in Baltimore City, and the landscape in Baltimore City is very, very different from where we trained out of state. And so Cammie and I had about a 4-month period of time where I frankly wasn't sure if she was going to be able to continue to be my dog because she hadn't trained in an environment with, you know, the sidewalks in the city or the different, you know, we walk by parks with other dogs and she would get distracted. And so I really believe that this would be an asset to those of us who rely on traveling and living our lives with service dogs. So I thank you for your time.
Thank you very much, Danielle. So do I have any questions for this panel or for our virtual witness? I see no questions. Thank you for bringing this very good bill, Senator. We have one person favorable with amendment, Sharon Dolles. You can begin, Penny. Thank you.
Good afternoon, Committee Chair Beidel, Vice Chair Klausmeyer, members of the Finance Committee. I'm Sharon Dolles, the Deputy Executive Director of the ARC Maryland. The ARC Maryland, as you know, is a statewide disability advocacy organization that's dedicated to preserving the rights and improving the quality of life for individuals with disabilities. We are pleased to support Senate Bill 796 with amendments. In addition to my written testimony that you have, I wanted to address some of the benefits that the bill provide, although I think the other testifying members already did that. But over 61 million people in the United States have disabilities, but less than 1% are teamed with service dogs. Service dogs specifically trained to perform disability-related tasks have long been known to provide invaluable support and assistance to individuals with disabilities. They're not only loyal companions, but they help people live, work, play, and live independently and confidently throughout their daily lives. Also, there's many other benefits such as psychological well-being, improving the quality of life, and reduction in prescribed medications. Service animals can cost tens of thousands of dollars. This should not be a program where only the rich or entitled people can have access to. This bill is a good investment for the state to make. The bill would create equity and access for critical supports for people with disabilities. Trained service dogs can assist with practical everyday tasks, giving people with disabilities their safety and their independence. In closing, we ask the committee for a favorable report on Senate Bill 796. Thank you.
Thank you, Sharon. Do I have any questions for this witness? Thank you. I see we have a late person that should have been on the panel. Bruce Bariano, did you want to say anything on Senate Bill 796? You're late.
Thank you, Madam Chair. I apologize, just one-man band. Just very briefly, I'm here on behalf of BISM, and we're in very strong support of this legislation. I read it, makes a lot of sense, and anyone that has disabilities, particularly blindness, which BISM is very much involved with, we would support that. And we ask favorable consideration of legislation. Thank you very much.
Thank you. Any questions for Mr. Bariano? Thank you.
Sorry,
for
I was late.
Yeah. That ends the hearing on Senate Bill 796. Now we'll go to Senate Bill 813. Senator Stallings here. Senator, you have Cornelia B Gordon. Is she your panel?
Yes, ma'am. If I have a panel, would they come up, please? Favorable. Of course. Thank you.
Welcome to Senate Finance.
Can I start? Thank you, ma'am. For the record, I'm Senator John Ray Salling, Baltimore County, 6th District. Madam Chair, Vice Chair, and Committee, I want to thank you for the opportunity to present Senate Bill 813, healthcare facilities, access to telephones, is also cross-filed, and I appreciate the cross-file that's helping this bill out. This bill will require all medical care facilities throughout the state to provide a landline free of charge to its patients so they are able to make outgoing calls and receive ingoing calls from outside the respective medical facilities. I believe this bill would offer several benefits for patients. In critical times, a landline is a reliable means to communication. Patients can quickly reach out to medical staff, parents, family members, and other situations that if it's urgent, they can reach out also. A landline in a patient's room in a facility, communication between the patient and the caregiver is very important too. It allows them for privacy at the same time if they want to talk to a family member. I believed in this testimony that I have a lot, but I think those that are for it, I appreciate those that are for it, but also that with amendments have got with me. But I do have a story that I like to tell you that happened personally. As you know, seniors, when they get elderly, a lot of them, we have a hard time taking care of them. And maybe it's in a place where maybe they need to get some health care or go to a facility. And at the same time, those that go into a hospital, maybe they have to go to rehab. And when they go to a rehab, they're there to be taken care of. I want to tell you this, Madam Chair. My father went to a healthcare facility. And when he was there at the time, we made sure that he was comfortable when he got there. But throughout the night when we left, they did not take care of him. Matter of fact, he had an alarm for them to come. They would not come. They found him laying on the floor and he yearned all over himself and he was unconscious. The following day, I found out, and my family found out, that they were taking him back to the hospital. We didn't find out that day or that night. We found out the following day that he was going to the hospital. We were very upset. I believe you would be very upset if that was your family member, your mom or your dad or your grandparent. And that happened to me personally. I believe this is one reason why they need to have better communication in rehab facilities with our seniors and at senior homes. Now they're telling me, and I have a couple amendments, which I believe will be talked about, but they're telling me that there's things are in code that they need to have phone jacks, but it doesn't say phones. It doesn't say phones, it say phone jacks. They should have a phone to at least so many patients that are in there and not give one phone to 10 or one phone to 16, but at least have a phone for maybe 4 in a room so they can have communications to their sons, to their daughters, to their relatives. I think it's important that we need to have this. And Madam Chair, I have one that's against me that's not for this bill, but they didn't come to my office. They didn't even come to me and have a conversation with me. I found out at the last hour that they were against it. I really wish I had the opportunity that I believe you would like to have the opportunity to talk to that person that's against your bill, that maybe you can amend it to be better. But I didn't have that opportunity. But I'm today more than willing to talk with them and have a conversation that maybe we can come to amends and maybe make it amended so they can be favorable. So I want to thank you for this opportunity, and I hope and pray we can get a favorable report for this bill. Thank you. And I want to thank you for those that are testifying as well. Thank you, Madam Chair.
Senator Cornelia.
Thank you, Madam Chair, Vice Chair. My name is Cornelia B Gordon, and I am the Director of Advocacy for Administrative Law at Maryland Legal Aid. Legal Aid regularly provides representation to residents in skilled nursing and assisted living facilities. Most of them lack access to a telephone. The lack of access to telephone interferes with access to private attorney-client communication. Attorneys who represent people in nursing facilities are very careful to observe protocols relating to attorney-client privilege. But frequently, we will get a phone call from someone at the nursing station, which, as you know, is a public-facing location and is not private. A confidential, reliable telephone connection between attorney and client is important to protect the client's rights, even for averting an order of guardianship. Our clients frequently face a very hard choice between waiving confidential communications and the inability to speak over the telephone at all. For these reasons, legal aid staff drive long distances all over the state in order to effectively communicate with our clients and potential clients. You have my written testimony, but I'd also like to quickly paint a picture for you all. I go into nursing facilities a lot. And who is in the nursing facility? There are people who are amputees, people who, without an access to a telephone, can't even complain about the care given to them by the staff. So in this modern world, it's necessary for the residents of these facilities to have access to a telephone for their own safety and also to access counsel. Thank you very much.
Thank you for that testimony. Do I have any questions for our sponsor or our panel member? I see no questions. Thank you. I think.
If I could, Madam Chair, real quick, I do have an amendment for anybody that's impaired in any way. I do have an amendment for that as well. But I believe we have some with the amendment that we could answer that also. Thank you very much.
Senator, I was reading the letter of opposition, and it also talks about people that maybe are there for punitive reasons, you know, that end up in a nursing home. So, but that's easy enough to unplug the phone from the jack. It's not like you can't take that phone away when you need to.
Yes,
so,
ma'am.
I'm sure you can work with them and offer some amendments.
I'd love to.
Thank you. Thank you very much. I have two people that are favorable with amendments, Stevan Ellis and Jacob Leffler.
Good afternoon. My name is Stevan Ellis. I'm the State Long-Term Care Ombudsman. I'm the Advocacy Director for Nursing Home and Assisted Living Residents. I'd like to thank the Chair, Vice Chair, and members of the committee for listening to my testimony today. I'm asking for a favorable review of this bill with an amendment. I think most of us take this telephone use for granted. I think most of us actually have. I bet if I took a poll of all of you, you all have at least one cell phone on your person right now. And in nursing homes and other healthcare settings, often there's a public access phone. The folks that testified earlier described that there's a phone available in common areas. There's a phone available at the nurse's station. There's no privacy. And if you're someone that is in a room all of the time, you may not be able to get to the nurse's station or arrange time to have private conversation. Also, nursing homes, unfortunately, still there may be 3 or 4 people in a room. And so to ask them to share a telephone, I don't think is proper. The 4 people in the room may want to have their own conversations, And so my amendment is asking that each person in a room in a healthcare setting that this bill applies to, that each person have their own phone. I believe it should be a landline because some people are not able to use cell phones. They don't have the fine motor dexterity. They can't see the phone. They may not be able to hold the phone. So an old-fashioned landline would do the trick. It would also allow them to have access to Echo and Alexa. We have a resident that calls us all the time. He uses that all of the time. And I think that's a very appropriate use of that. It really does make people's lives easier to have a phone. They can call for help. It leaves them connected to the outside of the world. When you're in rehab in a nursing home, you're going to want to call your family and let them know how you're doing. If you're there living, you're going to want to have the social connection to the outside of the world. It makes you feel like a complete person. And also it helps with your mental health. I'm respectfully asking for a favorable review of this bill with amendments. And I really appreciate you taking the time to hear my testimony today.
Thank you, Stevan and Jacob.
Good afternoon, Madam Chair and committee. My name is Jacob Leffler. I'm the Vice President of the Maryland Association of the Deaf. We are in support of this bill with amendments. We feel that it's very important for phone access to be available in every room in rehab facilities and hospitals. Our amendment requests the use of technologies such as video phones, remote interpreting capability, caption telephones, amplification devices for telephones that meet the accessibility needs of deaf, deafblind, and hard of hearing constituents of Maryland. We also request the installation of high-speed internet access. Many of these nursing facilities and care facilities don't have high-speed internet access, which is required for these kinds of technologies. Many staff also don't have training on how to use or troubleshoot those devices. So our amendment includes the recommendation that staff do get training on troubleshooting and how to contact support and things like that. Maryland Association of the Deaf wants to provide support of this bill in recognition of 1.2 deaf, hard of hearing, and deafblind constituents who live in Maryland, many of whom live in nursing home, rehab facilities, and also use hospital services. Maryland Association of the Deaf has heard many stories where patients and or their family members don't have access to telephone service. And if they do have their own mobile phone, they can't access high-speed internet services through the facility, so they are unable to make those calls. We feel it's very important for all facilities to be accessible for anybody who's there to be able to make telephone calls using the language of their preference. So we are in favor of this bill with amendments, and you already have my written testimony. Thank you so much.
Thank you for that testimony, and I do see the amendment, so thank you very much. And thank you to our interpreters today. We appreciate it. Thank you. Do I have any questions for this panel? I see no questions. Thank you very much.
Thank you so much.
That ends the hearing on Senate Bill 813. No, he's not here. And now we go to Senate Bill 1056, right? Senate Bill 1056. Senator Kramer, this is your bill. Should I call up your panel?
Please, thank you.
Kristen Jimon, Kathleen Hoke, Reverend Kobe Little, and Flannery Lee. Please come to the table.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. Ben Kramer to introduce Senate Bill 1056. Colleagues, this is a bill that is past due, and it simply is updating our retail sale of tobacco products in the state. Very much common sense changes, and a particular focus in trying to keep tobacco products out of the hands of those who are underaged, our high schoolers, our middle schoolers. We've done good work, particularly here in Maryland, in trying to reduce youth consumption of tobacco products, but it still is a significant problem. And vaping has been part of the issue, and trying to keep vaping products out of the hands of those who are too young to be using them. And nationwide, vaping use among middle schoolers continues to climb. And that's a frightening statistic. And all studies indicate that when youth start using nicotine products as minors, they are far more likely to become addicted for life than adults, and to have more physical health problems associated with that nicotine use throughout their lives. So the purpose of this bill is to take a look at how we can better serve the public when it comes to using tobacco products. And the bill before you starts with increasing the license fee. The license fee, annual license fee, has been $25 for decades. This bill increases the annual license fee for tobacco products to $300. That $300 will be utilized to enforce our standard of no one under the age of 21 should have access to tobacco products. There has been, I think, a little bit of contention as to how this money, where it will go and how it's going to get back. Well, the money goes to the Maryland Department of Health, as it always has. The Maryland Department of Health will then send it to the local governments who are responsible for doing the enforcement. And the cost will be covered by these fees. Now, up until about an hour ago, I believe the Maryland Association of County Health Officers had been indicating that they thought the money should come directly to them. I received an email and a phone call in the last hour saying, never mind. They're okay with the way the bill is structured. And I think it's appropriately structured that it continue to go to the Maryland Department of Health, and then they will address the need at the local level to ensure that inspectors come out at least once a year to inspect facilities that are selling tobacco products. The bill will also increase penalties for stores that are selling to minors, and appropriately so. There is no reason any store can't be checking IDs to ensure that they are not selling tobacco products to minors. One of the things the bill does is to prohibit the sale of tobacco products in pharmacies. Something, to their credit, CVS has taken the lead on, and as a couple of years ago said, we realize that as a pharmacy, people turn to us for products that provide wellness. And when people are coming to a pharmacy looking for tobacco cessation devices, they should not be exposed to a product that we absolutely know causes a host of health issues, including a variety of cancers. So the bill would prohibit the sale of these products in pharmacies. And then it also would provide that vaping devices be sold exclusively at vape shops. And that's very important in our effort to try to get vaping products out of the hands of minors. They'll still be readily available to adults in vape shops, and vape shops will be mandated to be checking the IDs to ensure that you're 21 when you come in to buy a vaping product. So we're not taking away access to it. We're just indicating if you want vaping products, you will go to a licensed vape retailer to get the product. And with that, that's pretty much what the bill does, colleagues. And I'm appreciative of my cross file in the House. Delegate Wilson, he and I have been working on this bill for several months now with a lot of folks, some of whom are sitting at the table today. And I think we have a very reasonable bill that will in fact improve significantly our efforts to keep tobacco products out of the hands of our youth. And also with the understanding that we know the tobacco industry has continuously targeted youths, trying to addict them and keep them addicted for a lifetime, and particularly our communities of color. And I think this bill will go a long way in addressing and combating Big Tobacco's efforts to hook our children on tobacco products. So thank you, Madam Chair.
Thank you, Senator. I'm going to call one more time for your panel, Reverend Kobe Little. There he is. Okay, thank you. So we have 4 people on this panel, and I'm going to begin on the left and go right down the row. Thank
Absolutely.
you.
Excuse me, Madam Chair, members of the committee, I'm Kathy Hogue. I am the director of the Legal Resource Center for Public Health Policy and a professor of public health law at the University of Maryland Carey School of Law, here today in support of Senate Bill 1056. I hope that my role will be to help answer lots of questions that you might have about this bill and the extensive amendments. So my primary point in this testimony is to tell you a couple of things. First, some of the provisions in this bill, those that relate to the identification check and the product placement being behind the counter, are already federal law. This will just put it into state law and allow our local governments, our local health departments that are out there doing enforcement to enforce those provisions. The other significant provisions in here that Senator Kramer mentioned, I want to highlight first is this enforcement program. For the first time, you will be mandating that there are enforcement checks to make sure that youth are not able to access tobacco products at the retail level. That's a unique provision in this bill. And to do so, it's necessary to increase the licensing fees. That money for enforcement has to come from somewhere, and very commonly, it's the regulated industry that pays for the enforcement programs. Second, that excuse me, there are increased penalties for violations, including, for the first time you're putting it in legislation, suspension or revocation of repeat violators. That's important. We know that's an evidence-based policy to drive down youth access. Prohibiting sales in pharmacies, Senator Kramer spoke to, that is, something we're seeing across the country voluntarily. It would be important to put that in law so that healthcare entities are not part of the leading cause of preventable death in the United States. And finally, the vape shop vendor aspect. This would take all vape sales at the retail level to vape shop vendors, allowing for us to hone in from an enforcement perspective, from a regulatory perspective, which you'll hear about on Senate Bill 987, the difficulties there, and again, reducing youth access to those products. For these reasons, I urge a favorable report on Senate Bill 1056. Thank you.
Thank you, Madam Chair and members of the committee. On behalf of the Campaign for Tobacco-Free Kids, my name is Kristen Jimon, and I am here today in full support of Senate Bill 1056, the Tobacco Retail Modernization Act. First, we want to thank Senator Kramer for his leadership on this effort, and we appreciate the senator for meeting with us to best discuss how we can reduce harm for children in the state of Maryland. Our goal is to reduce and prevent tobacco use by kids and by youth. While tobacco use is still declining, it still kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. And every year, the tobacco industry spends $8.6 billion annually in marketing, which is nearly $1 million an hour, with more than $95 million directly targeted at Marylanders. Published research studies have found that kids are twice as sensitive to tobacco advertising as adults, and we feel that tobacco products are sold seemingly everywhere. While considering this legislation, it's important to note that youth who try to buy tobacco products are often able to do so, and most kids who buy tobacco products buy them in person at nearby stores. And we also know that youth rates of tobacco use are lower in places with strong retail licensure, and kids are less likely to start smoking in areas with this type of strong regulation. This is especially important here in Maryland, where 8,800 kids under 18 will try cigarettes for the first time this year. This legislation contains common sense solutions to help address these issues. And we're trying to ensure communities have the resources they need to consistently enforce tobacco laws and keep kids from buying these products. We also know that it's vitally important that the state of Maryland and the public health community has current and accurate data to make informed future policy improvements. And this legislation also provides provisions to help provide that data. Which, with each year that passes, our youth tobacco crisis becomes an ongoing adult tobacco crisis and creates another $3.14 billion in annual Maryland healthcare costs directly caused by smoking. And for these reasons, we urge the committee for a favorable report. Thank you.
Hi, my name is Flannery Lee on behalf of Youth Activism Project. I'm here as an activist and student living in Baltimore City, expressing my support for Senate Bill 1056. As we all know, the problem of youth access to tobacco products remains a significant public health and economic issue. Data indicates that over 48,000 Maryland high school students use tobacco products, a number that likely falls short of the real total. Big tobacco industries have hooked my friends, my classmates, and even my family by their strategic marketing and flavor components. Senate Bill 1056's proposal takes a significant step towards this by limiting manufacturer power and sale of ESD to licensed vendors. Controlling ESD purchasing to vape stores will significantly reduce teen access. With this, lawmakers need to continue to go even further. Districts need to include provisions to educate youth and about the direct correlations of ESD products and what teens do. We need PSAs and visual advertisements in these vape stores that specifically target what youth care about. If these in-person required advertisements target ESD's effects, it's much more probable that other teens will develop a well-rounded perspective of just how detrimental these are. Along with more targeted advertisements, I encourage the Maryland Department of Health and ATCC to use the data from the end-of-year reports to look thoroughly at the manufacturer's role in tobacco retail, tackling the root cause of the issue. Finally, I support raising the licensing fee. The idea that counties will use $100 from each license to enforce existing preventative laws shows Maryland's commitment to protecting teens from the dangers of vaping. I strongly support earmarking these allotments to these previously mentioned visual advertisements. I urge you to vote in favor of this bill, the Tobacco Retail Modernization Act, and I'm looking forward to the development of this bill, as well as the continuation of youth voices in the implementation process. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, and Senators. I'm the Reverend Kobe Little, and I'm the president of the Maryland State Conference of the NAACP. We're here today in support of Senate Bill 1056. We're grateful to my good friend, Senator Kramer, for his work on this legislation. We are here to support this bill in view of the tobacco industry's longstanding predatory practices. This legislation allows Maryland state government to do what government is supposed to do, which is to protect citizens from predatory practices. So for these reasons and the reasons that have been mentioned by our colleague, we do ask that you offer a favorable report. This is a racial justice issue, and it is an issue that speaks to the heart of protecting vulnerable communities. And so we would ask you all to give a favorable report on this legislation. Thank you.
Thank you to this panel. Do I have any questions for this panel? Senator Hershey.
Thank you, Madam Chair. Senator, just a quick question. It's probably not the question you think it's going to be, but no. When we talk about other tobacco products, how do we classify the more expensive cigars?
Premium cigars are considered an other tobacco product, but they are not in this bill.
See, you did such a great job. Thank you so much.
You're surprised.
And
You surprised, Joe.
Reverend, I didn't ask you a question either, as you see, but thank you very much. No, you're good. Thank you.
I don't see any other questions for this panel. Thank you all very much.
Thank you.
We have a second sponsor panel. Laura Hale, Lance Kilpatrick, David Thankyul, and Lisa Way. And Lisa's virtual, but the first three I called should come to the table. Okay, so David, we're going to start with you since you're closest to the podium, and we're going to go right down the line. Thank you.
Madam Chair, Madam Vice Chair, to the committee, I thank you for this time. I am Dr. David Falconley. I serve as Assistant Professor in Public and Allied Health at Morgan State University, as well as Associate Faculty at the Johns Hopkins Bloomberg School of Public Health, but I come on my own accord, to make that clear. I'll ask you a simple question. I want you all to think about where you currently live in the state of Maryland, and I want you to think about how far you would have to travel to buy a pack of cigarettes. So as you think about that question, it calls to attention one of the more insidious ways that the tobacco industry has catalyzed tobacco use. And we call that outlet density, tobacco outlet density. And I've been fortunate to do that research since 2008. I guess you could say I'm kind of an OG in this research game. What I found was very clear connections between concentrations of Black and brown communities, as well as a negative association with median household income, meaning the more money you got in your household, the lower the density. One of the things that was crystal clear when it came to associations with tobacco outlet density is that the higher the density, the lower the age that people start to engage with the use, the more they use, the harder it is to quit. And I think we all know that there is no acceptable health benefit for tobacco use, zero. So what explains the density? We know that there are more density, the higher density in Black and brown communities. There's higher density in lower income communities. And it is something that affects all of us. I'm sure if I call out stroke, cancer, emphysema, COPD, all right, we know somebody. And it might actually be tied to smoking. So I look favorably on this bill. I hope that you do as well. It is a necessary and long overdue step towards better public health for the people of Maryland. Thank you.
Madam Chair, members of the committee, for the record, my name is Lance Kilpatrick. I am the Maryland Government Relations Director for the American Cancer Society Cancer Action Network. First of all, I'd like to thank Senator Kramer for all the work he's done over the number of months here to bring this bill to this position today. ACS supports SB 1056, inclusive of the amendments that have been discussed. This year is estimated that 36,410 Marylanders will hear the chilling phrase, "You have cancer." And it's also estimated that 10,310 will die from cancer. Now, tobacco use has been found to be one of the primary drivers of cancer-related health disparities. Achieving health equity relies heavily on eliminating tobacco use. That's it, plain and simple. ACA again thanks the chair and the committee for hearing us, and we urge a very favorable report on this bill.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and honorable members of the committee. My name is Laura Hale. I'm the Director of Government Relations with the American Heart Association, in strong support of this legislation and with the sponsor amendments on this. Just a few pieces on this particular bill. The research shows us that strong retail licensure, like what has been set up in this bill, is effective at making sure that we limit youth use, and we really know that this makes a difference. By increasing the licensure, the state can use this the licensure fee, the state can use these funds to better enforce the tobacco control laws that you all have worked so hard to pass and can continue to show and make a difference. The other thing I'd like to point out to you all in a year around budgets is an important program called SINAR. The SINAR funds are a federal program that we in Maryland get for substance abuse. As part of that, it's important for Maryland to remain in compliance with our enforcement checks and making sure that we are not selling too much to youth. Now, about a little over a decade ago, Maryland actually was the first state to be in a position where we were out of compliance with SINAR. We were selling too much to kids. And so this legislation, it actually threatened our federal dollars. Deals were made, we made a huge step up, but once again, coming out of the pandemic, it's time to make a difference to make sure that we continue to maintain those federal dollars. And this program will be a piece of the puzzle to really make sure that that happens. So we don't want to be losing any of our federal dollars. And so in addition to making sense for the state, making sense for enforcing our laws, it also will help protect those SINAR dollars. So thank you.
We have one virtual witness that's part of this panel. Lisa. Hi. Can you unmute? There we go.
Good afternoon. Good afternoon. Thank you so much for the opportunity to testify today. I want to thank our legislators and coalition of which I'm a part for pushing this bill to this point. I strongly advocate for this bill. I am Bishop Lisa Wea. I pastor the New Bethlehem Baptist Church in West Baltimore, where I am a large proponent of community wellness and the wellness of our families. The community where I pastor is a food desert. However, there are a plethora of tobacco products. We have seen over and over again the health and economic implications of the generational damage done by these tobacco products and how they are intentionally flavored and targeted towards young people to perpetuate the continued problems that we're having in our community. And so as a community leader, as a leader of wholeness and wellness for our families, one who strongly advocates for the improvement of Baltimore, I strongly urge you and ask on behalf of our families that you would support this bill. Thank you so much.
Thank you. I see we have a question from the sponsor.
Thank you, Madam Chair. Just a quick clarification. Committee counsel just brought to my attention that the sponsor amendments that I thought were here are not, so I'll get them to you immediately. And also wanted to clarify that with clarifying that the Maryland Department of Health will be the recipient of the fees that, as I understand it, eliminates the fiscal note. And I believe we may have an updated letter from them indicating as much. Thank you.
I have a question, please. I think, I'm not going to say your name right, David. So
Yeah.
You've been doing research on like the density of cigarette sales and is that going to be a published report at some point?
So that was actually my dissertation
Oh,
back in 2017. So certain aspects of that research was published. Just to give you a quick rundown, I looked at comparisons between Prince George's County and Baltimore City because those are the two predominantly Black jurisdictions in the state of Maryland. And they also have very disparate median household incomes, which is a typical measure of socioeconomic status. We found that the higher income area, Prince George's County, had a lower density than the lower income area, despite similar racial concentration. We explored that further in my dissertation to look at predominantly white areas. We wanted to see if there was a racial gradient as well as a socioeconomic gradient. The answer is yes. To put it bluntly, the poorer you are, the higher the density. The Blacker you are, the higher the density. So if you are in that quadrant where you are poor and Black, it is the worst for you. If you are in a quadrant where you are rich and white, on the whole part, lower density.
Wow.
And again, we know that the outcome is bad in a myriad of ways. But we need to understand the fact that certain neighborhoods are targeted simply with just the availability of the product. You don't even have to get into actual advertising. You don't even have to actually get into seeing the product. The fact that it's there is marketing in itself.
Thank you.
You're welcome.
I appreciate that answer. Do I have any other questions for this panel? Thank you very much. We have 4 more favorable testimonies: Candace Scott, Melissa Hendricks, Shema Patre, and Avriand Erevin. Okay, thank you. I'm not even going to try your last name. Thank you. I'm missing somebody. Candace Scott, Melissa Hendricks, Shema Patre. Okay. Closest to the podium should start. Thank you.
Good afternoon. I am here on behalf of the Maryland Vapor Alliance to support this bill and to express our appreciation for the sponsor's thoughtful legislation. We believe this legislation will serve to solve problems and no longer reward the bad actors in our industry. Vape products belong in vape shops. This makes the regulation pool much more manageable, and the FDA reports on this are clear. They're crystal clear. Consistently, it shows that convenience stores and tobacco shops fail compliance checks. If you go on the FDA compliance website today and search for vape shops, you'll be hard pressed to find one. And that's over years of data. This legislation will help to ensure that the vape products remain in the hands of responsible retailers, thus ensuring the safety of consumers. Small business vape shops have played an instrumental role in Maryland's success in becoming the 2nd lowest smoking rate in the United States. We believe this legislation will help kickstart to Maryland having the lowest smoking rate in the country. We are confident this bill will help to protect small business vape shops and promote a healthier Maryland. With the added amendments, this bill will also not cost the state anything, but will have great benefits in efficiency, safety, and compliance. We thank you for your time and consideration on this matter, and we are hoping for a favorable report. Thank you.
Thank you, Chair and committee members, for allowing me to speak today. My name is Melissa Hendricks, and I am a small business vape shop owner along with a part of the Maryland Vapor Alliance. This bill has a lot of potential to help reduce the number of teens using vape products because it places all vapes in businesses that only allow 21 and over adults. We are dedicated to helping keeping the vapes out of the teens' hands. If you do look at the compliance checks from the FDA, the bad actors are the convenience stores or stores that allow anyone under the age of 21. Vapes belong in vape shops where the employees understand the product and are knowledgeable about what they sell. We have the education to help customers purchase the right product for themselves, along with the knowledge and the know-how to use the product. When customers walk into convenience stores to purchase a vape product, they will not get the education like they do when they walk into vape shops. To me, that's really important. A lot of customers that transition from convenience stores to the vape shops, they don't really understand what they're utilizing. They don't know how to work the product. So when they actually come into a true vape shop and we are able to educate, sometimes we can actually get them lower on their nicotine because they don't realize how high the nicotine is in convenience stores, which is typically the highest that you can get. But if you walk into a vape shop, we can get you down off of that nicotine and really work your way off of vapes. Maryland has the second lowest smoking rate in the United States, and small business vape shops are really here to help to ensure that remains. We believe that this legislation will protect small business vape shops and make Maryland healthier. My family was full of smokers, and now they don't smoke. They don't even vape. And I think that would actually help make Maryland healthier. Thank you for your consideration.
Good afternoon, Madam Chair, members of the committee. Thank you for this opportunity to testify in support of Senate Bill 1056. My name is Arvind Muthukrishnan. I'm an Assistant Attorney General in the Tobacco Enforcement Unit of the Office of the Attorney General. Senate Bill 1056 brings some much needed improvements to Maryland's electronic smoking devices law. Use of electronic smoking devices, or ESDs, has grown dramatically since Maryland enacted the law in 2017. There are an increasing number of new products, many attractive to children, flooding the market. The consequences are all too predictable. ESDs are now the second largest nicotine product category after traditional cigarettes for adult users, but they're the largest category of nicotine products for Maryland youth. Despite Maryland's law banning ESD sales to people under 21, ESD use by Maryland youth is higher than for cigarettes, cigars, and smokeless tobacco combined. The Department of Health recently reported that 3.6% of Maryland high school students currently smoke cigarettes, but nearly 15% use ESDs. Because kids are particularly susceptible to nicotine's addictive properties, the widespread availability of ESDs in Maryland poses a long-term danger to our youth. Senate Bill 1056 helps solve this problem by allowing only licensed vape shop vendors to sell ESDs to the public and by requiring that ESDs are the only products those shops can sell. This removes ESDs from retail environments that kids frequent and make it easier for law-abiding vape shops to enforce the age requirement for the sale of nicotine products. This bill, like Senate Bill 987, also eliminates the existing exemption that allows ESD manufacturers to sell their products directly to consumers online, a huge loophole that allows youth to order ESDs from unscrupulous suppliers over the internet. The Office of the Attorney General also believes that this committee should consider amendments to make Senate Bill 1056 even more effective. This would include granting the Alcohol, Tobacco, and Cannabis Commission the authority to conduct inspections of vape shops to ensure for the foregoing reasons, the Office of the Attorney General urges a favorable report on Senate Bill 1056. Thank you.
Thank you for your testimony. Do I have any questions for this panel? I appreciate all your testimony. Thank you. I have a group of favorable with amendments. We're not sure, Larry Polsky, if he's here. Dana Moncrief, Dr. Caliana Rama, Scott Weber, and Sarah Sample. All right, so Dr. Caliana Rama, you are closest to the podium, so you'll start and we'll just go right down the line. Thank you.
That sounds good. Thank you, Chair Vital, members of the Finance Committee. For the record, I'm Dr. Nilesh Kalyanaram, the Deputy Secretary for Public Health at the Maryland Department of Health. And here to testify on behalf of the department that with the amendments that Senator Kramer, the sponsor, mentioned, we are favorable for this bill. This bill modernizes how licensed tobacco retailers are regulated and how they conduct business, and it aligns Maryland law with current evidence-based practices in tobacco use, prevention, and control, especially in terms of product placement and restricting where tobacco products, including ESDs, electronic smoking devices, can be sold. And I think critically, it really furthers our efforts to reduce children's access to tobacco products. The sponsor's proposed amendments focus on how the state can best operationalize this, including with having the Maryland Department of Health continue to coordinate our work to do retailer enforcement and to continue our efforts to fund local health departments to do this work as we currently do. I could go on, but I will stop there. I think you know that we are favorable, and I want to thank Senator Kramer and his staff for working with us on these amendments. Thank you.
And I'm Dana Moncrief. I'm the Director for the Center for Tobacco Prevention and Control. Honestly, I'm here to help answer questions, so I will pass it along to the next person.
Thank you to the chair. Thank you to the member of the committee for having me today. My name is Sarah Sample. I'm here from Mako. And we are still support with amendments on this bill. We think the funding for the inspections is absolutely great, good across the board. The way the bill had originally been drafted, there were $100 from each fee going to local governments to do the inspections. Along the way, it got redrafted to make sure all that money goes to MDH, and we certainly understand the fiscal note component of that. But we have also received good assurance from MDH that we are going to be required to be doing these inspections. And so what we are just looking for is some clarification in the amendments that is intended to be how the funding gets allocated. And so the amendments that we've sent over to the sponsor and to some of the other stakeholders just say that for any local inspections that are required, the funding would come with those. And then if funding is not allocated, then the work stays with the Maryland Department of Health and they would do the inspections. But so with those amendments, we would be certainly happy to support, and we don't want it to be a specific earmark of money or anything like that. We just want a little bit more clarification. Thank you.
Madam Chairman and members of the committee, Scott Weber, the founder of the Vaping Awareness Public Education Society. We are a nonprofit public health advocacy and research organization. We've been doing this for a long, long time. We are here very much in favor of this bill with amendments. I won't go into the details of statistics and facts. I've submitted written testimony to that. So specific to the amendments that are here, we'd actually like to ask that it be strengthened beyond what this is currently in there. One was the pulling out, and I'll go through the amendments that are in my written testimony. One is to pull out the exemption for 19, 20-year-old military, which we understand makes it consistent with federal. The idea of having behind a counter, we'd actually like to see it not just visible behind a counter, but actually in an exclusive area that has no visual aspect that a youth could come into. If you walk into a grocery store and you're seeing this here, get it into an area that is completely visually as well as physically blocking any access to anyone who's not 21, and make it age restricted before you can access that at all. I'd like to also ask for the restrictions involving age verification assistance of electronic devices be removed, so that indeed you could use age verification software and scanners to verify age. I think that would actually make it stronger, in addition to being face-to-face. I would also like to ask that the concept of being able to order it online be removed. However, the pickup of it be maintained, so that you can order it possibly online, but you have to come pick it up, and whoever's picking it up then has to be seen face-to-face, has to have that verification, has to approve it, because again, any credit card is an online transaction. So if ever it is used even in the store, it becomes electronic, and if you remove any electronic, you have removed the ability to transact in that way. We'd also like to remove the concept of exclusivity to a vape shop. There are vape shops that actually sell water, snacks, magazines, etc. What we'd like to do is, by having anything that's within the parameters of what would be called a vape shop, be put into a age-restricted area. So it really doesn't matter what's behind that door. Thank you very much. We are favorable with the amendments.
Thank you. And I just want to note, Mr. Weber, we did pass a bill earlier this year that takes away that military exemption, because it was being enforced federally anyway, and so it was illegal for those sales to happen. So that's been taken care of. That's one little piece of what you requested, but thank you.
Thank you, madam.
Do I have any other questions for this panel? No, I don't see any other lights. Thank you very much for your testimony.
Thank you, ma'am.
Next we have Sarah Price, unfavorable. If I was Sarah, I wouldn't be here. So Sarah, you are only unfavorable.
Can't wait.
Thank you, Madam Chair. Good afternoon, honorable members of the committee. My name is Sarah Price, and I'm here on behalf of the Maryland Retailers Alliance with some concerns about this legislation. I am in no way advocating for youth access to these products. We support enforcement. We support checking for age. We are not here to defend any bad actors, but we do have some concerns, particularly about the pharmacy license aspect of the bill. Marylanders at this point are accustomed to being able to pick up a variety of items at their community retail pharmacy. These retail spaces are not exclusive to medication, and in many communities, they operate as a sort of general store. You can buy groceries there, you can buy office supplies there, you can buy greeting cards there. These spaces are depended upon by their communities, and we would hate to see these retail pharmacies that we all know are already suffering take another hit by removing a product from these stores. It's also unclear in the bill whether grocery stores that have a pharmacy counter would be restricted from selling any tobacco products, or if that would only apply to the pharmacy section of the grocery store. I think we all know at this point that the grocery industry has some of the smallest profit margins in all of retail, and fully removing these products from the store for legal adults would have a very serious financial impact on that industry. No Marylander lives more than 35 miles from a tobacco retailer across the state line. So if we are removing these products from the places where they are commonly available for consenting legal adults, we don't we're not really sure if this is actually going to reduce tobacco use or if it's more likely to push the people who can travel across state lines and have an impact on our business community. So for those reasons, we would urge unfavorable. Thank you.
Thank you. Go ahead. Senator Hershey.
Thank you, Madam Chair. Thank you for your testimony, Sarah. I think I'd have to agree with you on the part on how we truly define what a pharmacy is in this legislation. I don't, again, if it's just something that is strictly a pharmacy, I think all of us would agree that they probably don't have to be selling cigarettes. But if a small pharmacy area is part of a broader store, maybe we have to take a different look. The only way that in the bill that I've seen that it's defined it just says a pharmacy, which a pharmacy permit has been issued. So I guess that's grabbing all of those bigger stores there. And I have not spoken with the sponsor yet, but maybe there's something we can do to address that concern that you have for the broader stores.
We'd appreciate it. Thank you.
Thank you.
Thank you, Senator. I don't see any other questions for Sarah. Thank you. And we have two virtuals. We'll start with Alex Casper. Alex, unmute for us, please. Thank you.
Madam Chair and members of the committee, thank you for the opportunity to make comments. You've heard from many of my colleagues, so I'll keep my comments brief. My name is Alex Casper. I'm the Director of Advocacy for the American Lung Association. We support Senate Bill 1056, inclusive of the technical amendments presented by the sponsor earlier. And we thank Senator Kramer for his leadership on this bill. The bill includes a number of provisions that the Lung Association supports as good public health policy to address tobacco use in Maryland and curb youth access. Tobacco use remains the leading cause of preventable death in the U.S., killing an estimated 480,000 Americans and 7,500 Marylanders each year. 2.8 million youth are using tobacco products, and approximately 15% of Maryland high school students use an electronic smoking device. As you heard, there are some great provisions in this bill that will help reduce that youth access and encourage people to make a quit attempt. And for those provisions we support, and we thank you for your continued commitment to the health of Marylanders and ask for a favorable report.
Thank you for your testimony. We have one. Do I have any questions for this witness? We have one more virtual. Francesca Weeks. Francesca, you ready?
Yes. Can you hear me?
We can't hear you. Try again.
Oh, you can't?
Now we can. Thank you.
Okay. Good. Good afternoon. I'm Chair and the entire Finance Committee. My name is Dr. Francesca Weeks, and I serve as a faculty researcher at the Maryland Center for Health Equity. And I come to speak today in a personal capacity, and I appreciate you guys taking the time to hear my support for Senate Bill 1056, and I urge this vote to be favorable. When I was in high school, I was a part of an undercover operation that paid teenagers to go into stores and attempt to purchase tobacco products. 90% of the stores sold those products without asking for my ID. 20 years later, it's been 20 years since I've been out of high school almost, it's hard to believe that we're still struggling to regulate this access. So e-cigarettes are being marketed to youth and young adults as a less harmful alternative to cigarettes. Although that is true, e-cigarettes still contain potentially harmful substances, including nicotine, heavy metals, and lead and volatile organic compounds and cancer-causing agents. And this is according to the U.S. Department of Health and Human Services. One of my areas of research is examining the impact of marketing strategies on youth and young adults that utilize AI machine learning integrated with social media that impacts the health decisions and outcomes in teenagers. And what we have seen is that the marketing is increasing and pushing teenagers to go and choose e-cigarettes, which helps them have a gateway to having cigarettes. So e-cigarettes contain nicotine, an addictive chemical that has a significant development issue for adolescents' brains and can harm the parts of the brains that control attention. So today, what we're asking you guys is deeply consider addressing this issue by supporting this bill as a public health issue, as a social determinants health issue, and the challenges that we're seeing in our underserved communities. We trust that our communities are trusting us to put in the right policies to help them. So on behalf of the Maryland Center for Health Equity, we ask you guys to support this bill to limit the sales of tobacco products in an equitable, accountable, and responsible way. Thank you.
Thank you. Do I have any questions for this witness? No. Thank you very much. Thank you for your testimony. That ends the hearing on this bill, and my vice chair is going to take over now.
Next up, we will have Senate Bill 1000, Maryland Healthcare Commission Nursing Home Acquisitions. And the sponsor is Senator Bidle. Our
And my
chair.
panel, please.
And the panel would be Ben Steffen, Winnie Hawk, Jake Whitaker, and Stephen Ellis.
Stevan might be in the House testifying. All right. Thank you, Madam Vice Chair, members of the Finance Committee. Thank you for hearing testimony on Senate Bill 1000. This bill has to do with nursing homes that are transferred or purchased by private equity firms. And this is an issue that's really being addressed in states all over the country, because we find that so often the private equity firms come in, they basically buy a nonprofit, and now they're operating these homes at a profit. There are issues with the transparency because they'll often have 3 or 4 or 5 LLCs involved in the transfer. So one LLC may, or one corporation may control the property, somebody else, controls the nursing, the management, the pharmaceuticals, the equipment vendors. And so they're making all this profit, and yet they're also making a profit for their folks that are part of the equity ownership, but our patients in the assisted livings are not being well cared for. And we're seeing these issues in a lot of the transfers. However, we can't really restrict the sale of nursing homes, because if a nursing home is having financial issues and they're going to be sold, we don't want them closed. We need the nursing home beds in the state. And so if nursing homes are sold, then patients are moved, maybe even out of state, to other nursing homes. And that's a problem that we've seen previously. So Senate Bill 1000 will ensure greater accountability, but at the same time, not overly be restrictive to discourage acquisitions, especially for nursing homes that need to be sold for financial or quality care reasons. There are amendments to the bill that address timeframes and appeal processes and make other technical and clarifying changes. And there are a lot of amendments, and we've worked closely with the House, and our analyst David has worked, I think, every meeting that we've had. And so there are a lot of amendments, but it grants authority to the Maryland Healthcare Commission. And thank you to Mr. Steffens and his commission for their work on this, to approve or disapprove an acquisition rather than only being able to make a recommendation to the Office of Healthcare Quality. Allows the commission to approve with conditions for 1 year when approving an acquisition. This is important because it will ensure greater accountability following an acquisition. Requires the acquiring entity to submit an annual report for 3 years to the commission, the Office of Healthcare Quality, and other state partners, which will allow the state to continue to monitor the post-acquisition, and establishes a process for beginning to reduce multi-bed units following an acquisition. The Office of Healthcare Quality will continue to have responsibility for licensing and survey activities. And I'm hopeful with the addition of new positions in the budget that the Office of Healthcare Quality will finally conduct the inspections from a bill that was passed a few years ago. And personally, I'd like to see this done sooner, given the number of acquisitions that have occurred over the past several years. I appreciate the work that the stakeholders have done throughout this interim, and I respectfully request a favorable report on Senate Bill 1000.
Are there any questions? Okay. Ben Steffen.
Thank you, members of the committee. Ben Steffen, Executive Director of the Maryland Healthcare Commission. The Maryland Healthcare Commission is supportive of this bill. We've worked with the sponsor, both Senator Bidle and Delegate Kerr in the House, to refine some additional amendments that we believe are going to be supported by all stakeholders. This work is the outgrowth of a work group that was convened last year by the Healthcare Commission, resulting from legislation that you passed in 2023. The legislation really tracks very closely with the recommendations of that work group. There is a link in my testimony that you can pull up that report if you're so interested. The important point here, I think, is made very succinctly by the sponsor, that the state has been increasingly concerned about the quality of care at nursing homes, especially those who have been purchased by private equity firms. and sometimes groups of high worth individuals who team together to exploit an opportunity. Academic research suggests that ownership of nursing homes by private equity and some of these high value individuals can be associated with worse health outcomes for the residents. And certainly these types of acquisitions merit greater scrutiny before they actually occur. That's what this legislation does. It gives the Healthcare Commission, which is the first cop on the beat, so to speak, when acquisitions come to before the state. We confirm that a CON is not needed currently. This legislation would expand our authority to really take a deeper look at the character and fitness of the entities that are purchasing it, as well as make steps to eliminate 3 and 4 bedded rooms in a scheduled and controlled manner. We strongly support this legislation and encourage a favorable report. Thank you very much.
Thank you. Okay, Winnie.
Thank you very much, Madam Chair and members of the committee. Winnie Hawk, here on, currently am the center director of at the Maryland Healthcare Commission for facilities and planning and the acquisitions of nursing home. The work would be in my center. I don't need to repeat what Ben has said, but I think the most important factor is that this does codify the recommendations of this interim work group, and it will strengthen regulatory tools for oversight of these types of transactions. You have our written testimony, happy to answer any questions, but we look forward to a favorable report. And I just want to emphasize, we have been working very, very closely with all of these stakeholders to build consensus on the amendments that you'll see. Thank you very much. Happy to answer any questions.
Thank you, Madam Vice Chair, members of the committee. Jake Whitaker on behalf of the Maryland Hospital Association, here to testify in support of Senate Bill 1000. Maryland emergency departments serve about 1.7 million patients annually and millions more in other hospital units each year. Approximately 20% of the Medicare patients served in Maryland hospitals are discharged to nursing homes. Ensuring that these patients receive the appropriate level of care is critical to ensuring the success of Maryland's total cost of care model, reducing ED wait times, and most importantly, ensuring that patients have access to the highest quality of care possible. This legislation would ensure that nursing home providers continue to provide the best level of care, including for patients post-hospitalization. Additionally, nursing home bed availability and clinical capabilities in nursing homes is critical to maximizing efficient hospital throughput, which again reduces ED wait times. Maryland hospitals prioritize the safety and well-being of patients and will only discharge patients when they can be certain that the patient will be discharged to the most appropriate care setting possible. If hospitals can't discharge patients to post-acute care options like nursing homes due to bed availability, then patients will remain in hospitals instead of the best care setting for that patient. When post-acute care options are readily available, patients can be quickly discharged to more appropriate care settings, allowing hospitals to serve patients waiting in EDs, which also dramatically improves wait times. Ensuring access to quality care in the community, like nursing homes, ensures that patients who need care at hospitals and the patients who are more appropriately served in the community get the quality of care that they deserve. And I just want to thank Chair Beidel for her leadership on this issue and also serving on MHA's ED work group. And so with the aforementioned reasons, we respectfully request a favorable report on Senate Bill 1000. Thank you.
I see that Senator Ellis has a question.
I do. Thank you, Madam Vice Chair, and thank you, Senator Beidel, Madam Chair, for this bill. And during the briefing earlier this session, I asked this question, and so hopefully you had some time to think about it and answer it in greater detail. I'm concerned about the sale of nursing homes, especially the nonprofit ones. Nonprofit, that means there is no owner per se. So you have these private equity groups come and buy these nursing homes, including the nonprofit ones. A sale happened in my district. I shared that with you last time. And I tried to find out, former retired delegate is on the board, called me and informed me and said, hey, where'd the money go? She's like, I don't think I can disclose that. So my question is, as a CPA, just always try, identify where the money goes, you know. And I know it was shared that the commission was not tasked to deal with that particular issue, but that's a big issue. And and as a CPA, I had a membership in Prudential Insurance years ago when it was a nonprofit mutual association. They went public and the CPA Association negotiated with them, and I got stocks in the public company as a member. So it's possible to really make sure monies go to maybe the residents or some community groups. I see you look. So I was instructed to ask this question of one person, so I choose you, Ben. Sorry, Madam Chair. So what's your further thoughts on that, and what state, what should we do to
and
make sure?
we haven't formally responded to your question, but we have continued to think about that. The Office of the Attorney General does have some authority to, when not-for-profits are purchased by for-profit companies, they do have an ability to look at that. In a discussion last week, they were mostly focused on the purchase of non-for-profit hospitals, which I did remind them probably has not occurred in Maryland for a good 25 years, and pointed to the nursing home industry as a more likely area where not-for-profits are being acquired by for-profit organizations. That's something I'd like to follow up a little more with them in terms of what their thinking is and get back to you.
And that's the Attorney General's office.
That's the office.
So they can, but probably not much action coming out of that.
Well, I think they were focused when we spoke with them on the hospitals. And we pointed out to them that there hadn't been a hospital acquisition.
But I know there've been nursing home acquisitions.
You're absolutely right.
And, you know, nursing home nonprofit, they got a lot of government money and other money. And so it's curious to see where those millions flow from the private equity groups to whoever, I don't know. So thank you. I'll definitely follow up with you with that.
And
that's a
we'll
big
be back
issue.
in touch with you after talking a little further with the Office of the Attorney General.
Thank you. Thank you, Madam Vice Chair.
Are there any other questions? Seeing none, that ends that panel. Thank you very much. And now we're going to go with Aaron Greenfield, Joe D'Amatos, Allison Zabrowski, Lorraine Arakat, Dana Kaufman, and Randy Ames. No, sure. Okay, and we'll start by the podium and go down that way.
This is what happens when you sit in the back. Hot seat. Good afternoon, Vice Chair, Madam Chair, and committee members. Thank you so much for hearing from Disability Rights Maryland, the state's nonprofit protection and advocacy agency for people with disabilities. My name is Randy Ames. I'm here in support of Senate Bill 1000 with amendments. I want to highlight there's already been conversations about the high turnover rate of nursing facilities in Maryland. So I'd like to use a particular chain as an example of why under Senate Bill 1000, there is a requirement for the commission to set standards for evaluations for acquisitions. And I would recommend that part of that requirement should include that an acquisition should not be made unless a survey has been done. So currently Maryland is unfortunately ranked last in the backlog of overdue nursing facility surveys. We have 85% of our over 200 survey settings that still have not been surveyed over the pandemic. Unfortunately, that has led to underperforming facilities being acquired from private equity firms and has led to poorer care and worse outcomes for nursing facility residents. In particular, I'd like to highlight a New Jersey private equity group now doing business as Autumn Lake. In an unprecedented move, CMS came into Maryland and closed their South Haven location in July of 2023. This is the first nursing facility to be closed that I'm aware of since 2018. So this is a very rare occurrence. And part of this is the lack of oversight that led to that purchase. It was an underperforming facility, and it shouldn't have been able to be acquired by an outside state private equity group without improvements. So I would ask that the requirement for surveys to be up to date before acquisition to be included. And for these reasons, DRM supports and urges a favorable report for Senate Bill 1000 with amendments. Thank you.
Chair Bidle, Vice Chair Klossmeyer, members of the committee. For the record, my name is Dana Kaufman. I'm here on behalf of Lifespan Network. We also support this bill with the amendments that we are finalizing with the Maryland Healthcare Commission and others. We brought this issue of the acquisitions to the Maryland Healthcare Commission a few years ago and the Office of Healthcare Quality. We did participate on the work group. I want to point out two provisions that we're looking at two things in this bill. It's not just the standards to be applied for approving an acquisition, but it's also post-acquisition. And I think they're equally important. From the bill that was introduced and passed last year, that bill gave the commission the ability to make recommendations and findings to the Office of Healthcare Quality. Because of that bill, and it is now going to be codified in this bill, the commission does have the ability to to approve with conditions. And those conditions for the last three change of ownerships have basically given a provisional license for the first year, as long as certain standards are satisfied. And then at that point, after a year, it's reevaluated for a non-lapsing. So that is going forward. So we think that's very important. The other important provision I wanted to bring to your attention is that the acquiring entity will be required to submit reports to the Office of Healthcare Quality, the Maryland Healthcare Commission, and others for 3 years, making sure that it is meeting certain metrics. So this bill really has two provisions. It is making sure that the acquisitions are more closely looked at, but also ensuring that post-acquisition, the standards are being satisfied for licensure. So I just wanted to point that out, and with the amendments, we would urge a favorable vote. Thank you.
Joe?
Madam Chair, Madam Vice Chair, members of the committee, I'm Joe D'Amatos. I'm the President and CEO of the Health Facilities Association of Maryland, speaking in strong support of this bill with amendments. Madam Chair, I want to applaud you and the other senators and delegates for your involvement on the task force and in bringing this legislation and to being, consistent and resilient in this important work. I think it's a historic step forward. I want to speak about three things really quickly, and I really hope that there's some time or some questions from each of you. One, the issue isn't whether private ownership or for-profit ownership is good or bad. The issue is the source of financing and how leveraged an organization is relative to the source of financing. And so we have seen in recent years this increase of private equity or family equity across the country buying nursing homes. Not all of them are bad. The ones that are leveraged to the point that they can't support the operations because they're putting profitable dollars elsewhere, that is a challenge. Relative to 3 and 4 bedroom rooms, the marketplace is going to a place where providers want to move away from triple and quad rooms. But that said, there are communities in urban and rural areas in this state where that's the only nursing home bed that's available for somebody who needs it. And it takes time to redesign and do those things. Finally, the transparency provisions in this bill are important. They're a giant step forward. And I really want to applaud the work specifically of MHCC and OHCQ in being good partners.
Good afternoon, Chair Beidel and Vice Chair Klausmeyer and members of the Finance Committee. My name is Lorraine Arikat. I'm the Senior Policy Analyst with 1199 SEIU United Healthcare Workers East, and we are testifying favorable with amendments. I want to thank Senator Beidel for introducing this bill and working with MHCC on this important issue. This is a great start for Maryland to join states like California and Connecticut in setting more rigorous review standards for changes in ownership. 1199 has been sounding the alarm on the lack of transparency in nursing home ownership and the rapid pace of transfers of ownership in Maryland's nursing homes. Our members know that this practice correlates with quality of care and adequate staffing. And understanding who owns a skilled nursing facility and makes the kinds of operational decisions that impact staffing and care quality is crucial, yet currently quite challenging. Workers such as GNAs, housekeepers, and dietary aides have reported that they often are not even aware that nursing facilities that they work for has changed hands until they see a notice on the door, or worse, until they receive communication from management that their benefits are being changed due to a new ownership. We applaud the language in this bill that ensures notice to and input from the very people whose daily lives are impacted by these decisions. Our first amendment is to create a 5% threshold for ownership review. We're very concerned that setting a threshold of 25% will allow many potentially detrimental transactions to fly under the radar of the state. We have discussed this amendment with MHCC and understand the challenges of implementing a 5% threshold, and therefore support statutory language that would require nursing homes to give MHCC notice. Additionally, our other amendments are to keep original language in the bill that would ensure a robust scope of review by the Maryland Healthcare Commission, and that the Office of Healthcare Quality continues to evaluate recommendations by MHCC. For these reasons, 1199 SEIU would like to issue a favorable report on SB 1000 with amendments. Thank you.
Good afternoon. Thank you, Madam Chair, Madam Vice Chair, members of the Finance Committee. My name is Allison Siborowski. I'm the President and CEO of Leading Age Maryland, here in support of Senate Bill 1000 with amendments that we're continuing to work on with all of the stakeholders you've heard from. I want to thank particularly Senator Chair Beidel and the Maryland Healthcare Commission for convening the work group that met over the interim. We were glad to take part in that work. Leading Age Maryland represents more than 150 not-for-profit aging services providers, which does include some skilled nursing providers. And we really just want to echo the comments that have been made by others on this panel and the panel before us. I think that we are all coming to the table and finding places where we can agree and also meet the goals of ensuring that vulnerable older Marylanders have access to high quality care, and that the staff who work in these organizations are treated well as well, which is very important. So we think there needs to be clarity around expectations, timing, and process. I think that we're getting there with the work we're doing on the amendments. We look forward to continued collaboration, and I urge a favorable report. Thank you.
Okay, any questions? Okay, Senator Ellis.
Yeah, thank you, Madam Chair. And thank you for your testimony. And Joe, I wish I could ask you questions, but I'm allowed one question per bill. So reach out to me privately.
I'll come and
Thanks.
visit. Any other questions? Okay, that ends Senate Bill 1000, and I will turn it over to. You want me to do? No. We will have Senate Bill.
Senator Washington is supposed to be here. You Senator Washington, Mary Washington.
Senate Bill is, there's Senator Washington?
Yes.
Okay. You have Senate Bill 815?
Yes. Yes.
Okay.
And 699.
And 699. Okay, well, we'll start with 699 then, and you have Nashana Kess and Nathaniel Hicks. So that's virtual, but so.
Let me just make sure my people know that we're up
Nashana?
now. I can get started.
Where is she here? Or he?
I'm trying to make sure. Let's see. I have a Mr. Hicks coming.
No, no,
And
Mr.
then
Hicks is virtual,
Oh, he's virtual? Okay, great. Then we'll just make sure we're ready.
but we don't have Nashana.
Oh, that's not part of my panel. I only have one person on my
Okay,
panel.
okay, take it
Okay,
away.
and also this one is a delegation bill. Too, so,
Okay.
okay. Thank you, colleagues. Here to present Senate Bill 699, a Community Reinvestment and Repair Act distribution, use of funds in Baltimore City. Glad to be here, Senator Mary Washington. As we all know, when cannabis was legalized, a part of that in terms of looking at the revenues that were being, the revenues of the distribution, the state comptroller manages the fund, and then 35% of the tax revenues of the sales go into the Cannabis Reinvestment Fund. And each county is allocated a certain percentage of those funds based on the agreements with the Office of Social Equity. Baltimore City has a proportion of the cannabis-related arrests and therefore is being allotted a proportion of those funds. Now, each county in the legislation is allowed to determine how the funds are allocated. When we were looking at the allocation of gaming revenues, the state actually provided an opportunity for there to be created local councils to help determine how these funds would be allocated, and that's what this bill is based on. The Baltimore City Council, and you do have a letter of opposition, so I want to address that. They did establish a council, and however, the council was made up of 14 members, one from each council district. And when you read the law, the council members themselves are actually not making the appointments. It's actually the appointment of the mayor. And then also there is the members of the council serve 4 years concurrent with the mayor's term. Additionally, an additional concern that we had about the commission, or what was come up with, was that it required members to demonstrate knowledge in the following: the history of the resistance of African descent to white supremacy, enslavement, Jim Crow laws, and other examples of racial violence, knowledge of the history of the resistance of racial, ethnic, and minority groups against discrimination, and just a number of qualifications that are well-intentioned and important, but we did not believe these are skills or knowledge that individuals in impacted communities would necessarily have. And so we felt that the eligibility requirements, one, it could amount to a single elected official having ultimate control of the distribution. So in order to be consistent with the intent of the Cannabis Community Reinvestment Fund and the Office of Social Equity, and to ensure that the money gets to the people who need it, this bill establishes what we call equitable community investment councils throughout Baltimore City. And these councils are the bodies that will distribute the fund. There will be 5 councils, one for each legislative district. And the first round of appointments will be appointed by the governor and the Office of Social Equity. After that first round of appointments, each council will decide internally how it elects additional members. And then again, they must adopt governance structure, and there's rules about what kinds of organizations they can make grants to. We've had amendments to clarify that the senator and the delegate are not voting members. So the amendment makes we're not voting members. And then also we put clarifying language to really establish that there be a financial management plan, that there be a governance plan in effect at least 60 days before any grants can be made. Just not to put a too fine a point on it, but the Baltimore City delegation, because of the importance and the profile of this fund, really wanted to ensure that the legislative intent is followed, that the funds are managed properly, and most importantly, that communities closest to the ground are able to distribute these funds. I have a community association president here. In the bill, there will be 7 community association presidents or their representatives appointed to each council, as well as a number of other people, and the council will be a size of 15 to 17. So, Madam Chair, if you could hear from my witness, and then I'm available for questions.
Okay. Should we we're gonna take Nathaniel Hicks, and then we'll have question time. Well, wait a minute, just for the sponsor of the bill, does anyone have a question? Okay. All right, Mr. Hicks, you're on.
Thank you so much. Good morning, everyone. Or afternoon, I apologize. My name is Nathaniel Hicks Jr. I am the Vice President of Edno Gardens Lakeside Civic Association, as well as the Maryland State Director of Minorities for Maryland for Medical Marijuana, and as well as a founding member of the Maryland Cannabis Equity Collective. So I am here to give a favorable support to the bill sponsored by my senator, and I do appreciate her. I want to thank her for sponsoring the bill and giving the community and community activists a voice in the formation of a council proposed by this bill. It is appreciated that this bill literally gives each district the agency to direct resources and programs that would focus on the impact of community repair. I do want to keep it brief, but again, we do have a favorable support for this bill, and as well as to just keep in front of the mind that our returning citizens should be at top of mind as well, and have a concerted effort in order to give a voice to them as well. And I thank you again for the opportunity to speak on this.
Now, are there any questions for Mr. Hicks? And thank you very much. And you can stay right there because I see you're on the next bill as well. So
yes.
Senator Washington, Senate Bill 815.
Now, thank you, Madam Chair. Now, of course, I wanted the opportunity to share the love with the rest of the state. So if Senate Bill 815, Community Reinvestment Impact Districts, what it does is allows for any county and of course, Baltimore City to create districts that are, smaller, where they can invest a specific amount of community reinvestment dollars. And what this is based on is that the Office of Social Equity released a community reinvestment and repair fund survey for the whole state. And the survey respondents overwhelmingly expressed a desire to prioritize areas disproportionately harmed by the war on drugs and to have robust public participation. So this bill seeks to honor the public's feedback and to ensure that communities most affected by disproportionate cannabis enforcement or priorities are prioritized across the state. While this bill does capture, while the overall allocation of cannabis funds does capture at the county level the disproportionate impacts within counties, there is variability within there may be a concentration of the impact, and this bill allows there to be created districts that meet at least 4 of the following. They have an average unemployment rate that is more than double the rate of the unemployment in the county. At least 6% of the adult population were on parole or probation during a 2-year period. Unemployment rate for adults between 18 and 29 years of age is at least 35% during the most recent 2-year period. At least 50% of the adult population over 30 years of age have not graduated from high school. The average household income is in the bottom 20% of the income distribution. We also allow for there to be looking at infant mortality rates that are at least 9.5%. That would be twice that of the state average. Also looking at emergency calls related to overdose or fatal overdoses, proportionate drug treatment clinics in an area, and then also an area that has a history of redlining. These districts will receive 20% of the community reinvestment and repair funds. In conversations with the Office of Social Equity, they are also interested in this, and those districts that are created within counties can have a relationship of training and support and capacity building for this. This is not a mandate, it's creating a structure for which counties can implement at a smaller level some of the requirements and some of the goals of the Community Reinvestment Fund. So again, my sponsor panel consists of Mr. Hicks, who will also speak in support of this bill. And again, this was modeled off of what we have done with revenue generated from gaming.
Okay, this is Nashona Kess.
Yes, come on. Yes, I have. Yes.
Okay.
Thank you. Sorry.
Yeah. Okay. And then we'll take you, Mr. Hicks.
Yes, ma'am.
Thank you. Good afternoon. My name is Nashona Kess. I am the Executive Director for the Maryland NAACP, and we stand in favor of this bill. This bill is not just about designating areas as community reinvestment impact districts. It's about rectifying historical injustices and fostering equitable development in communities of color. First and foremost, this bill recognizes the systemic disparities that have plagued our communities for far too long. By designating areas, we acknowledge the need for targeted investment where it's most needed. Communities of color have borne the brunt of inequitable policies from redlining to mass incarceration, and it's time to address these injustices head on. Secondly, allocating a minimum of 20% of funds from the Community Reinvestment and Repair Fund to these districts for at least 5 years is a crucial step towards real change. This targeted reinvestment will empower local residents and organizations to address systemic issues such as economic inequality, lack of affordable housing, and limited access to quality education and healthcare. Lastly, it is imperative to understand that over-incarceration has not only torn apart families, but also weakened the social fabric of our communities. By investing in these areas, we can provide opportunities for those impacted by incarceration to reintegrate into society, access job training programs, and build stable lives for themselves and their families. This represents a significant opportunity to foster economic empowerment, social justice, and community resilience in areas that have long been neglected. I urge a favorable report on this bill. Thank you.
Okay, now Nathaniel.
Yes, ma'am. Thank you again for the opportunity to give a favorable support to bill sponsored by our Senator Washington. As you know, the colleague just mentioned, there's a lot of things that this bill would create or would make sure that our social ills are rectified. What we want to do, or the reason for the favorability, is the fact that this bill gives the transparency and the actual definition of the districts as far as the qualifications of these impacted districts. And that was missing prior to the initial bills. And I would say that, again, with this bill in particular, as far as making sure that everyone knows, or down to a grassroots level of what is indicated as far as what is an impacted area, is dictated in this bill, and we appreciate the thoughtfulness and the hard fight that it took to get it this far. Other than that, again, we do request a favorable support for this bill. Thank you.
Thank you very much. And we have a question here from Senator Ellis.
Yes.
Thank you, Madam Chair. And thank you, Senator Washington, for this bill. I will direct my question not to Senator Washington, but to Dr. Washington. And so I'm here, I'm like, wow, okay, that's deep. And I looked up your biography, you have a PhD in sociology. And so could you reach out to at least me and give me a master class in this bill? Because it's very good and it's very much detailed and it's like, I don't think I have the capability
You
of
do actually
dissecting myself.
So for this bill, as was said, we often talk about we want to help impacted areas or communities that are overburdened, but we don't attach actual quantitative measures to them. And so this fund, well, actually, these districts would not be restricted just for these funds. It could actually be used as an opportunity to target other funds. For example, if you create these districts and we pass the Enough Act, it might be an opportunity to target money from the Enough Act into this. If we have other, areas, but these.
What's the Enough Act?
Oh, you'll hear about it. It's in our committee's governor's bill. But let me just say, I did the research to find out, okay, what is correlated with underinvestment? What is correlated with some of the things that people find are a challenge in our communities? And so the research from a number of entities say these factors. So if you have an average unemployment rate that is double the average rate of any county, so that it could be applied to any county, that area is going to have more problems. If more than 6% of the adult population in that area are on parole, there is an impact for those returning citizens that's really not captured anywhere else. If you have an area that has an unemployment rate for adults that are between 18 and 29, there's a challenge there. And then also it finds that if you have an adult population that's over 30, which I was surprised to read, but there are areas in our state, across our entire state, where 50% of the population has not graduated from high school. And then
high school or college?
From high school.
Really?
And then the bottom 20% and infant mortality. So these are measures that are found all over our state. And to the NAACP's point, it's overrepresented in our African American and communities of color. And these things are overrepresented in our rural areas. And they're also, they're overrepresented in the aging suburban areas. So this district has an opportunity to be able to draw on a number, I think, of sources and address a number of issues, should a county choose to use it as a way of distributing their community reinvestment funds.
Thank you, Senator. Thank you, Madam Chair.
Does that help?
Yes, ma'am.
Okay,
Tremendously.
okay.
Thank you.
Any other questions from the committee?
May I just add quickly, I was on the list for 699, but I was not in here. I did submit a written testimony for that one. Thank you.
Right. Yeah, I had called you, that's why, and then I.
Yes, ma'am. I was
We were, yeah,
Up
we
down.
thought it was later.
Okay,
thank you.
thank you.
Okay, thank you, Madam Chair. And again, I would appreciate your favorable report on both of these bills. All right, thank you.
So that ends the hearing on this bill. And next we're going to have Senator West present Senate Bill 874. And I believe his panel is Daniel Shattuck and Barbara Boccato.
Thank you, Madam Chair. It's a pleasure to be with you, first time in a couple of weeks, to report on Senate Bill 874. This deals with surgical technologists. So let me start with a personal story. This past summer, I had a heart attack, and I recognized the symptoms of the heart attack, and I went directly to the emergency room. And in no time flat, they had done an EKG and they concluded I was in the middle of a heart attack. So I found myself on an operating table for the first time in my life. It shocked me. I figured, okay, death is near. I had just fortunately completed my will about 2 weeks ahead of time, so I knew that was done. But I expected them to break some ribs, to put me under, open up my heart, lots of blood. It was going to be a mess, and I might not survive. That's not at all what happened. It took all of a half an hour, half an hour later I was done, and there was no general anesthetic. But in the meantime, I'm lying there on the operating table and the surgeon is going through my right wrist to operate on me and put in 3 stents within a half hour. The medical miracles these days are incredible. But the reason why I'm talking about that now is while I was there was nothing to do. I didn't have my cell phone. So occasionally I would lift my little head up and look around the room and see what was going on. It was a matter of, some intellectual interest as to what happens in an operating room when I'm being operated on. And there were a number of people there. Everybody seemed to know exactly what they were doing. There was no fighting or disagreement about who's supposed to do what. It was incredible how professional the whole thing was. Now, I will say it was at St. Joseph's Hospital, so I want to give them credit. But my conclusion was that surgical operating room really operated well, that the people there were highly professional and highly skilled. And I got a very good product. The next day, the doctor came and said, good news, you did the right thing. You came as soon as you realized the problem. There's no lasting damage to your heart. So it all ended up very happily, but I had an interesting experience of watching the operating room work in the meantime. So that brings us to this bill. There are 128,900 surgical technologists employed nationwide, including 1,930 in Maryland. Surgical technologists are surgical team members that maintain the sterile surgical field, ensuring that members of the surgical team adhere to sterile technique to prevent surgical site infections. Certified surgical technologists serve as the surgeon's second in command, providing instruments and supplies to the surgeon, preventing patient death and harm relating to medication as well as infections and bleeding. Surgical technologists must operate effectively to prevent never events like medication errors, surgical implant errors, unintended retained surgical items, patient burns, and incorrect site surgery. Typically, surgical technologists must earn an associate degree from an accredited institution to practice. There are 7 accredited programs throughout the state, and the certification exam price ranges from $190 to $290. Nonetheless, surgical technologists are not regulated in most states, including in Maryland. Senate Bill 874 would require that surgical technologists graduate from an accredited educational program and pass the Certified Surgical Technologist exam, with exceptions for all currently employed surgical technologists and military-trained surgical technologists. Furthermore, surgical technologists who have graduated from an accredited program but are not yet certified have 18 months to obtain certification. Senate Bill 874 also stipulates that oversight is through the Department of Health to verify surgical technologist compliance upon request, requiring no change and minimal effort by hospitals and ambulatory surgery centers. The bill will not require a new licensing regime because healthcare facilities verify the surgical technologist, and apprenticeships can be used as the clinical experience in the credentialed education program. These surgical technologists are an integral part of our healthcare system, and we owe it to our residents to ensure that when they enter surgery, as I did last summer, they can be certain their entire team is properly trained. Now, I've noticed that I'm anticipating that there are going to be objections to this bill. So there can be opposition to the bill. I was on HGO for 4 years in the House. And when I was on HGO, when things like this happened, we always encouraged the people to sit down and try to work out their differences and then come back to the committee later on with an amendment which would bring everyone in consensus. And that's what I'm offering here today. You'll hear the opposition later on, but I'm willing to sit down with them, bring the proponents to the table, and try to work out amendments which are acceptable to all, which will bring this bill into consensus rather than the current disagreement. And thank you for your attention. I hope for ultimately a favorable committee report.
Madam Chair, members of the committee, my name is Dan Shattuck. I'm here today in support of Senate Bill 874 on behalf of the Association of Surgical Technologists. I want to thank Senator West, 1, for bringing forward this bill, and 2, for being here to bring forward this bill. That description of the operating room is insightful and valuable, because most of the time when we get a surgical procedure, we're under anesthesia and we're not seeing all that's going around. And I think that's the core of this bill, is the personnel involved in the surgical tech world. They have a big role to play. They're, as the senator said, the right hand individual for the surgeon. They're aware of everything that's going on in the course of the surgical continuum. They're there to make sure that the equipment, the materials are being used appropriately, taken care of, because often they're expensive medical devices. And going to the never event issue, making sure that all the instruments that are being used at the surgery, what goes into the body and what comes out of the body is supposed to come out, and make sure that there's nothing left behind. And that's an important risk management perspective and role that the surgical techs play. So I just want to comment on a couple things. The bill, we have some amendments that clarify the grandfathering provision that would ensure that everyone who's employed as a surgical tech now would continue to be employed, and we've extended the date out to 2026 to make sure that the current workforce is not impacted. And we also are extending the timeline in the bill that would allow a student who comes out of a program, they would have up to 2 years to get their certification. So the goal here is to elevate the workforce. We don't want to eliminate current workforce, but moving forward, we want to make sure that the best and brightest are in our operating rooms. Thank you.
Madam Chair, Barbara Brocato, also here on behalf of the Association of Surgical Technologists in support of Senate Bill 874. So, we're committed here to try and find a pathway to patient safety through credentialing, but that supports the workforce and patient safety. And I want to say that nobody knows better than this committee, than those of us that are all working on healthcare issues, the stresses in the system. Well, some of you may or may not have looked at an article in the Washington Post some months ago, I think it was in October, and it was sharing the kind of stresses that there is in the system, in the hospital system, that medical errors had tripled from 2019 to 2022, tripled. Now, we know there are workforce issues with the doctors, with the nurses, with surgical technologists, but this is a professional pathway, and we have a surgical team that needs to be working together and streamlined. I also want to share with you that the American College of Surgeons statement on surgical technology training and certification says, the American College of Surgeons strongly supports adequate education and training of all surgical technologists, supports the accreditation of all surgical technology education program, and supports examination for certification of all graduates of accredited surgical technology education programs. We don't have data, but our surgical technologists that tell us that when they talk to their surgeons say they really would like to have a certified technologist working with them. And with that, thank you for your time, and look forward to trying to work together with our friends in the hospital world to find a common ground here. Thank you.
Thank you. Do I have any questions for this panel? Senator Hayes.
Thank you, Madam Chair. Senator West, we served on HGO together, and my good friend Sue Krebs used to always say, is this a solution looking for a problem, right? Your testimony today was that you had a great experience. Everyone was great. It was wonderful, but it looked like you're looking to put more regulation or more qualifications on for these individuals to work. And it seems like they're the least, it sounds like, given all of the different occupations that's in the room, they're the least paid of all of those in the room. What is the problem that we're trying to solve here with the bill before?
Well, as you say, my experience was 100% positive. But my understanding is that there are other situations where people's experiences perhaps have not been 100% positive, and maybe Ms. Mercado can give you some information about that.
One person can answer a question.
What's that?
Yeah, only one person can answer a question. That's the chair's rules.
Okay.
All right, but I'll follow up with you. I'm just not sure. I'm just not sure what we're trying to solve here. But hopefully we get in other testimony, and I'll follow up with you.
Sure.
Thank you, sir.
Yeah. I think there's some virtual witnesses coming up later who are favorable, and maybe they could provide more detailed information to answer to your question. But thank you for the question.
Do I have any other questions? Any other senators? Thank you very much for your testimony. Next, we have 6 unfavorables: Andrea Hyatt, Kristen Bryce, Thomas Young, Grayson Wiggins, Devon Powell, and Pegeen Townsend. So you can all come up. And the person that sits closest to the podium is going to start. And we're going to go right down the line. So I'm going to try this again. Is Andrea Hyatt here? Thank you. I know Kristen Thomas. Grayson was here. Is Grayson Wiggins in the room? We're having trouble. Some people aren't hearing us call names, so I want to be really clear. Grayson was outside. Are you Devon?
Yes, ma'am.
Thank you, and Pegeen. So you can all start. We're going to look for Grayson. Thank you.
Okay, thank you, Madam Chair. Pegeen Townsend on behalf of the Maryland Hospital Association in opposition to Senate Bill 874. Surgical techs are the highest vacancy rate we are experiencing across all our job categories. It's about 18%. So this is really a critical issue for us. And I would note that there are multiple ways to enter this profession. So community colleges offer this, vocational schools, universities, hospitals grow your own programs, which are very successful, workforce intermediaries, such as what the EARN program funds, high schools. This gentleman went to a high school that had this program, the military, apprenticeship. So we're trying to meet people where they are for this. It's an entry-level job. Don't need to over professionalize it, but it also represents a pathway many times to higher paying and higher skilled jobs. So we don't want to interrupt what is working, and please don't make the problem worse by limiting the ways we can train these people to get into the profession. So for those reasons, we'd ask for an unfavorable.
Hello, everybody. I'm Davon Powell. I did the surgical tech program at Emerson Westside High School, which was partnered with the University of Maryland Medical Center. And the medical center trained us on the job. It would take multiple hours for me to tell you how much the program has done for me, but to sum it all very quickly and very briefly, it changed my life. Having the exposure to the medical field at 17 years old set me on a path that to this day still seems unreal. It showed me I had a passion for medicine, in which now I'm pursuing to be a surgeon. I graduate college this year and I apply to medical school this year as well. It's all due to this vocational program allowed me to join the workforce at an early age. Simply put, passing this bill will be ripping this opportunity from future Emerson students, and I would love to see them have the same opportunity that I have. And for those reasons, I'm greatly opposed to this bill.
Madam Chair, Madam Vice Chair, and committee members, thank you for the opportunity to present the following testimony. My name's Andrea Hyatt, and I'm the president of the Maryland Ambulatory Surgery Association. I'm here representing many of the 336 ambulatory surgery centers in Maryland that are members of our state association. I've worked in healthcare for 42 years, and I've directed ambulatory surgery centers for the last 34 years. I've had the distinct pleasure of employing and overseeing surgical techs in the critical role of OR teams at the centers that I have had direct oversight. This bill would prohibit ambulatory surgery centers and hospitals from hiring a surgical tech who has not been certified by the specific program mentioned in this bill, and would just create more roadblocks for the already existing shortage that Pegeen had mentioned. This has been the result of this very same bill that was passed in Oregon. This bill limits access to certification to only one particular certifying organization who's pushing the legislation and has financial ties to the Association of Surgical Technologists. And from technicians that I have hired that have this certification, they say that it's just created more undue expense for them. They promote that this is to protect patient safety, despite the fact that there are no safety concerns or reports of patient safety issues in this state without requirements of certification. I've had oversight for over 300,000 surgical procedures, and I've never had a patient safety issue related to a surgical tech. There are a lot of equivalent programs that were mentioned that expand the pool of available candidates through alternative training programs to an AA degree or through the military. During my last 34 years directing ASCs, I've worked with and I've had oversight for dozens of surgical techs, many of them not certified at all, some certified through MBS TSA and some through NCCT. I can tell you that there's no difference in the skill level. And I'm thrilled that the person that testified earlier had a great experience, but I can tell you, he doesn't know whether that surgical tech was certified or not. I hope that this warrants an unfavorable report on this bill. Thank you very much.
Good afternoon, Madam Chair, Madam Vice Chair, members of the Finance Committee. For the record, Kristen Bryce with the University of Maryland Medical System. Here today with my colleague, Davon Powell, who's been with the University of Maryland Medical Center for 5 years. And as you just heard, he has been able to advance both his professional skills and formal education while earning the salary that makes all of that possible. I know that this committee is all too familiar with the staffing crisis in healthcare, and I would be remiss if I didn't thank the members for keeping an eye to this as you consider various health policy initiatives. This bill risks exacerbating the healthcare crisis, but more importantly, it could cut off a pathway to employment and an opportunity for a career in healthcare. If there's a silver lining to the staffing crisis that plagues so many industries and businesses in the state and the nation, it is the opportunity to expand employment pipelines so that we are capturing talent regardless of resume. The Search Tech program at Edmondson High School is one of those pipeline expansion tools, and you can see the result for yourselves. Hospital leaders often note that healthcare is one of the few industries still able to offer a pathway to the middle class. It's a true statement, but it doesn't happen automatically. It requires thoughtful and deliberate policies to support potential entry-level talent within our organizations. Potential and entry-level talent within our organizations. I ask the committee to take this into account as you deliberate on SB 874, and I request an unfavorable report. Thank you for your time and your consideration.
Thank you. I understand Mr. Wiggins is in JPR testifying. Is Thomas Young here? Okay, I just want to check one more time. Do I have any questions for this panel? Devon, I want to congratulate you and thank you for sharing your story. And
thank you.
We're trying to do more programs like what you did, wraparound services and help people continue to get education in the medical field. So I really appreciate that you told your story.
No problem. Thank you.
So no other questions for this panel. I do have a couple virtuals. Josephine Calici.
Kalachi. And Madam Chair, would it be okay if you took Charmaine before me?
Is Charmaine on? Charmaine, would you like to start? Thank you.
Sure. Can you hear me okay?
Yes.
Great. Greetings, Madam Chair and all Finance Committee members. My name is Charmaine Miller, and I work at the Community College of Baltimore County as an instructor and clinical coordinator. I also serve as the president of the Maryland and Delaware State Assembly for Surgical Technologists, and I am in full support of Senate Bill 0874. I cannot stress enough the critical role surgical techs play in surgical patient care. Our hands are in and touch patients' bodies, manipulating tissue and keeping it safe. Surgical technologists prepare and mix medications, prepare specimens, make sure all equipment and instruments are available, functioning safely, and are sterile. Placed correctly in surgeons' hands when needed and without delay, because every second counts. The many skills performed by surgical techs require a level of education in math, anatomy and physiology, microbiology, and a deep dive into the many practices, principles, and skills required to deliver quality surgical care. On-the-job training may have been okay years ago, but surgeries have and continue to grow in complexity, and having a statewide standard in educational requirements is more vital than ever. Surgical techs are healthcare practitioners, not entry-level workers. I cannot stress this enough. The skills and knowledge needed to deliver safe patient care requires an educational foundation that needs to be maintained and updated. Certified surgical technologists are required to stay abreast of the many changes and updates in healthcare by completing continuing educational credits and participating in conferences and workshops. Allowing people with only a high school certificate with no formal standardization training to deliver patient care takes advantage of the vulnerable patients unaware of the role STs play in their care. And that fact is truly unethical at its core. The quality of our profession is declining, and this is well-known in Maryland ORs. I've spoken with numerous surgeons who share these concerns, yet many hesitate to speak out formally due to fear of retaliation, as they acknowledge hospital administration doesn't want to pay for quality. As a clinical coordinator for surgical technology, I have personally witnessed during my many visits an alarming rise in errors caused by untrained individuals masquerading as surgical techs. And I want more for you and for me. Thank you.
Thank you, Charmaine. Josephine, you want to go now?
Yes, thank you, Madam Chair and Vice Chair of the Senate Finance Committee. My name is Josephine Kalachi, and I'm the Senior Director of Government Affairs for the Association of Surgical Technologists, and we are supporting Senate Bill 874. AST has nearly 55,000 members nationwide with 626 members in Maryland. I'm going to keep my testimony short, but I want to address a couple things that were said earlier today. I want to make it clear that the Association of Surgical Technologists does not own the Certified Surgical Technologist credential. That credential is owned by the National Board of Surgical Technology and Surgical Assisting. However, we do support the education program requirement along with the certification because we believe, as Charmaine stated earlier, that is not over professionalizing this profession. They are standing over a patient in an OR next to the surgeon with their hands in patients. And thank you so much for the opportunity to testify this morning and support, or this afternoon, in support of Senate Bill 874.
Thank you. Do I have any questions for these witnesses? I see no questions. Thank you for your testimony. We have one more unfavorable, Dana Van Lays.
Hello, good afternoon. Thank you, Madam Chair and Vice Chair and members of this committee for the opportunity to comment today. For the record, I'm Dana Van Lays, SVP of Government Affairs at the National Center for Competency Testing, and we oppose Senate Bill 874. Senator West, thanks to your Chief of Staff for meeting with me to hear our concerns and explanations of how this bill will have unintended consequences for Maryland. And I'd love to be part of those conversations going forward to rectify some of this language. We've already heard it's not good to compound existing staffing shortages by creating more roadblocks for employers to recruit and adequately staff their operating rooms. And there's language in this bill, and some of it's subtle, that creates even more barriers to entry for the surgical technology field, again, by forcing that associate's degree level training when it is not necessary or required to do the job. And many fully qualified and competent surgical techs in today's workforce in Maryland have been successfully, safely, and competently performing their duties without a dictated path to how they learned their skills. And there is no basis or evidence to support the need for standardized training. I just want to clarify, they did mention earlier that some of those apprenticeships, they get their surgical scrubs in those apprenticeships, but the apprenticeship programs they were talking about still have to be associated with an associate's degree bearing accredited program, whereas there are other U.S. Department of Labor standalone and hospital-based programs that will never be able to gain this accreditation that they're talking about, because all that accreditation, there's only 2 accreditors and they require an associate's degree and the use of AST's specific curriculum. So they don't even allow other teaching mechanisms. So there are also DEI obstacles to providing care in rural and underserved communities. Again, look at Oregon and restraint of trade as well. So I just want to say Maryland would be better served by leaving those employment decisions in the hands of those hiring facilities and not legislating this. So I don't think you want to make it worse. Happy to work with anybody on fixing this bill if it does go forward, but we ask you to not pursue it at all in the best interest of Maryland. Thanks so much for your time.
Thank you. Do I have any questions for Dana? I don't see any questions. Thank you.
Thank you.
That ends the hearing for Senate Bill 874. Next, we'll have Senator West back for Senate Bill 399.
Once again, Madam Chair, thank you very much for introducing me. I'm here to present Senate Bill 399. This is a straightforward bill which merely reestablishes the longtime cannabis advertising laws that were in place for the medical cannabis industry for a number of years, but only in the area of public signage. Prior to the passage of the adult use legislation last year, Maryland authorized medical marijuana dispensaries to advertise their business on signs. There were sensible exceptions prohibiting signage within a reasonable proximity of schools, or childcare centers, or playgrounds, or libraries, and the like. Under that statutory regime, things like billboards and event sponsorships were commonplace, as long as those advertising vehicles were compliant with commission regulations. And the commission was entirely capable of issuing intelligently phrased regulations to make sure that the advertising was appropriate under the circumstances. Throughout the years in which medical cannabis was legal in Maryland, the advertising laws existed and were complied with by the state's dispensaries without any significant issue that I'm aware of. In fact, I don't require legislation ever being filed by any legislators during those years seeking to roll back the existing system of advertising. I may have missed a bill, but I don't think so. I don't even recall reading letters to the editor complaining about cannabis advertising during those years. Yet last year, in the Cannabis Omnibus Bill, we opted to completely prohibit such advertising. Not being a member of the Finance Committee, I'm not aware of who pressed for such a prohibition or why the prohibition was sought, but it made its way into the final omnibus bill that we had enacted and that the governor signed. Senate Bill 399 represents an attempt to revisit the issue of cannabis advertising, but only in a very modest way. First, there are lots of cannabis firms in Maryland, which from the earliest days of the medical cannabis program engaged in the laudatory, public-spirited sponsorship of events and activities of the state's nonprofit institutions. 5K races, sporting events, annual fundraisers, all of these sorts of activities put on by nonprofit organizations were sponsored by cannabis firms. Generally, the nonprofits promote these activities and events by circulating a sponsorship information form, showing that the nonprofit in question is supported by major donors and institutions. The sponsorship materials always feature the logos of the sponsors. This practice continued until after the passage of last year's bill. Then the commission began to discipline the state's cannabis dispensaries for permitting their logos to be used on such sponsorship materials. This makes no sense. We should encourage our cannabis firms to become valued members of our communities by encouraging them to sponsor the events and activities of our nonprofit institutions. We shouldn't have a statutory regime that penalizes them for being public-spirited members of the community. In this regard, the commission is certainly able to promulgate regulations as necessary to ensure that any such use of logos is legitimate and does not target minors. But a blanket prohibition on the use of logos strikes me as overly draconian, counterintuitive, and even stigma-driven. If the use of logos during the medical cannabis era ever resulted in a problem, I haven't heard of it. While more prominent than logos on sponsorship materials, the use of billboards erected in commercial districts and nowhere close to schools or playgrounds or libraries is similarly hard to understand. Again, has any particular problem with the billboards during the medical cannabis era ever been identified? The blanket prohibition on these billboards strikes me as a solution in search of a problem. Let me offer two reasons why the billboard prohibition should be revisited. First, there are genuine First Amendment problems with blanket prohibitions on commercial advertising. The Attorney General addressed this concern in a letter written last spring, which concluded as follows. Quote, "The ban on outdoor advertising raises First Amendment issues, but in my view is not clearly unconstitutional." Close quotes. I don't think I've ever read a sentence that more damns something with faint praise than that. Beyond the constitutional issue, however, the existing prohibition on this type of advertising will harm social equity applicants whenever those licenses are awarded. Imagine having zero market share, becoming a market entrant after other businesses had a lengthy head start, and then attempting to break into an industry as complex as cannabis, and to do so without the ability to advertise like any other businesses. Being able to put signs up or sponsor events is an essential form of marketing and a way to build name brand recognition when other forms of advertising are severely curtailed. We are in effect setting up these social equity applicants for failure by not allowing them to get their name out and about and let people know that they even exist, much less what services they provide. So for these two reasons, I've introduced Senate Bill 399. It's easy to read. It's very short. It would permit logos to be used in the future as well as billboards in appropriate locations as regulated by the Cannabis Commission. I appreciate the committee's consideration of this bill and will be happy to answer any questions the committee might have.
Do I have any questions for Senator Kramer?
Thank you, Madam Chair, and good to see you, Senator West.
And nice to be here.
You inquired as to who or how it came to pass that this issue of billboards became problematic, and I'm happy to just point right here at this member of the committee who just as we have concerns with tobacco products and their marketing, concerns about alcohol and alcohol marketing, there were equivalent concerns about cannabis and cannabis marketing. All of these fall into the category of legal drugs, and therefore we do treat them differently than other products that you might find at the retail level. And so I get what you're saying about utilizing these logos, that maybe there's a conversation to be had with the Cannabis Commission about it, and if in fact they are enforcing this, and if so, how they're enforcing it, and engage with them. I think perhaps that does go beyond the will of the legislature in ensuring that again, with these legal drugs, we're very cautious as to how we advertise and market to the public, particularly with concerns to our youth. And we just had a bill hearing shortly ago to update and modernize tobacco sales in the state with a primary goal of minimizing access by youth or enticing youth. And I think that is a reflection of the limitations that were put in place with regard to cannabis. Just the recognition that it is a legal product, but it's also a drug, and concerns about ensuring that we do everything we can to prevent and minimize enticing our youth into, using these products that are legal drugs. And so that is the catalyst behind the issue with the advertising and on signage advertising.
I appreciate all that. In our committee, when a statement like that is finished, normally the speaker says, "Isn't it so?" Yes.
I think that was pretty much understood.
Yes, that's right. That's great. I do reiterate my concern. However, we're going to create a lot of social equity dispensaries across the state. And if we are precluding them from getting their name out and about in any way, and you have lots of existing dispensaries which people are now used to using, I think we're setting the social equity dispensaries up for failure if we prohibit them from in any way letting people know that they exist. And that's what the current law does.
Yeah, I would disagree with you in that statement that we're prohibiting letting anybody know in any way that they exist. I think we are just being very thoughtful and practical in, again, addressing and expressing concerns about enticing youth and marketing, and that's nothing new.
Totally concur in
We've
your
been doing
concern about that
for decades on other legal drugs, and this just falls into that same category. But I appreciate your concern. So
appreciate your concern too. Thank you.
Thank you, Madam Chair.
Do I have any other questions for the sponsor? I don't see any. Thank you, Senator West. We have another favorable area plot.
Should I just stay here?
Sure. You can stay as long as you like, Senator. We're happy to have
I
you.
don't want to outstay my welcome.
Good afternoon, Madam Chair, members of the committee. My name is Ari Plout. I'm here in support of Senate Bill 399. Thank you, Senator West. Here on behalf of Clear Channel. We're a billboard company. As Senator West did a great job explaining what this bill does and the history of it. The comprehensive cannabis bill passed last year. It removed our ability to advertise medical cannabis on billboards. Prior to this change, our clients advertised on billboards medical cannabis, which was allowed for, I believe it was around 7 years. This bill, Senate Bill 399, will allow advertisements on billboards with some restrictions, such as Senator West explained, not within 500 feet of a school, playground, a substance abuse center, et cetera. Clear Channel, we're extremely cautious. We're very mindful when we run these types of advertising in terms of image restrictions and placement. We have a number of checks and balances in place to ensure compliance. We've never had any citations. The prior law, when medical cannabis ads were allowed, they were restrictive. You had to put a disclaimer on medical claims supported by data. Moving on. So we believe that this bill is a fair balance between allowing to sell cannabis products. This bill is fair balance between, preventing youth exposure to allowing a business to advertise a medical product. And the bill allows for an advisory opinion on whether this is compliant. And we asked for a favorable report and Senator Kramer just would say this should address some concerns because we think it should at least allow for some medical advertisements. So with that, we'd ask for a favorable report. Thank you.
Thank you. Do I have any questions for this witness? I don't see any questions, Ari. Thank you.
Thank you.
We have one unfavorable, Matthew Swinburne. Or Swinburne, I'm not sure. Swinburne, thank you.
Madam Chair, committee members, my name is Matthew Swinburne. I'm the Managing Director of the Legal Resource Center for Public Health Policy. And I'm here today in opposition of Senate Bill 399 because it unnecessarily risks Maryland's children by repealing the current outdoor advertising restrictions. The First Amendment doesn't require the harms proposed by Senate Bill 399. This is the type of advertising. Advertising is a form of commercial speech, which is evaluated under what's known as the Central Hudson test. And this analysis has 4 elements. To receive First Amendment protections, the advertisement has to deal with lawful activity. Cannabis is still illegal at the federal level. And several courts, when they've analyzed advertising restrictions, have upheld them on this issue alone. However, if a court were to deem cannabis sales a lawful activity for the purposes of Central Hudson, Maryland's current restrictions are still permissible because they're in compliance with the 3 remaining elements. 1, Maryland has a substantial interest in protecting the health of their children. 2, the current restrictions directly advance that interest. Research shows that children frequently exposed to billboards are 7 times as likely to use cannabis. And 3, finally, these restrictions are narrowly tailored to that governmental interest. Maryland's cannabis industry has ample opportunity to advertise their products. This is evidenced by the fact that the industry made $800 million in sales last year. Now, I've provided a deep analysis of the First Amendment issues involved with this type of advertising in my written testimony, but I just want to emphasize the First Amendment does not necessitate the risks that Senate Bill 399 proposes. Thank you.
Thank you. Do I have any questions for this witness? I see no questions. Thank you for your testimony and your information. That ends the hearing on Senate Bill 399. And next we will go to, is Senator Hedelman here? There she is. We'll go to Senate Bill 952. bringing up a panel?
Yes, please.
Actually, there's 7 of you, so somebody's going to stand up at the podium.
Actually,
So
I will do that.
you'll do that. Okay, so I have,
Yep.
and people, as you sit down, the person that's closest to the podium is going to start.
Oh,
Jennifer
first is-
Crawley, Stevan Ellis, Paula Sotar, Patrick Mish, Catherine Renaud, and Paula Diamond. Come on, let's find a seat.
Thank you very much, Madam Chair, Madam Vice Chair. In the interest of time, we will get started. Thank you very much, members of the Finance Committee. My name is Shelley Heddleman, Senator from District 11 in Baltimore County, and I'm very pleased to be here today to talk with you about assisted living refers. This is a new industry, and it is a bit of the Wild West. In my written testimony, you have some data about, and I think we all know this from our constituents and from ourselves, we're all growing older, and we all have, hopefully, and we all have constituents who are growing older, and we have a larger and larger percentage of the population that is aging. And in fact, the Census Bureau estimates that 22% of Maryland's population will be 60 and older by the year 2030. We have asked our Department of Aging and others to look at this and to plan. One of the ways that we accommodate aging is we look for alternative living arrangements, right? Senior living communities that can provide the supports that we might need, both in terms of socialization, both in terms of healthcare and other things that we might need to age gracefully. There's an industry out there, and they are assisted living refers. And I would argue that we do not have very many guidelines about how this industry should operate. A couple of years ago in 2020, I had legislation and we passed a bill, this committee passed a bill that created, that ensured that assisted living refers only referred to licensed senior living communities, right? We want to make sure we want to have a floor of standards by which we judge this business so that there's safety, so that there's transparency, and so that they are adhering to the rules that we have set up through our Department of Health. Secondly, in that legislation, we also wanted to make sure that refers were not only referring to those businesses with whom they have a financial relationship. And you will hear from the panel who's going to be opposed to this bill that people in the community, our constituents, do not pay them directly. That is 100% true. They have an arrangement with these senior living communities. That is how their business model works. If I need someplace for my mom who was in the hospital and all of a sudden can't live independently, I might, like any one of us, go online in a panic, right? We're kind of operating in crisis mode. Mom can't live independently anymore and need to go on the computer, and I search and I want to know what are the resources in my own community that can help make the transition for my mom into the community, out of the hospital, out of medical care, and have her get the supports and the assistance and that she needs, right? So I might go online and I might search for senior living communities. And one of these companies might be out there and they certain tag words, and I don't know how all the algorithms work, but companies will come up and I might click on it and say, okay, this is one spot where I can go and they can tell me who in the world can provide these services near my home, right? They will ask me a series of questions. What are the limitations of my mom? The healthcare, where is it, where is it in the community that I want her to live? What kinds of supports does she need? What can she do independently? What does she need help with? And ask me a series of questions. Again, they're not asking personal information quite yet, although they are asking about healthcare. What are the activities of daily living that they are capable of? Do they need a walker? Do they need a cane? A wheelchair, etc. So you're starting to get into more personal information about them. Then they ask for your name. And they also say there are terms of use, and there's a privacy policy. And they are long. I went through some of them recently, and I have about a dozen screenshots of this very lengthy, as you can imagine, very legal
stipulation setting out what you, when you're putting in your name and when you're clicking, what you're agreeing to. Just a couple things. You're agreeing to them being able to sell that information that you have provided to third parties or the parties that they work with. You are basically agreeing to no privacy. And I hope that the data privacy bill that this committee is working so diligently on will actually help to provide some measure of protection to that sensitive information. But right now, it doesn't exist. You are agreeing to a lot of things. You're agreeing to robocalls. You're agreeing to a whole set of things by clicking on, because again, you're in this sort of turmoil and a panic, and you're looking to find a safe place for your loved one. So what this bill does is it creates some guardrails for this industry. And I want to talk, as you have some amendments, it mandates that the people who work in it have criminal background checks in their employees, which seems very reasonable to me. It mandates that there's transparency in this contractual relationship between the referrer and the client. So if you're clicking, you know what the agreement is. You know that they're being paid X fee by X community, right? That you know that they have general liability insurance. Now, there's some questions I know about HIPAA requirements, and I would love some clarification from this committee and their legal expertise. But it seems to me if one is sharing personal healthcare information with a company, there should be some confidentiality there. I don't want that information to be shared with whomever they're going to sell it to or share it with. Finally, there is something in there about a database at the end of the bill. We took that out. OHCQ has been wonderfully responsive to our concerns. We want folks to be able to go on the health department's website to be able to search, which you can do. As of March 1, they have now a very user-friendly, searchable database spreadsheet where you can type in your zip code and find out where to go. And finally, we want there to be some kind of limitation on this relationship, that you have with them. And we think they should be able to collect their fee. I mean, it's somewhat arbitrary, but within a certain set time period, and we happen to put that as 1 year. So that is what the bill does in a nutshell. I just feel like it is the Wild West right now. There are a number of states, and we call it NCSL. We have a number of states who have done this, put some of these guardrails up. This is a big business. It is only growing more and more. In some parts of the world, it's a big business. You're going to hear from some of the small business people, some of whom are in my district here, who are going to talk about the kind of services that they provide to their clients. Finally, I did not mention there's a part of the bill that talks about tours. We are amending that out. We think people should just be able to show up anywhere unannounced, and that is the best way to really, for them to learn what it's really like there on a day-to-day basis. So we took that out. We don't want that to be a burden on the referrers. So I'm happy to answer any questions. I'm happy to turn it over to the experts on this panel. And I just thank you very much for your time and attention to this important issue.
We'll take questions after we get through your panel.
Terrific. Thank you.
Good afternoon. Thank you, Chair Beidel and Vice Chair Klossmeyer and members of the committee. I'm Jenna Crawley. I'm the Deputy Secretary for the Department of Aging, and I'm pleased to be here in support of Senate Bill 952. I thank Senator Hittleman for her leadership on this bill. You have our written testimony, so I'm just going to make a couple of key points. As Senator Hittleman stated, Maryland is getting older and getting older fast. In response to these demographic shifts, the Department of Aging recently had an executive order signed by Governor Moore launching the Longevity Ready Maryland Initiative, a multi-sector planning effort to help us be more ready for the opportunities and challenges ahead. Access to assisted living and a well-regulated community of assisted living referral service providers are important components of Maryland's long-term care services and supports, which we need to be strong in order to be longevity ready. These services are already regulated by the state's Office of Healthcare Quality. This bill just enacts additional common sense guardrails, as previously stated, to how they can operate in Maryland. Things like requiring general liability insurance, a criminal history records check, and limiting the time where an assisted living referrer may request the referral fee up to a year. These additional requirements will give additional useful protection to older Marylanders, their families, and friends who are looking to help them look for assisted living options. Again, we thank Senator Hedelman for bringing this thoughtful bill forward and urge a favorable report.
Hi, my name is Savannah Ellis. I'm the State Long-Term Care Ombudsman. I'd like to appreciate the chair, the vice chair, and the members of this committee, and I'm asking for a favorable report on this bill with the amendments that Senator Hedelman suggested. The Ombudsman program provides advocacy for nursing home and assisted living residents in Maryland. And it's very important to when you're considering an assisted living facility, the resident, family, and their support system should be fully informed about all options available. When working with an assisted living referrer, the assisted living referrer should provide that information. When someone is looking for a facility is often a very stressful time. And personally, I've been through this with my mother. Their loved one may be in a hospital or need more care than what can be provided at home. If a person decides to work with an assisted living referrer, there needs to be safeguards in place to protect that consumer. So I appreciate the criminal background checks, the HIPAA protections, and the transparency and the contract that's available. It's critical that this happens, that the contracts are clear and transferable. Or transparent, sorry. The long-term care ombudsman educates the public and provides information about how to choose an assisted living facility. And it's important for the individual to make an informed decision about the facility and whenever possible to visit the facility. So I appreciate those amendments. My final suggestion is that I strongly urge for this committee to support this bill and with the amendments that Senator Hedelman suggested. Thank you so much for your time.
Thank you. Thank you, Madam Chair. My name is Paula Sotier. I've been the owner of Care Patrol Baltimore for 10 years. I thought I would just level set as to what referral placement companies are. So basically, they're very similar to real estate agents in that they're local and online agents that get paid for selling a house. Well, the assisted living industry is the same. We have local and we have online, what we call advisors, and they get paid by the assisted living to place that client. All of the placement companies have contracts with the assisted living so that we know what specific payment we're going to get. Now, I'm not here saying that it is as easy as selling a house as placing a client. One of the things we need to do is we have to find out what the healthcare needs are for the client. Our goal is to find safe living options. As we've talked about, the Office of Healthcare Quality actually does produce or publish a monthly list of who's licensed. We need to make sure that all of our clients only go to licensed assisted livings. But we also need to know the care capabilities of all the assisted livings that we refer, so that once we know the healthcare information, we make sure that they can take care of that client today and in the future. Placement services are needed, as we've just talked about. There's so many expanding senior population. The real goal of this bill is to raise the level of professionalism for this industry to protect seniors seeking placement. At the present time, we have 114 referral placement companies. That has more than doubled in the last 2 years. We are asking to support this bill. All placement companies should maintain liability, and all employees of placement companies should have the criminal background check. We need to protect our Maryland seniors. Thank you.
Thank you, Madam Chair. My name is Patrick Mish. I'm the CEO and co-founder of Silverstay. We're an assisted living placement agency. Assisted living is an essential solution to meeting our country's rapidly increasing need for sophisticated long-term care for medically, financially, and socially vulnerable individuals. The population of 65-plus-year-old individuals is growing 5 times the rate of the total U.S. population. This demographic is experiencing homelessness and medical complexity at high rates, leading to packed emergency rooms and very high length of stay in hospitals. Assisted living placement agencies provide an essential linkage between these vulnerable individuals and high-performing, clinically, financially, and socially sophisticated assisted living communities. In order for this linkage to be made in a safe and efficient manner, placement agencies must have a nuanced understanding of the individual's clinical needs, and they must understand assisted living outcomes based on prior placed patients in those communities. As such, placement agencies should be obtaining clinical information on the individuals they're serving while utilizing a robust information security management program that ensures each individual or their proxy has signed a HIPAA authorization form. This is why at Silverstay, we hire licensed social workers to support our clients. We collect outcome data on assisted living facilities, and we've developed an extremely robust information security management process. Operating in this form allows our company to reliably and consistently support very vulnerable individuals across the state who are transitioning to assisted living. Completely in favor of this legislation, and clinically sophisticated placement agencies are essential to supporting our vulnerable Maryland residents.
Madam Chair, my name is Bonnie Renaud. I am the Assisted Living Manager and Director of Nursing of a 99-bed assisted living facility in Lutherville, Maryland that's been open since 1952. It is a family-owned, family-run business. I've been an RN and have been in this industry for 35 years personally. I agree with Patrick. We're seeing a much higher level of acuity or medical needs of clients at College Manor. We are a level 3 assisted living. We need to review much more medical information before accepting clients because they may be skilled clients rather than assisted living clients. Placement companies that receive permission from the seniors or their families to access and review medical information can send us clients that they know we can accept and take care of. It saves the senior, the family, and us the energy of going through communities that can take care of them. And I've learned that not every placement agency company is the same. We've signed contracts with many different kinds of placement companies, and I'm confident that the ones that we've stayed with are doing the right thing for their clients. We've worked with companies that you may have seen on TV who for us are nothing more than a database, a list to be on. They consider that they are contracted to any client and if that client supplies them with their email address or in an inquiry, they command a hefty fee, usually 80% of the first month's rent for coming into a facility. They consider that they're contracted to any client if that client, the placement company, however, earns their fee by a personal relationship, helping with the process with the client or as responsible parties and facility. There's so much more skill to this process than just providing a list. I support and in favor of this bill to help clients in their communities promote transparency with those who are working during this process. Oh, I'm sorry. Yeah.
Good afternoon, everyone. My name is Paula Diamond, and I actually just went through this entire process of getting my mom through the process of getting into an assisted living. So my testimony is a bit different than others in that I am under a month, so we're 3 weeks in. I was first referred by the hospital rehabilitation social worker to a placement company to start this very process. As background, my mom is 98, feisty, fiery little lady, 4'7", and the most difficult part is that she's also a Holocaust survivor, so she's pretty damaged to start with, but feisty. Her overall mental and physical health has declined over the last couple of years. So this second bout of COVID pneumonia really did her in. And as a result, we really needed to help find her the right placement that would be safe and a good community. And also very difficult is to get her to agree that she would move out of her independent apartment. So we're in rehab, hospital, and I'm panicked. To say the least, I was overwhelmed and exhausted, and I truly welcome the help of the placement company who did everything right, A++. Here are some of the things that they did for me, for my mom, and moved us along. They received permission to review the medical records and files to complete also an in-person assessment, which was huge, right in her rehabilitation center. I met with the placement company and the social worker afterwards so I could understand my mom's competency to be able to make a decision on her own. All 4 communities were identified and appropriate for my mom's level of care. I toured the facilities with the placement company as well, and I chose one community that was the best fit. Great news, my mom is happier than she's ever been, and my comment to everybody here from a personal level is I support Bill 952, the placement, my process, everything. There was so much hand-holding, and it meant all the difference in the world to me and to our family. Thank you.
Thank you. Senator Washington.
Thank you, Madam Chair, and I'm glad your mom is great and in a great facility. Great story, by the way. You seem like you had a really great experience.
I did.
Can somebody else tell me what's a bad experience look like then? Yeah, just give me. I just want an example of a bad experience from one of these folks.
So we have had placement agencies that have business connections with assisted livings that are licensed, who also have unlicensed assisted living facilities. And it's illegal to have an unlicensed living facility. And then they move them into that setting and the staff aren't qualified. They're not well trained. And often the folks that end up in this situation are people that don't have the support system like the woman that just spoke to us. So I'm very concerned about, and I placement agency is the same as assisted living referrer. So forgive that's the old term, placement agency. But my concern is I want to make sure that assisted living referrers are doing the right thing. And I think that these additional protections will help with that. In addition to the fact the law that Senator Hedelman referenced earlier, the earlier law, that's actually added some extra protections as well. So that's a bad case scenario.
Okay, and you're the ombudsman,
Yes,
right?
yes, sir, that's correct.
Yes, okay. And just one quick follow-up, sorry, Madam Chair. You're the ombudsman, so what would this bill do to prevent that illegal activity from the person, the referral being illegal, meaning they don't have a license, and then the facility also being illegal and they didn't have a license? How does bill prevent that from happening?
Well, hopefully, the transparency contract would help minimize that. The criminal background check might help minimize that, because if somebody has a criminal background check and the assisted living referrer finds that out, or that might help. It may not prevent all of those things from happening. But I think any protections will make the chance of that happening less. That's my hope from this. And that's why I wanted to testify on this. I wanted to make sure. I also, again, I'm very supportive of taking those tours out, because I worry about somebody in crisis being directed by somebody who has their own interests in mind and not the consumer's interests in mind. So yeah, and also we want as a program people to reach out to us as well to get more information about how to choose assisted livings. And so I'm glad that there's also more transparency, and that assisted living referrers are supposed to provide all information, not just the companies they have contracts with.
Got it. Thank you.
Senator Hedelman, are you still here?
I am.
You might want to come back up to the podium in case there's a question for you, because I have a few more questions. Senator Guile.
Thank you, Madam Chair. I actually do have a question for Senator Hedelman. So, Senator, you mentioned some of the things that you were cutting out from this bill. Could you go through those again of what you're removing from the bill?
Sure. One was the tours that was just mentioned, and that the other was the database, because we don't need it anymore because OHCQ has provided what it was that we wanted. And that is it.
Okay. What about the prohibition of referrers requesting payment for referrals made more than 1 year? You're keeping that part in? Okay.
And we think part of that is there seems to, there's a potential incentive there to get somebody in to a place that meets their needs now, and then, or maybe falls a little bit short, and then move them on to another place so as to be able to collect another fee.
Mm-hmm.
So we think a time period makes sense, right? Because every new community is a new arrangement with the referrer. And so we think it should be time limited.
But I'm sorry, Madam Chair, just one follow-up to that. But what if like it just takes a little while for somebody to make the decision, like if the parent is in like, like a rehab setting or, sometimes it just takes a while to like, convince the parent in order to move out. Like I just, wonder then are they just not supposed to continue helping them? Like, well, how,
So, two things. One is, as I said, 1 year is somewhat arbitrary, but 1 year feels like a long time when you're talking about the needs of older adults and how quickly those needs can change. So it felt like a reasonable amount of time to me. Two is, I don't know that, and maybe somebody, Paula, could speak to this. I mean, generally it is the relationship to get somebody into the community and to assess what community is best for them. Beyond that, unless the person is reaching back out, are you staying in touch with them going forward?
No, we really don't. We stay in touch 1 month and 3 months just to make sure, to the point of Patrick, we want to make sure that our placement was a safe placement, but after that, we don't. So I do have people that may call me 2 years later, but the reason they're calling me is because their medical conditions have changed so much.
And there's a new need.
And there's a new lead. So that's where that comes.
Okay, thank you. Thank you, Madam Chair.
Senator Mounts.
Thank you, Madam Chair, and Senator Hedelman, thank you, because I have a couple questions also.
Sure.
And I was trying to, I was looking at the definition, assisted living referrer. It says if you make referrals to assisted living programs without cost to the person receiving referrals, that's the first component. And the second component is if you're compensated. So if anybody that makes a referral who is compensated, they are technically assisted living referrer, correct?
So correct, although there are some other specifications. If you look on page 2, or the first bottom of the first page and going on, you have to register with OHCQ. And the other requirements are there, lines 4 through 10.
But if you don't register, then you would still be able to make referrals and be compensated?
I would say probably not legally.
Right. So I was wondering, so in a lot of medical settings, so when you're seeing your doctor and the doctor says, look, it's time now, you need to make some pretty serious decisions, conditions are a certain level. We think you should go talk to so-and-so. And if the medical office has an arrangement with any of these facilities, would medical offices be covered?
So I haven't heard of that before. So I don't know the answer to that. I mean, it doesn't seem to me that they would, because they don't have a financial arrangement with wherever they're referring, right? And I mean, maybe people could speak to whether you have an arrangement with doctor's offices.
I have never seen a doctor's office do it.
They haven't in a long time.
No.
Okay.
That my referrals
Well,
used to be.
Whoa, one witness, I'll get me in trouble. And then I just, because on the Eastern Shore, we don't, I mean, the availability of care is
limited.
very different. It's very different. And I was just wondering who would be covered, because there's also a lot of individuals who just do home care.
Absolutely.
And they provide referrals as well as many of the doctors and even the staff in the doctor's offices. I just wanted to try to determine who is covered by this, because there are entities that hold themselves out as referral entities.
Yes.
And there's others who don't, but they have arrangements because people know people and they have, and they have friends.
And it's informal.
Right.
And I think honestly, a lot of this happens in the informal world.
Right.
That's why it is incredibly unregulated.
Right. And for well, that wraps up my questions. Thank you.
Thank you.
I was just rereading the bill, Senator, and I think we need to confirm the part where they're a referrer if they're taking a fee.
Right, that's not.
So like a social worker in a
not in there.
hospital gives you a list and refers, or like you said, a doctor's office, or, so I think we probably need an amendment to confirm that.
Right, that is not under the definition right now, Madam Chair.
Okay, thank you. Are there any other questions for this? Oh, I'm sorry, Senator Classmark.
Yeah, I just want to know and I heard it a couple times about the HIPAA, with the HIPAA forms and Savannah, I guess, Stevan, you had mentioned it and so did the gentleman mention it, one or the other. But what is the purpose of that?
Well, actually, I'll have the provider ask or answer the question first and then.
Okay, yeah, sure. So in our company, we work with a lot of individuals who are coming out of the health system, coming out of the hospital, they're coming out of a skilled nursing facility. And so we are getting access, we have to in order to make a good match with a highly qualified assisted living community. We are getting access to all of their medical records, not all their medical records, but a lot of their medical records. And to do that on our side, we have a BAA signed with that hospital system. We have to get authorization from that patient or their proxies to be able to access that information. And then we have to run our own process on our side around information security management. Does that answer your question?
Well, but that do the companies that are going out interviewing people, do they have to get the HIPAA sign?
Yeah, yes. So I
mean,
think
because now you have run a facility, correct? Or
she runs the facility. I run the referral.
Oh, okay.
What is the terminology?
Refer.
Assisted living referrer. Yes.
Okay.
Is that not clear?
Well, I guess it is, but I just think that I don't know if I am happy with it or not. I don't know.
I'm more than happy to help clarify.
No, because you are getting folks that are really, really sick at that point, right? No.
Well, really, arguably anyone who's going into assisted living, you're going to want to have a degree of understanding of their clinical needs. Okay. And to get that, sometimes we're looking at doctors, going to the doctor's office and getting the patient's doctor's files. Sometimes it's coming from the hospital, sometimes it's coming from the skilled nursing facility. So that PHI then needs to be protected, right? So we get a HIPAA authorization signed, which is a one-page document that HIPAA provides guidelines around how to create that. And most organizations that we're getting this from, all organizations really we have a BAA with a business associates agreement with that allows that transfer of that information to us and to maintain it and use it.
Okay. All right. I got it now. Thank you.
Thank you. I don't see any additional questions for this panel. Thank you all.
Thank you very much, Madam Chair.
Thank you. We do have one more favorable that didn't quite fit at the table, and that's Cornelia B Gordon. And while Cornelia's coming up, let's bring Dana Kaufman up. She's favorable with amendment.
Good afternoon again, Madam Chair, Vice Chair. Again, I'm Cornelia B Gordon, and I speak to you from Maryland Legal Aid. We provide free legal representation to many individuals who are seeking assisted living or access to healthcare. I think it's clear that the rules around assisted living facilities need to be tightened up. I can hear the questions that this committee's asking are very on point in terms of what's missing in many of the choices that my clients face. And I want to talk to you about a different resident or patient, not the one who's lucky enough to have her daughter seek and ask critical questions, but more likely to be the person who's coming out of the hospital who doesn't have those familial supports. And I hear the questions that you asked, what can go wrong? And a lot can go wrong because they may not end up in a place where they have the protections that this bill raises the professionalism of the industry. And we had a client that ended up in a place where he was very ill-treated and was subject to a bedbug infestation, as my written testimony says. So Maryland Legal Aid supports this bill. And I also want to state that we support the amendments because potential residents should be able to see a family, a facility as it is without special notice or advanced preparation, and observe, most importantly, existing staffing levels and how they're treating the residents and facility cleanliness. So Maryland Legal Aid urges the committee to issue a favorable report. with the amendments and passage of SB 962. Thank you.
Thank you for that testimony. I really worry about the people that don't have someone to advocate for them. It's really a difficult situation, but thank you for that. And thank you for your work.
And I've seen both. You know, I've had to put my own daughter in a nursing facility as a young person. Very, very difficult. Also, I see what my clients face and some of them who have nobody. And that's why we need this bill. Thank you.
Thank you very much. Dana, I'm going to try one more time. Is Dana Kaufman there? Well, we missed Dana's testimony for sure. We now have 7 unfavorables. I'm going to ask for 6 to sit at the table and 1 to stand at the podium. And the person at the podium is going to start. Frank Boston, Ari Plott, Jim Rosenthal, Mark Feinroth, Nana Boyer, Michelle McGovern, and Rachel Levy.
So Mark Feinroth and Ari Plott just signed up in case I wasn't here. So
okay, so I can cross out Mark.
And Ari Plott as well.
And Ari too. Thank you. And so
I think this is our panel right here.
Are you comfortable standing at the podium then, Frank?
I'm a lawyer.
I know that.
I am.
So you can start whenever you're ready.
Yeah. Madam Chair, members of the committee, I'm Frank Boston III. I'm here today on behalf of A Place for Mom and Caring.com, assistant living referrers that are national companies, and we respectfully oppose this bill. The great Senator Hettleman put in a bill 4 years ago that laid out a lot of rules and regulations that we are working under, and she explained those, and status quo is fine. I heard the proponent's testimony, and still I can't think of anything anybody said that justifies the need for the bill. This bill, you know, I'm later going to defer to my highly esteemed panel for their detailed testimonies and problems with the bill. But I will tell you that this bill is an attempt to regulate a freely competitive industry. We live in a time where people are online and that's where they do their searching. I get it. The people who testify are local referring companies, but sometimes you live in Chicago, sometimes you live in California, and you have parents that live in Maryland and you just can't get there right away, but you want to start the process. Companies like I represent serve that needs. This bill attempts to codify their business model that is totally unworkable and in some cases totally illegal for the clients that I represent. And with that, Madam Chair, we ask that this committee consider this bill unfavorable. One thing I do want to say is criminal background checks, of course, but we're the referring agency. We're not the facilities. Those facilities who are with those actual senior citizens, I would hope that they have criminal background checks in places when they're working with them. With that, we ask for unfavorable, and I'll stand for any questions, Madam Chair.
Thank you, Frank. I have a question. I have more people at this table than I called. So raise your hand. Nana Boyer?
Yep.
Michelle McGovern? Rachel Levy? So the first lady next to the podium, what's your name, please?
Lauren Ratcliffe.
You're not here. Did you sign up?
I did.
All right.
All right. Did you sign up on this bill?
I
My
believe I
esteemed
did.
partner helped us signed up.
Frank, it's your fault.
Of course.
All right, I'm gonna let you go, but we typically don't if you haven't signed up.
We spent about 20 minutes yesterday, 2 days trying to get
I
it
so
signed up.
appreciate that. So thank you very
Okay,
much.
so we're
We
gonna
like to
start
follow the
there,
rules
we're
at A
gonna go
Place for
down the
Mom.
row. Okay, thank you.
Thank you. Thank you so much for hearing from us. My name is Lauren Ratcliffe, and I'm a senior vice president at A Place for Mom. As a former caregiver to my maternal grandmother with early onset Alzheimer's, our companies exist to help and advocate for the 40 million unpaid caregivers in the United States who have not planned properly for that moment when mom and dad can no longer take care of themselves and it becomes no longer safe for their loved ones to age in place. There is a lot of confusion as to what our companies do. We are free education, referral, and resource companies with the mission of enabling caregivers to make the best decisions across the country and in the state of Maryland. In fact, last year, we helped over 10,000 families objectively evaluate their options in Maryland with a dozen local advisors living and working in the state of Maryland. We are here today because making a senior living decision for mom and dad is one of the most complex decisions made often in a time of crisis. And the components of this bill create unnecessary burden for caregivers that prevent them from moving forward and making the right decision, restricting choice. A Place for Mom and Caring today invest in recommendations and referrals, matching families to the right communities and resources based on care needs, financial needs, their desired location in a privacy compliant way. The people on this committee testified earlier how important the role of referral agencies are. What this bill does is make this unnecessarily complex for those in the state of Maryland, and my colleagues will explain legally as to why. I also want to leave you with is the number one thing we often hear from families who work with us is that they wish they found us sooner in the process. Thank you very much for the time today.
Madam Chair, Madam Vice Chair, committee members, I'm Jim Rosenthal, CEO of Caring.com. Thank you for the opportunity to speak to you. We oppose Senate Bill 952. I joined Caring 6 years ago, soon after losing my dad to Alzheimer's. I was that adult child that is often our client, with family members in multiple states, not smart enough to find Caring or a place for mom, and went to bed every night lacking the confidence that we knew all our options and we were making the right choice. When I found out about Caring, I immediately wanted to get involved, join the company, and I have dedicated my career to helping seniors and families at this time of incredible stress. You have our written testimony, which lays out our 5 objections, which we'll speak to. The amendments that were spoken of either eliminate 1 or 2 of those, leaving 3 or 4. Those we still object to, and none of those are mandates that we face in any other states, despite what you just heard. I want to speak a little bit also about, there's a lot of discussion about medical information and HIPAA. We don't want to know people's medical information. We're not medical experts. When they start to tell us it, we ask them, not to share it with us. When we talk about care needs, we care about activities of daily life, things like, can somebody bathe themselves? Can they dress themselves? Can they get in and out of bed? Can they feed themselves? Those are the things we concern ourselves. We don't know anything about the kinds of things that are on doctors' records or on electronic medical records. As it relates to the arbitrary 1-year deadline, our mission is to help as many seniors as we can and their families. We don't care how long it's going to take. If we have to invest the resources to help somebody over 2-3 years, we're going to do that. We don't go away after the first phone call, as it was intimated previously. We continue to nurture both the family as well as the communities to make sure there's a good fit and help people move into the right place. Thank you for the opportunity.
Good afternoon, Madam Chair, Vice Chair, and committee members, and thank you for the opportunity to testify. I'm Michelle McGovern, the General Counsel of A Place for Mom. This bill unfortunately creates roadblocks for facilities, referral agents, and families alike. Because I'm the lawyer, I'm going to deal with the boring lawyer, the boring lawyer parts, but they're really critically important. So as we discussed, this bill requires somebody to sign a federal HIPAA agreement. Now, there is no such thing as a federal HIPAA agreement. The Health Insurance Portability and Accountability Act applies to covered entities, insurance companies, and clearinghouses. None of these are assisted living facilities. It requires a business associate agreement with vendors of those facilities. We are not a vendor of those facilities, and we are not a vendor of the assisted living facilities that we refer to. So this is a legal impossibility. The government does not hand out HIPAA agreements. So this is not something you can legislate to. And it's not something that protects people because it doesn't exist. And we don't deal in PHI, protected health information, under HIPAA. To the extent that we are taking personal information, sensitive information, we are regulated by myriad state laws that we work incredibly hard to comply with. CCPA. We are rolling out our Washington My Health, My Data compliance this week because we have to be in compliance by the end of the month. We are regulated with respect to personal information and we comply with those regulations. In fact, the TCPA requirements, the phone calling, the auto dialing regulations that we were told were on our website, that's part of the federally required disclosures that folks need to protect their privacy. Privacy is absolutely critical to our companies. And when Maryland rolls out its privacy rules, we will be compliant with those as well. The other thing I just wanted to point out, the inherent inconsistency between a bill that purports to protect patient privacy and then requires the presence of a third party who that family may not want during a tour of a facility when the information discussed over hours only gets more personal, more intimate, and more clinically involved than the prior discussions. Thank you very much.
Good afternoon, Madam Chair, Madam Vice Chair, committee members, and again, thank you for the opportunity to testify in opposition to SB 952. My name is Nana Boyer. I'm the Associate General Counsel of A Place for Mom. I wanted to address a couple of things that came up during the prior discussion just to clear up some potential misunderstandings. And to echo what Frank had said, that the status quo works. Our process, our business model works to best serve Maryland families. One of the things that came up is that this bill would require referrals only to licensed facilities. Agencies like ours only refer to licensed facilities. And in fact, we have a person on our team whose entire job it is to audit those licenses and investigate complaints at facilities on a biannual basis. We also have customer reviews. We have people who specifically go into facilities to understand how well they operate, how quality services they provide. So those protections exist and they're in place. In addition, anybody on our staff who deals with seniors or families or any vulnerable population goes through a criminal background check. So again, those protections are in place to protect Maryland families. Finally, as Michelle mentioned, we don't ask our families to consent to robocalls. We provide them disclosures that they have the option to do so, but that is not a condition of providing our service. And we have a robust opt-out, do not call, unsubscribe processes in place. Finally, I wanted to briefly address Senator Giles' point as to why a 1-year limitation is appropriate on referral agencies receiving payment from facilities. And I heard something that was admittedly that time period is somewhat arbitrary. The standard by which we provide our services is not somewhat arbitrary, and it's not to force families into facilities. It's to help them make the best choice for them and their family. Thank you for your attention. And again, we ask for an unfavorable report on the bill.
Good afternoon, Madam Chairman, Chairwoman, and my name is Rachel Levy, and I am a social worker with 3 decades of senior living sales experience. And I have assisted thousands of families as they have navigated their senior living experience. And I'm here to oppose this bill. And in particular, the tour experience and having somebody on that tour experience with that family member. The senior living tour experience is a very intimate experience. You, as a senior living sales professional, I take at least 2 to 3 hours with a family member, really understanding what their needs are, understanding what they're looking for, meeting with that family member, that resident, introducing them to other people who are living in the community, having them introduced to other staff members, residents, family members that are living there. All of this takes time, and having a person who perhaps that family or resident doesn't want to have on that tour really is very intrusive. Also, about the year time limit, I would never give up talking to somebody who still is in need of a placement just because of a year time limit has gone by. If somebody is still in need of senior living, putting a time limit on it just doesn't make sense. Why would you give up trying to talk to somebody and help them through their journey navigating through senior living salesperson just because they haven't come to the conclusion of where they needed to go at that time? So I think that this bill has a lot of work that needs to be done, and it's just not right for families.
it dictates too much and it eliminates family members being able to make the best decisions for themselves and for their family members. Thank you so much for your time.
Senator Ellis.
Thank you, Madam Chair, and thank you all for being here. I would thank the sponsor for this bill, Senator Hillman, and the first lady who spoke, you're on the list. What's your name again, please? Lauren. Oh, Lauren. Okay.
It's just crashing it.
Yeah, so I'll direct my question to you, Lauren. It's a two-part question. So I hear your commercials all over. I mean, they're everywhere, you know, and you say, yeah, you're happy about that. Don't be too happy yet. So tell me why I should not be offended by the name of your company. As a son of a father who took care of me until he died and bossed me around until he died almost 90 years old, you know, why should I not be offended by that name? As basically, and as a father myself, you know, take care of my two kids who are adult now. Why should I not be offended by that name as basically telling us that fatherhood is discounted, it's not really important. And as father, basically, we are, how should I say, overlooked and undervalued. And my second part question is, give you time to think about it. You mentioned that your service is free, but all you're all paid by that company, right? And Mr. Frank Boston is paid, I would assume, or maybe correct me if I'm wrong. Well, you can't answer. But so how could you provide a free service and everyone gets paid and you have all that money for all the advertising? Where's that? How's that happen?
Thank you for the question.
Yeah, sure.
I very much appreciate your questions. And, you know, when you bring up your question, it's really, really important about the name of our company. We are a place for mom, a place for dad, a place for your mother-in-law, a place for your father-in-law, a place for your great uncle. In fact, if you look, and I'm happy to share with you.
I'm just talking about the name. I'm talking about the name.
All of our advertising, our most successful TV ad is A Place for Tom that tells a story exactly about what you're saying, which is that his dad, Tom, was going to go to a place down the street, and we worked with him and his son to find the right community. If you look at our advertising, we represent all the different maturations.
Well, I don't want to be rude to interrupt you, but we're limited in time. But I'm just talking about the name of the company, which is A Place for Mom, period,
Yes.
correct?
Yes.
That's the name. A Place for Mom. So why should I not be offended by that name? And it's basically a discounting fatherhood and an important role fathers
We
play.
certainly don't want anyone to be offended. So A Place for Mom and Dad and Uncle Bob is a really long way to explain what we do. And the way that the name of our company was created was to help consumers understand there are resources out there. And so our name specifically is one of our greatest assets because people get it. We provide that right place for your family members.
Okay. And the second part of my question.
Senator, I think your
about
point is well taken
Well,
about being a dad.
don't get me in trouble, Mr. Frank Boston.
But I'm going to send you that A Place for Tom ad and I want to know what you think.
I saw it, but the next part of the question about, you say all the service is free, but how do you all get paid?
So
to
it's
pay
really
salaries,
important.
advertising?
It's really important. I appreciate this question too, because we really want everyone to understand. In order to help as many caregivers in the state of Maryland and the entire country, it's really important that we're free to them. They can work with us. They can work with Caring. They can work with everybody. We just want them to get help. We are paid by the communities that we work with, but I want to be entirely clear, a portion of the first month's rent. And I want to be very clear that we don't care which community. We don't get paid more than certain communities than others. We just want caregivers to make the right decision and ultimately move in.
So you get paid by the placement of individuals who call you. Okay, got it. Thank
We
you.
do. And
Thank you so much.
we're not biased towards where they choose.
Thank you. Thank you.
Senator Guile.
Thank you, Madam Chair. Michelle. You were talking earlier about, the data privacy law that we just passed out of this committee and we'll be going to the floor soon. Obviously we care a lot about protecting personal data, people contact, for the service. do you sell the data that the people provide to you?
We do not, we do not sell data to third parties. So we
Okay.
do not downstream sell data. So we're not selling your data to a adult diaper company, insurer. That's not how our data flows. We have to provide data to make a referral. So the assisted living communities that you've identified as your top ones can contact you back. Arguably, that's a referral, not a sale, because state laws are drafted so broadly and because we believe that consumers have the right to understand that their data is moving, even though we say to them, when we make a referral, we say, we're going to send your information, your phone number to 4 places. Yes, no, like they all consent to that. And every state that has a written and oral, we have to follow up with an email. We comply with all the different requirements. But because we don't want to get into the business of saying, well, you should know the law and you should know that a sale means third party and, not a referral. We provide the most robust privacy and disclosure language that we can so that consumers understand that we are giving their data, even though they have called us to give their data to a community and for the community to pay us for it, for the placement, not for the data, for the placement.
Okay.
But we don't want there to be a question of hiding the ball or, oh, but I gave you my information. Oh, you get paid by the, so we have the robust privacy language, including sale language. So it's clear and unambiguous. And so people don't feel deceived because we're sharing less disclosure than is legally necessary. Does that make sense?
Yeah, I guess I'm looking at your website and it says, we may sell personal information to partners and other third parties.
We don't.
Oh, so
We
then
don't.
it's inaccurate on your website? Is that privacy disclosure? Or are you just trying to be a lawyer and cover all your bases just in case you do?
I think without being too weedy, we have nursinghomes.com as a site for ours. So home care is a perfect example. We have a home care business. That's our home care line might look distinct to an individual. You don't realize that it's a division of a place for mom. We say to people, you sounds like you're ready for home care versus assisted living. Can we share your information with our home care team? That's sharing it with a third party, an affiliate, a partner. Am I trying to be overbroad and legally? I guess you could say that. Or I know what our business model is. I don't want there to be a question of intent. And we're just trying to help families. It's within the A Place for Mom 4 walls, but the walls are bigger than folks realize. And do they need to know that sauce when they're talking to us on the phone? Or does it help me more to know that we've told them how the model works and that we're not selling their information to a truly unaffiliated what that's getting at is ad sales. We're not doing that. We're not selling it to a person who's targeting advertisements at them.
Okay. All right. Thank you very much. Thank you, Madam Chair.
Thank you. So I was looking at websites online too, and Mr. Rosenthal, I want to thank you. Your contract statement is very clear, and my question is not for you. I just want to congratulate you, and you clearly say 1 year. It's my understanding that A Place for Mom, your social worker referred to the fact that, oh, we don't want to ever give up helping someone. That's not the question. So let's say I contract with you and you help me find an assisted living. And after a year, my loved one, maybe 13 months later, my loved one needs to move from assisted living to long-term care. Are you going to take a fee when we move to long-term care because I once contracted with you one time 13 months ago?
You're not in contract with A Place for Mom. So that's the first. I'm sorry. You are not in contract with A Place for Mom. We do not require, and this is one of the issues with the bill. Families are free to work with A Place for Mom and Caring and 10 different local referral agencies so they can find the best place for them. They're not asked to sign it. It's a free service. They're not paying us for it.
No, it's not a free service.
To them it is.
You're being disingenuous when you say it's a free service.
It's free to the family.
It's free to the family, but it's not a free service.
It's a free service to you're saying, I'm sorry.
You're getting paid. You are getting paid.
100%.
You're just not getting paid by the family. But answer my question.
Your answer.
What happens if I don't contract or you don't help me right away, but 13 months later, you help me find a place because I talked to you and gave you information, but you didn't help me find a place. 13 months later now, wait a minute.
Yeah.
13 months later, I find a place. I move my dad in. Are you getting a fee because we first talked with you?
We only get fees when we have made a referral to a facility. And the agreements we have with them, freedom to contract, they may negotiate what they wish on the back end. We cannot disclose every single individual's terms and life of lead, but we only get paid by a facility, not by a family, if we are the first person to give that lead to them, and giving a lead at a very distinct moment in time. There is an email that goes out, there's names, there's information, the person is, the family is consented, it goes into the inbox of the facility, there is no question or doubt. And then they have 72 hours to tell us, I've already met this person. Caring actually referred them first. Somebody else did. A Place for Mom, you're not going to get this referral fee.
So
if they find somebody independently to whom we have not referred
Okay.
them, no.
But if a while later, more than a year later, I end up in that facility, you're gonna get the fee because of that.
Did we refer you to that facility in the first place? I'm clarifying
Yes,
because that is
yes,
what triggers a
Yes,
referral.
but
fee.
now it's 15 months later.
If you found that facility because you
Okay.
spoke to our agents for an hour
Okay,
and you identified that as one of the ones that you wanted to move your family into or consider, and then we sent your information to them and then they called you because of that referral, and then you decided to move into there. First of all, we haven't discussed, have you been calling us back for the past year plus, asking us further questions? Are we still helping
No.
you? Right? So that could have been
so
happening
it's
the entire time.
infinite, it's an infinite agreement. It
It is an infinite agreement. They're
If I ever
confidential.
go,
They're
if I
confidential.
ever go to that facility that you referred me to ever, then it still comes back to you. Thank you.
That is,
Um,
I'm sorry, I would
no.
like to respond.
Pardon?
That's not, these are negotiated agreements.
Okay, thank
Between
you.
two sophisticated parties, that is not the term of every contract.
Thank you very much for answering my.
You're welcome.
Are you back? You're welcome to ask your question, Senator Mount. Senator Reedy?
Madam
I
Chair.
just want to ask, I'd like to ask one follow-up question to your line of questioning. So, and this could be anybody, and they can answer this, but, and everybody's probably a little different model, but if we capped certain amount of life of lead at a certain point, is that something everybody can work with, or is that something that would be impossible? And I think a year, I'm in sales, so I know something about life of lead. I'm not in this business. I think the bill has a year. Some people have.
And
I mean,
I'd say Jim wants to say something, but let me say this. The reason why putting a year time limit on it is difficult. I mean, I went through the same situation with my mom. You know, you're in the hospital, you go to the rehab facility. You start talking about assisted living. You contact one of these companies and your mom says, I don't want to go to an assisted living.
Right.
So what you may do, you may have already started the process. Senator Reedy.
no, I agree with you. I think my question is there a year is probably not enough time in my opinion, just my opinion. But if there's a place, I'm sympathetic to some of the concerns of the local guys, but I also understand it's a fair business model and they're not doing anything wrong. So I'm just trying to find.
And what happens is they may do home health care first, and then it'll come to a time where they have no other choice, and that may be beyond that year period. So it's hard to say, should it be a year and a half or should it be 2 years? Because you don't know how long it's going to take. You don't know what the decline looks like in terms of times and years. So that's
all right.
But,
thank you.
It's more about procuring cause.
Understood.
Yeah,
we're doing a thing where we're supposed to ask one person because we have a long day. So if I'm happy to talk to folks on both sides offline and get more information. Thank you.
Senator Reedy, thank you for that. That ends the hearing on Senate Bill 952.
Thank you very much.
We now have Senate Bill 911.
Thank you,
Senator McKay has waited patiently, Senator, and we
Thanks.
thank you. You have a panel.
I do.
Robert Thornsberry, Aditi Bergava, Tanya Carmona Daniels, Gopi Vinjaya, and Jancy Lindsay.
If my panel could come.
Oh, and your panel's all virtual.
I have some in person. I have
Okay.
a bunch in person.
Who do you have in person?
So we have Maria Lorenzo
Okay,
Chang. We have Marsha Blakely. We
Okay.
have Judy Orendio,
okay.
Emily Carsil.
Well, Emily's favorable with amendment, so let's bring up your favorables.
Okay.
And then we also have your virtuals on screen. So you're gonna get to participate in your panel. Okay.
We want to make sure that we have the people who actually have signed up. Okay.
Maria Lorenzo, Marsha Blakesley, and Rudy Arendano. That's the three that are signed up. Who is this? I'm sorry, I can't hear you.
Son of a father who took care of me.
She's gonna.
You're favorable with amendment.
Hold on, please.
Okay, can you wait? We do all the favorables first.
Okay.
Okay,
Minor.
okay. I'm so confused about who's at the table. Who's the person on the end?
Yeah.
Okay. Senator, you can start. We're going to try to get all your favorables, all your virtuals, and then we'll ask questions to your favorable.
Absolutely.
Okay,
Yes, ma'am.
thanks.
Okay, I think I'm ready for a place for mom. So anyhow, maybe they need a comedian there. Anyhow, thank you, Madam Chair, Madam Vice Chair, members of the committee. You know, when I thought about this bill, gene structure, function modifying products and labeling. What the heck is that all about? Well, you're going to get an education today, and it's not going to be from me. So when I drove my car down today, well, I should say over the weekend from Cumberland, the oil light went off. So this bill is like one of those dashboard lights that says, hey, there's something going on. There's something wrong. And I may not be the mechanic that knows how to fix it. My panel will be the people that will be able to tell you why we need this bill. All I know is I've got a problem and I need to make sure that it gets addressed. Now, the benefits of Senate Bill 911 gives you the opportunity towards protecting an already compromised food supply, and that the community that is generally already susceptible to food sensitivities and disease as a whole. You see, the new food labeling specifications will help Marylanders consumers make informed choices about their food consumption, turn to their health, while creating any kind of substantial additional costs in the labeling of a product. You see, Madam Chair, the purpose of this bill is to prohibit the sale of gene structure or functioning modifying products unless they have been properly, and I repeat, they have been properly labeled in large visible text as such. It should also be included the potential side effects, risks that an individual, if he have taken or consumed. This bill will establish some penalties for a violation of this act if it is passed. And I thank you for your time and ask for a favorable vote for the dashboard light of food labeling, as we're going to explain from my panel. Thank you, Madam Chair.
Who would you like to go first, Senator?
Would you go, please? Sure. We're going to go right down the line, if that's okay. Thank you.
Thank you, members of the Finance Committee. My name is Dr. Marcia Blakesley, and I've been in practice in Severna Park, Maryland as an internist for the past 30 years. In the course of caring for patients, I deal with a large variety of health conditions and provide counsel on the best way to care for those conditions. Perhaps more importantly is the ability to provide medical counsel that helps prevent the development of chronic health conditions. A huge body of evidence points to the ability to avoid many health conditions by reducing exposures and consumptions that lead to chronic health disorders. There's great evidence that many human medical disorders are the result of what we eat and drink. These include high blood pressure, diabetes, heart disease, and cancers. Knowledge of the contents of products allows consumers the ability to make appropriate choices for their health. We're in an age of rapid advancement of genetic technologies using and altering DNA and RNA. While these biotechnological advancements may hold promise for the future, there's also the possibility of great harm. History is littered with the removal from the market of many products which were ultimately found to be dangerous. Clinical practice has taught me that susceptibility to harm is different for every person, since each person's physical, biochemical, and genetic makeup is different. Consuming any food product or animal product that contains or has been treated with a new technology that has the capacity to modify the gene structure or function of an individual, that means me and you, could result in disastrous health outcomes for some. For basic human safety, any product of this type must be openly labeled as such, and the labeling should include potential risks to the consumer. We all expect to know the calorie count, carb count, fat grams, gluten or nut content of any product that we consume. We should certainly expect labeling on our foods that may contain products that could have unknown short and long-term potential risks. I would strongly advise that you pass SB 911 to provide appropriate labeling of products for the people of Maryland. Thank you for your time.
Madam Chair, if I may, I'd like to remind my panel and those who are virtual that we have a 2-minute time frame, and we get bonus points for staying in the 2-minute bumper. Yes, sir, please.
Good afternoon, and I appreciate this honorable committee to allow us to present testimony. I not only embrace but endorse the concerns of my colleagues with regard to SB 911. I'm the president of Latino Farmers and Ranchers International, representing over 75,000 Latino farmers and small to medium farmers throughout the United States. And one of the concerns that we have is in terms of the pollution of our food system. Our food, we want to make sure that we provide and we endorse and we promote safe and healthy and fresh fruits and vegetables, and also to make sure that our animals are well taken care of so that we are not doing any genetically modified of any sort. We're having concerns with regard to the country of origin label at this moment. We have for several years now, whereby the meat industry will bring animals or meat from other countries not meeting the standards that we have here in the United States, mixing it and then labeling that it is USDA approved. We are very concerned about utilization of especially genetic modifying that the food that we eat. You know, I suffer the consequences of having as a young man, you know, I was a migrant farm worker. I started working in the fields at the age of 5 and had to endure the Agent Orange, the dusters that I had to bring in. So thank you very much for your effort, and we look forward to the having 9/11 passed. Thank you.
Thank you, Madam Chairman. I'm Alan Vinitsky, an internist and pediatrician for more than 45 years in the state of Maryland. My amendment is very minor, and that is that businesses or business entities or organizations be included as well as persons. Okay. Gene-modified products can be medicines, nutraceuticals, which include supplements, foods, and flavorings, to name a few. Human insulin is made using bacteria that mass-produce human insulin. A nutraceutical that was derived from jellyfish is mass-produced by bacteria that are coded to produce the protein. Based on my understanding of this legislation, such products should also be labeled as GMP. Today, we have access to multiple generic medications, and these are regarded as the same as the active ingredient, but they are not the same. When we talk about genetically modified products, they're substantially the same, but they are not identical. And individuals who I take care of often cannot tolerate variations on the products that they've received. And so this is the case of adding in genetically modified organisms or products as part of the additional evaluation that I need to do when I'm considering persons who might not be able to tolerate products. I operate under the precautionary principle. If safety hasn't been shown, then labeling a product as GMP will at least give the consumer the option of making a choice about the product. As an example, GMP crops made to be resistant to glyphosate, which is an herbicide, will be treated will be used by that herbicide, and that could be a problem. In addition, substances are used that can be attached to our DNA. These are called DNA adducts, and that will wind up causing ongoing medical conditions. Thank you for your attention.
Good afternoon. My name is Alejandra Lorenzo Chang, and I'm here in support of SB 911 as a mother, daughter, and informed consumer. My need for extensive research on food was due to not only my professional background, but also because of my mother's Parkinson's condition and my son's allergies as a child. Had I known about the correlation between the health and the gut microbiome and brain health sooner, I would have saved years of agony for my deceased mother. Food had a crucial part in my son's healing and my mother's quality of life. I cannot imagine the repercussions an artificial gene-modifying food product could have on my son's health and could have had on my mother's health at the time. My son's and mother's experiences are not anecdotal, since most of the adult and young population suffers chronic illnesses. Dr. John Fagan's analysis of food-like products developed using modern technologies based on synthetic biology is very revealing. Dr. Fagan analyzed a milk-like product that is currently commercialized as a food product, and he identified 92 different compounds which are not present in regular milk. According to Dr. Fagan, most of these compounds are so uncommon that they have never been classified in science or assigned a name. Dr. Fagan found them to be predominant in this milk-like product that is currently being commercialized in spite of containing compounds that have not been part of the human diet before. These are very frightening facts. I ponder with great concern the effect of these types of food-like products, which are being commercialized as foods and consumed in different quantities and frequencies by a predominantly susceptible consumer population. Food is our daily sustenance, our source of nutrition and nourishment. It plays such an essential role in our lives. We are honored to have model organic, regenerative, and biodynamic farms in Maryland, which exemplify what it means to provide food products that have a positive impact on the consumer, the community, and the environment. People have the right to know and decide what they and their families consume. Today, you have the opportunity to protect this right, contribute to the development of a healthier food market defined by informed consumers, and avoid preventable harm to the public.
Thank you. Sorry. We're going to go to the virtual testimony now. Robert Thornsberry. Unmute, please.
Thank you very much. I'm very honored to testify today. I'm a veterinarian from Missouri. I've been in veterinary practice for over 40 years. I'm licensed in Missouri, Illinois, Iowa, and South Dakota, and I work with livestock producers on a daily basis. There are products being utilized in the United States, primarily in swine, that are provisionally licensed by the USDA that are injections of genetic material. This genetic material can be excreted from the animal through extracellular vesicles, exposing consumers to them when they're preparing the meat for their family. We're very concerned about the perception about these genetic materials, and we are in favor of this bill in order that consumers would have confidence in their food supply by at least having it labeled. They could make the choice then. Do we want to consume something that has been injected with genetic material, or do we not? We work diligently as practicing veterinarians to keep a safe food supply, to work with our producers to make sure that they do things correctly and properly. This is an important procedure, and we are definitely in support of it. Thank you.
Thank you. Aditi Bergava.
Thank you for this opportunity, Madam Chair. I speak in favor of SB 911. My name is Dr. Aditi Bhargava, and I've used many of these genetically modified techniques in my lab for over the last 3 decades. Remember when the corn stalk was just a wisp and looked nothing like the present day corn? Don't remember it? Neither do I. That was eons ago, like over 8,000 years ago. Crossbreeding and domestication gave rise to many of our present-day crops. Exchange of genetic information or crossbreeding is key for survival. In nature, this exchange of genetic information is unique to sexual reproduction. Even single-cell bacteria periodically exchange genetic information to maintain a diverse and healthy genome. Viruses are unique. They are neither living nor dead. They become alive in their hosts, and to reproduce, they make copies of themselves by usurping hosts' resources and often exchange information with the host. Sometimes they steal from the host, sometimes they leave behind their or stolen genetic material in the host. This cross-pollination can be beneficial or harmful or neither. Several modern-day genetic modification techniques rely on using viruses and bacteria as vectors and hosts. Hence, regardless of the technique used, CRISPR, mRNA, viral vectors, bacterial plasmids, we cannot prevent or guarantee that exchange of genetic information will not happen. The unintended consequences of such exchanges remain largely unknown. But given that bacteria and viruses use a number of these techniques for their own immunity and to evade our immune systems, exchange or integration of these vectors and genes used for modification can have tremendous impact on the functioning of our own immune system and alter expression and function of other genes when consumed. Big difference between using GM for academic understanding versus real-world application. Recall the green pit on tomatoes and other fruits. That green calyx had a function, protection from pests and ripening. But calyx was forcibly modified. As a result, the fruits ripened too quickly or didn't ripen at all. The latest focus is to remove
Please finish your testimony.
Just
past time.
Okay. For whose benefit and for what purpose? We are trying to correct issues that were never a problem to start with. Rather than real problems driving invention, we are letting cool techniques drive and invent problems. Okay. Thank you.
Tanya Daniels, you
Oh, I
done?
didn't hear my name. I'm sorry. Thank you for having me here today. I'm testifying in favor of this bill. As a mother of three, one of my main concerns is to wipe these products that are on our basic diet are loaded with toxics and organisms that change our genome. It is very alarming to see how public schools meals are loaded with heavy metals and GMOs. Kids are slowly being intoxicated. We have the right to access real nutritious food. Any food product that modifies our genome must be pulled off the market. Meanwhile, labeling with a big warning, not a small one, must be mandatory to protect our bodies and our children's health. I represent a group of parents of children with autism. Our kids were not born with autism. It is clear to us that medical and or environmental factors negatively impacted our children, who otherwise did not show any signs of autism pre-intervention. Many of us have proof of it. If we had been fully informed about the risk, we as parents would have been made different choices about what we put in their bodies. Children with autism generally have compromised digestion. Working on restoring gut health is essential, particularly due to the gut-brain health-brain functioning connection. Dietary changes, including the switch to organic diet, has demonstrated to have a positive effect in kids with autism. An improvement in reducing autistic symptoms is observed. The potential artificial genetic alteration through food could be catastrophic to many, particularly children with autism, as their bodies do not metabolize toxic agents. Parents need to be fully informed about the potential artificial gene altering capacity that a food product presents in order to make the best decision for their children's health. The supply of food, our daily source of nutritional nourishment, needs to be protected. I used to criticize people at the supermarket when they read the labels in the products. Why are you reading if it's on the shelf, it must be safe to eat. That's what the FDA is for. I was wrong. Consumers are supposed to trust authorities whose jobs is to guarantee the wellness of the citizens. Today, we have the opportunity to take a step forward toward this objective. Anyone opposing this bill care about profit over people's wellness. Thank you.
Thank you. Dr. Vieira.
Hi, good afternoon. Thank you, members of the committee, for having me on. My name is Dr. Gopi Vijaya. I'm a physicist by background, and I've served as the scientific and legislative advisor for grassroots organizations in Utah for several years. I'd like to speak in strong support of SB 911, which is also a coincidentally appropriate name because we are indeed dealing with an emergency. But this emergency is not as obvious to the eye as others are because we are having to deal with a genetic issue. So the advent of the very recent technologies in using a variety of genetic processes that can directly enter the genome of the human being, there was a lot of concern across the nation, and there had been some initial work done at the federal level in 2016 and 2022, but it suffers from several shortcomings. For one, they used a word called bioengineered, which does not cover anything that we are talking about, especially with regarding to the mRNA platforms and other highly intrusive technologies. It doesn't cover the recent advances that we are seeing in that. It has been held up in litigation because it runs afoul of First Amendment issues. It opposes the very act. So it's a huge mess. And what we're trying to do is to ask you to make sure that you clear the air and do what was not done at the federal level and do that at the state level, because these are technologies that are used and we have no idea of the clinical trial data. You can't find the clinical trial data. It's not open to the public. While at the same time, you have a big wave of gene altering technologies being fast tracked, for example, for plants as mRNA factories. So in light of all this, I'd strongly urge the committee to please pass SB 911 and help protect the citizen. Thank you.
Thank you. And our final virtual testimony is Jancy Lindsay.
Hi, my name is Dr. Jancy Lindsay, and I am thankful to be able to testify for you here today. I am a toxicologist, and I'm also a molecular biologist. That means someone who studies RNA, DNA, and protein. And I'm also an expert witness for a living. I've done research in this area for over 30 years. There are a number of new vaccines that are being put out, genetic vaccines being put out by the USDA. There are about 70 of them that are genetic vaccines that use RNA or DNA technology. Plasmid DNA technology is particularly being used. And we know that plasmid DNA can transfect workers. We had lab workers that worked with some COVID plasmids in the lab, and they were transfected in their nose. They went home and they gave that plasmid to their family and secondary transfected their family. That's in Beck 2022. The risk for this transfection is a real issue. It's thought to be small if the plasmid degrades quickly. In a study that was done in mice for a fish vaccine, they saw that the plasmid degraded in about 90 minutes. However, when that plasmid DNA study was actually done in fish, the target species, the plasmid DNA lasted for 90 to 320 days. This is a type of farm fish that you are getting in the grocery store that is not labeled. There are studies that say if these persist, this can transfect you. That means you get vaccinated with everything that the fish get vaccinated with, that the swine get vaccinated with. There's another important study, the Sequevity vaccine, where 30% of the pigs that received this vaccine ended up with life-threatening illness. 3% died within 21 days. And these pigs were allowed to be used for meat for human consumption after receiving this vaccine, which was approved by the USDA in 2021. These should not be being approved for us to consume because we don't have the risk properly assigned. The USDA is using bridging studies. Like I said, that mouse
Dr.
study
Lindsay, thank you.
would have
Thank you for
been
the testimony.
accepted. Thank you so much. I appreciate your time.
Thank you. Do I have any questions for this virtual committee? Okay, so we're finished this hearing. I think I have a couple more people to call.
Yes.
Emily Tarsel. I'm not sure I called Emily. I think Emily's the last favorable. Have I missed anybody else that signed up to speak on this bill favorably?
Come on up, Miss Emily.
No. Okay. I think Emily's the last one.
Bless you.
Okay.
Yes, ma'am.
Yeah. Good afternoon, everyone. I'm Emily Tarsell, a licensed therapist and president of Health Choice Maryland. I asked for a favorable vote, especially for the food labeling. Precision fermentation is a clever technology whereby organisms like bacteria and are gene edited to produce artificial fats and proteins for making artificial foods that some people have called frankenfoods. These include synthetic dairy and synthetic meat products, and independent testing has shown that they lack the important nutrients and vitamins found in natural foods, and they also have a host of compounds that could be harmful. The FDA would not require these foods to be tested or labeled, but other countries like Italy ban synthetic meat and require safety testing of fake foods before marketed, but not in the US. Labeling here is non-existent. And this new technology with unknown consequences in terms of health, safety, and environmental impact is based more on an investor model driven by the duty to make profits for the shareholders and not necessarily for the public good. Other states have set precedent for food safety. The antibiotics in food law began in California. The GMO food labeling began in Vermont. Both have become national policies because of their health value. Scholars implore more states to take initiatives to enact food safety regulations because they need to serve as laboratories and developing new rules and standards to fill the gaps in the U.S. food regulation. Marylanders should set the standard for the nation to ensure proper labeling because consumers deserve the right to know. Thank you.
Thank you very much.
Madam Chair.
Yes, sir.
So just like when I started, the dashboard told me that I needed to do something with my oil. These people know exactly, if you take anything from this whole positive presentation, is that there should be some kind of truth about food labeling, and to give some of the people like myself who don't understand what goes under the car some kind of an opportunity to say, I better get with somebody who's an expert. Thank you, Madam Chair.
Thank you, Senator. You have one unfavorable if Sarah Price is here.
Good evening, Madam Chair and honorable committee members. I am still Sarah Price here on behalf of the Maryland Retailers Alliance. When we were preparing for this hearing, we struggled to identify products that are on the shelf available for sale right now that have been found to alter human genetics. The federal government has determined that GMOs are safe to eat. These products, they're modified so that they are disease resistant, so that the crops are hardier, so that the products are more nutrient dense. And about 80% of food that you can buy right now is or contains some form of GMO. It's true that the federal government in 2016 passed the National Bioengineered Food Disclosure Standard, and the rule established by that went into effect in 2022, which requires all foods and packages that include GMOs to have a seal or text that indicates that that item has been bioengineered or derived by bioengineering. And that bill also established preemption for state law for similar bioengineering labels. That preemption was upheld in federal court in 2022. Ultimately, we come before you all the time to talk about how complicated it is to have a patchwork of policies across the country for products. And for that reason, we would respectfully ask for an unfavorable vote. With respect to the sponsor, we just don't feel that this is necessary. Thank you.
Thank you, Sarah. Do I have any questions for Sarah? Thank you for testifying, Sarah. That ends the bill hearing, and we now will start Senate Bill 823. Senator Kramer, it's your turn. I'm going to bring up your panel. I remind you that the panel is going to start at the podium and go straight across from there. So Donna Edwards, Allison Harding, Shanna Pearson-Merkowitz, and Ann McLeer. Please come to the table.
All right, Madam Chair, members of the committee, Madam Vice Chair, Ben Kramer here to introduce Senate Bill 823 and colleagues. This bill sounds familiar, and that's because it is. And I am hoping that maybe this will be the year that we pass this bill so you won't have to see this smiling face before you again on the issue. The issue is one that's very important. The University of Maryland system is outstanding. We have a great university system that's one of the best in the nation, and I'm very proud of that fact. However, there is a dark cloud that hangs over the university system, and that cloud is the fact that there is a disconnect between the university system and the employees who work in the university system. And in this case, we're talking about the faculty and the graduate assistants who are in the field, in the classrooms, doing the day-to-day work that makes the university system wonderful. I would proffer to you that it is not the Board of Regents that makes the university system the place that our families, our parents, want to send their children. It is the hardworking women and men who are in the classroom who make our university system so outstanding. Colleagues, the vast majority of the universities in the Big Ten Conference do just what we're asking for in this bill. They provide the opportunity, and that's what this is, opportunity to participate in collective bargaining if that is the will of their faculty and their grad assistants. There is nothing in the bill that forces anyone to be a member of a bargaining unit. And in fact, it has to be a selection of the members that are in the categories in the bill before they even have a vote to determine if they want to avail themselves of the opportunity to bargain collectively. Collective bargaining is more than just a mechanism for negotiating wages and working conditions. It's a fundamental right that empowers workers to advocate for their interests collectively. Collective bargaining ensures that workers have a voice in shaping their workplaces, and it strengthens the balance of power between labor and management. It is a basic right that we afford state employees in all the other agencies in state government, but we do not do that for these hardworking women and men in our university system. And I am just ever so disappointed that our University of Maryland system is once again going to come in and oppose this bill. And their opposition, I would also say to you all, is disingenuous. And it goes against all of the thought that goes into the other universities in the Big Ten Conference that afford this to their faculty, to their grad assistants, because they want to recruit and retain the best. And they know that extending collective bargaining to their employees is one very important way that they will recruit and retain the very best. The university system, and I've taken a look at their written testimony and their opposition, they list several categories that they posit is the reason that collective bargaining is not needed at the university system. The first of those categories is what they say is academic freedom. And they define academic freedom is the freedom of a teacher or researcher in higher education to investigate and discuss the issues in his or her academic field. Isn't that great? Has absolutely nothing to do with collective bargaining and the need for collective bargaining at our University of Maryland campuses. They then go on to indicate that they have shared governance. And because of shared governance, we don't need to have collective bargaining at the University of Maryland campuses. Well, colleagues, there exists the Council of University System Faculty. I'm going to repeat that. The Council of University System Faculty, and here is their charge. It consists of faculty representatives elected by the faculties of each of the constituent institutions of the University of Maryland system to represent the University of Maryland faculty. And here's what they had to say about shared governance, which the university system is telling us, oh, we don't need collective bargaining, we have shared governance. And I quote, shared governance in sum does not deal with the issues that a union would address. Period. End of story. Once again, disingenuous, smoke and mirrors. The university system comes in here and says, we have shared governance, but the folks who represent the faculty at each of the university's institutions, they're, oh no, that has nothing to do with collective bargaining. I will also share with you that the very same people, the Council of University System Faculty, have voted unanimously to provide to support collective bargaining rights, unanimously. So if all is well at the university system, why is it that those members who are representing the institutions voted unanimously to support this legislation? Finally, and this one is laughable at best, the university system says we don't need collective bargaining because they have meet and confer. Meet and confer. That's where they sit down if the employees of the university are fortunate enough to have them do that. They listen to what it is the concerns are that are raised, and after that, crickets. They don't have to respond. They don't have to do a thing. And frequently, as you're going to hear today, that's exactly what happens. The university system does nothing. It is embarrassing that our university system does not respect the workers and the will of the workers to bargain collectively. There's even in their opposition, they said, well, there's always going to be a small group. a small group of people who are dissatisfied. Colleagues, if it is just a small group that has a problem with the way things are going at the university system, then what does the university system have to fear in providing the opportunity, just the opportunity, for these hardworking people to bargain collectively? What do they have to fear if it's just a small group of individuals who have a concern? Then by all means, let's pass this bill, and they have nothing to worry about, because obviously this small voice is not going to choose to bargain collectively. Colleagues, we need to step in and take action, do what the overwhelming majority of the Big Ten universities have done, and provide this right to the hardworking professors and the hardworking grad assistants who make our university system as outstanding as it is. With that, thank you, Madam Chair, and thank you, members of the committee.
Donna, we'll start with you and go right down the road. Thank you.
Okay. Good evening. Good evening. Thank you for the opportunity to testify. I'm Donna Edwards. I'm president of the Maryland State and DC AFL-CIO. We strongly support Senate Bill 823. Collective bargaining is a well-known right around the country. It is a right of all workers. It is not the university system of Maryland that is preventing or prohibiting this. It is the state of Maryland. The state of Maryland is prohibiting these workers from having the right to have collective bargaining. All that Senate Bill 823 is enabling legislation. It enables the workers in this particular sector of employment the right to come together to decide to vote if they want a union or if they do not want a union. And we are saying at this point, we are only one of two Big Ten states. Ohio State and the state of Maryland are the only two states that prevent this types of collective bargaining to faculty and to graduate workers. I just want to say from Albert Einstein, I consider it important, indeed urgently necessary, for intellectual workers to get together, both to protect our economic status and, generally speaking, to have influence in the political field. He said that as a member in 1938, as an AFT member of 552 at Princeton University. This is not a new idea. Ivy League schools have had collective bargaining for decades, and we ask you to please give this right. Free up this sector of employees to have the same right as everyone else for collective bargaining. Thank you.
Good afternoon, Chairwoman and Senate Finance Committee. My name is Allison Harding, and I'm a third-year PhD candidate in information science at the University of Maryland, College Park, and a homeowner in Cottage City, Maryland. Similar to how the administration will tell you that graduate workers are paid well in comparison to comparable universities, while not telling you that per their own study, 52% of us are worried about how to pay for housing every month. The administrators will try to tell you that they'll try to sell you the misleading point that we are students first and workers second. In my 3 years as a PhD student and candidate, I've had two major assistantship assignments. I've provided the university with a convenient substitute for a full-time tenure track subject specialist librarian position while they dragged their feet finding replacements for people who had left their position. A job I was working paid for a 20-hour-a-week stipend and was already more than qualified to hold without the degree I'm seeking. The other major assignment I have had is as a research assistant on a $6 million grant project funded by this very body on digital literacy in the state of Maryland. Worthwhile and necessary. Absolutely, but not furthering my own work. My own research consistently has to take a back seat to a job that will not further it. And I'm not alone in providing the university with labor that they like to believe is educational so that they can continue to exploit us. Do you really want to agree with the administrators when they say that all of our work is educational when you have people like me covering for hiring failures? What about the graduate worker who is an administrative assistant in somewhere like the Office of Fraternity and Sorority Life, or the graduate workers in facilities? What about the ones working in dining halls or the ones who are career counselors for undergraduates? These are not isolated incidents, despite the narrative that the administration tries to spin. I urge you to listen to not just me and my colleagues testifying, but let the pile of over 2,100 union authorization cards from graduate students and graduate workers that you see before you hold more weight than the words of administrators who routinely and consciously deny us the respect that we deserve. Please report in favor of Senate Bill 823.
Hi. Committee members and sorry, Chairwoman. Thank you for having me today. My name is Shauna Pearson Markowitz. I was born and raised in Prince George's County, and I currently live in Howard County. I've served as a tenured faculty member at both unionized and non-unionized universities. I've also served as an associate dean at the University of Maryland, College Park. In that capacity, I witnessed a broken system in which faculty and graduate workers were treated very differently depending on their individual ability to self-advocate. The predisposition of their supervisor to their area of expertise, and perhaps most importantly, their supervisor's knowledge of and interpretation of university policy. When I worked at a unionized university, by contrast, the union ensured that university policies and shared governance practices were meaningful and practiced. Studies empirically find that faculty unions reduce pay inequalities and increase the hiring, promotion, and retention of women and faculty of color. Researchers associate the increase in faculty equity with the fact that unions ensure that there are transparent and consistent hiring, performance, and workload policies, and formal processes and representation through which to appeal when a faculty member believes they have been treated inequitably or are being held to a different standard. Further, faculty and graduate workers in unionized schools have a better understanding of the workloads and pay of their colleagues. This information alone can reduce inequalities created by the fact that some workers negotiate less effectively than others. The research also shows that the workplace is more collegial and communication is better at unionized universities, and that unionization improves efficiency and effectiveness, including time to graduate for our students. The oversight to ensure there are consistent, transparent policies and that there is formal representation is just what a union provides. I urge you a favorable report for SB 0823, and I have provided a very comprehensive summary of the research in my written testimony.
Thank you all. I also called Ann McLeer. Is she here or is she gone for the day? Is Ann McLeer here?
She was never sent an email confirming. So
She's on the list, so I'm sorry she missed the
she's
email.
on the list, but she never got a confirmation.
Okay. Do I have any questions for this panel? Thank you all very much. I'm going to call up the next sponsor panel. Lenore Knowles, Nicole King, Robert Burt, Holly Brewer, Brian Weibel. She did sign up. She's here.
Supposed to be the order, right?
It was? Oh, it's the signed cards.
Do you want to go first?
Okay.
I don't know.
Who am I missing? I have Lenore Knowles, Nicole King, Robert Burt, Holly Brewer, and Brian Weibel. Okay, well, somebody's not here. Let's start with the person closest to the podium and just go right down the line. Thank you.
My name is Lenore Renee Knowles, and I'm a member of the Graduate Labor Union and a PhD candidate in the Harriet Tubman Department of Women, Gender, and Sexuality Studies at the University of Maryland, College Park. I am also a Black and Honduran first-generation college graduate, and I've lived in District 40 for 6 years now, and I'm involved in community-led development work in District 45. If grad workers had the opportunity to bargain collectively, it would clarify work expectations in ways that shorten time to degree, and lead to more equitable work and learning conditions. During my first year as a graduate worker, I learned a hard lesson. The backbone of the University of Maryland College Park is low-wage graduate labor. That first year, I had a supervisor who tried to elude paying their portion of my summer stipend, which was outlined in a vague portion of the funding letter issued by my department. During the same year, I was assigned 2 other supervisors who expected me to work past the term stipulated in my work agreement. Graduate workers do not get standard enforceable contracts. Instead, stipend levels and working conditions vary from student to student across departments. As someone who grew up Black and Latina in a working class single parent household, I know how difficult it is to reach the level of doctoral studies because of this country's deeply inequitable education system. The stress and isolation of having to advocate for myself in the workplace, being a low-wage graduate worker on top of completing a demanding doctoral program makes it that much more challenging to complete the degree. However, I've persisted because I want to make a meaningful contribution to my communities and the state of Maryland. If I and my fellow graduate assistants had a formal contract and representation facilitated by a graduate labor union, supervisors would be informed about workplace norms and our experiences as workers would be more equitable. I ask for a favorable report for SB 823.
Good afternoon, members of the Senate. My name is Robert Burt. I'm a professor of philosophy at Bowie State University, where I've been teaching full-time since 2008. I am also here to urge a favorable report for Bill SB 823. Collective bargaining rights for higher education workers will actually strengthen, we believe, shared governance and also dignified labor conditions for all instructors, including part-time faculty. The principle of shared governance and academic freedom, which are informed by the AUP policy, are part of the bylaws of the University of Maryland system, as well as faculty handbooks throughout the state. They allot primary responsibility for teaching, for the content of teaching, the hiring, evaluation, promotion of faculty, and the program development. These are good policies, actually, but for such policies and principles to be good in reality as well as on paper, the right to collective bargaining is essential. Without that right, faculty do not have effective means of preventing the erosion of shared governance and academic freedom. These then, they'll be left to will be dependent upon the goodwill of administration, which is not always available. So I want to encourage the promoting of SB 823.
And next we have
Holly Brewer.
Okay.
Hi, my name is Holly Brewer. I am the chair of the Legislative Affairs Committee for the Council of University System Faculty. Last year, I was the chair of the entire council. As part of my written testimony, I have submitted 2 resolutions passed by the Council of University System Faculty of the University System of Maryland. I emphasize we are the only representative body for the faculty of all 12 USM institutions. Formally, we are advisory to the chancellor. These 2 resolutions support collective bargaining rights for faculty and for graduate students. Both of them passed unanimously at our January 2024 general body meeting. It is a fit statement of how well shared governance is working that the USM vice chancellors who submitted witness testimony in both the House and today did not mention the Council of University System resolution supporting collective bargaining rights. They attend our meetings. They have read our resolutions, but you do not hear our voice through them. Our views are only advisory and can be ignored. That's the point. Imagine if you were just advisory to the governor. Any policy that the governor made could be made without your actual consent. You deliberate, you pass a resolution, you talk for ages, you gather tons of information, and you can just be completely ignored because you're advisory only. That's the problem. I write also to address some claims in the USM's testimony about how shared governance works, claims that are problematic. In that capacity, I write, particularly as chair of CUSIF last year, I conducted the surveys in question. I'm happy to answer any questions you might have. Thanks.
Good evening. My name is Nicole King. I live in Baltimore City in the 40th District, and I'm professor in the Department of American Studies at UMBC, where I've worked for 18 years. The right to collectively bargain for faculty and graduate students is tied to academic freedom, racial and gender equity, and the right to honestly teach the history of this country without fear of reprisal. These issues are especially important right now, as troubling battles to dismantle public education are occurring across the country. The lack of collective bargaining rights in Maryland disproportionately impacts first-generation students, women, and people of color. When I started as a graduate student in 2001 at the University of Maryland, College Park, where I worked with the American Federation of Teachers on organizing my fellow grad students, my annual salary was $12,000. Today, 23 years later, Morgan State University and HBU in Baltimore, where I live, graduate students make $15,000. A union would in no way harm the mentor-mentee relationship, but provide more clarity and transparency at all levels and make it work better. As a chair of my department at UMBC from 2015 to 2022, I saw the economics of how graduate students and contingent faculty make our institutions of higher education work without anything near fair compensation or job security. At UMBC, our faculty senate is not a union and does not directly address grievances or pay inequity or compression. This bill will give each individual campus a right to bargain for a more just, fair, productive academic workplace based on our own specific needs and conditions. After organizing for collective bargaining rights for USM employees for 23 years, I believe now is the time to pass SB 823. Thank you for listening.
Do I have Senator Motz?
Thank you, Madam Chair. Just a quick question. So Dr. Birch, thank you for your testimony. Thank you. We're only allowed to ask one witness a question, so it'll be real quick. And I'm sure University of our system, our salaries for the professor, associate professor, assistant professor, instructor, lecturer, I've got a document from the system they shared it with me, is above the national average. I don't know what each professor is making, and that doesn't matter, but that's from the system, and that's good. That's good. But the question that comes to my mind, being a person that went through postgraduate work, if collective bargaining takes place, costs inevitably go up. There'll be an expense. At least that's what there's articles and it's pretty well documented. The costs will go up. And so if your department takes a budget hit, how do you suspect that would prevent the loss of some of these positions? I mean, aren't you concerned at all about the opportunity? Because these are great opportunities for students as they're going from the studies into whatever career they're going to follow. I mean, if your department takes a significant financial consequence, would that, I mean, how would you be confident that wouldn't affect the availability of these positions?
Well, we've had problems And also, me, Frank, you say that we're paid above average. That seems to be different from what reports I've been getting on campus itself. I even recall a situation, and I'm also thinking about the not only just the regular faculty, but even the part-time faculty. Even the case I understand, as is reported to me, that the COLA raise that was supposed to go to, under the previous governor, Hogan, the COLA raise is supposed to go to all the employees, was initially denied to our part-time employees. And that's despite universal support for that, unanimous support for that from the faculty.
Right.
So there was
Well, you can dispute, that's fine. You can say no, Senator Mounts, I don't agree with that. But that's fine, because that's information was given and we have to filter all that out. But the essence of my question is so the history has shown that the cost of employment goes up, and that's that's broken out to different departments. So if your department has a additional or a reduction in its budget because of this, could that mean that would it be reasonable to suspect that if that occurred, that potentially some of these positions may not be available in the future?
I'm not sure I'd agree with that. In fact, I don't know. We often hear that if you have collective bargaining, so like you hear when if you raise the minimum wage, everything will go up and we'll lose people. I tend to doubt that. I think what tends to happen when you have collective bargaining, if anything, is that things will be improved, and secondly, that the faculty will have more of a voice in this. Right now, what is decided people get is not something that is the faculty itself have much of a voice in. Is decided by the higher ups.
Okay, well, you answered my question. Thank you. And I was looking at an article from the Los Angeles Times dated January 29th, where their University of California is considering cutting teachers' assistants. And are attributing it to collective bargaining. But I'm not disputing your testimony and your perspective about here in Maryland. I just wanted to put that question to you. No, only one witness. Thank you for answering my question. I appreciate you offering that. Thank you.
Thank you, Senator. Senator Kramer.
Thank you, Madam Chair. And any one of you can answer it, but please just one. Are any of you aware that as a consequence of collective bargaining at Michigan University, University of Minnesota, Michigan State, Iowa, Wisconsin, Illinois, Rutgers, Penn State, or Northwestern, if somehow they had to cut positions because the majority of the Big Ten universities afford collective bargaining to their faculty?
Okay, I'd like to answer that. I do not know of any examples like that. And I would say that when you look at the AAUP data as the place that most of the money has been going for the last 10 years, including across the USN system, is towards greater and higher salaries for administrators. That's the other problem.
And in fact, at the University of Maryland system, has not the management skewed much higher than the professors?
Exactly. Many more positions in administration and much higher pay for administrators.
Thank you. I appreciate that. Thank you, Madam Chair.
Do I have any other questions for this panel? Thank you all very much for your testimony. All right, so now I have 7 unfavorable. So I'm going to ask one person to go to the podium and the other 6 can take seats. Thank you for taking those. I appreciate it. There's one more stack. Thank you. Allison Wren, Stephen Roth, David Ownby, Dr. Rondell Allen, Dr. Guy Elaine Amaso, Provost Roger Ward, and Sherry Roxas. Okay, so we're going to start at the podium, and then we're going to go next to the person closest to the podium, and you're just going to write down the line. I'm not going to call anybody. You're just going to go next. Thank you very much. You can start and identify yourself, please.
Thank you, Chair Beidle, Vice Chair Klaus Meyer, and Senators. I'm Dr. Allison Rinn, the Senior Vice Chancellor for Academic and Student Affairs for the University System of Maryland. I'm going to start by touching briefly on the statements about the University System Council of System Faculty, or CUSIF, on collective bargaining. To be clear, the CUSIF resolution that was mentioned by Senator Kramer and Professor Brewer did not endorse collective bargaining. In fact, it flatly stated this is not an endorsement of collective bargaining. Instead, it asked the Chancellor and Board of Regents to support legislation extending the right to consider the alternative of collective bargaining for USM faculty. What harm would come from enabling collective bargaining, you might ask? The harm is to graduate students who will not be able to attend the USM due to funding reductions that have happened in other states with collective bargaining. The harm is to shared governance of the faculty when the faculty union decides to tread on the prerogative of the shared governance body to determine the curricular requirements of students, and that has happened in other states. And finally, the harm is to undergraduate students who will suffer from a work slowdown or stoppage by the graduate student or faculty union that could result in a delay on the submission of grades, causing students to potentially not graduate in a timely manner or lose graduate school or employment opportunities. My colleagues will share specific examples from our campuses on the ways in which shared governance operates successfully. You will see why we believe so deeply in the presumption of a shared commitment between faculty and the administration. We work together in a respectful manner in the system to ensure that best outcomes for our students. The USM respectfully urges an unfavorable report on SB 823. Thank you.
Thank you, Chair Beidle and committee members. I'm Stephen Roth, Dean of the Graduate School at the University of Maryland, College Park. I first want to acknowledge the courage and commitment of the students who shared their testimony today. I stepped into this role because I want to improve the student experience, and I know that we can do better. I do not believe, however, that collective bargaining is the best approach to improving the student experience. Graduate assistants are students receiving financial support, not employees. They are not hired under a typical employment process, but are provided an assistantship as a way to financially support their education and professional goals. Contrary to what you've heard, the meet and confer process is working. Our GA stipends are in the top ranks of our publicly funded peers. Our GAs receive the same healthcare benefits as our faculty and staff. And we have improved and continue to improve grievance, mentoring, mental health, and parental accommodation and other policies and resources. We often hear the question, and it was raised today, what do you fear with collective bargaining? Based on the experience of our unionized peers across the country, we fear that students' relationships with faculty will become more about employment than mentorship, that our ability to be nimble and work directly with students on policy improvements will instead be limited to renegotiating lengthy multi-year agreements through a union, and that programs will move more and more to hiring full-time staff rather than part-time graduate assistants, limiting important educational opportunities for students. For these reasons, we seek an unfavorable report on this bill. Thank you.
Thank you, Chair and members of the committee for your attention. I'm David Ownby, Associate Dean of Graduate Studies and Professor of Chemistry at Towson University, which, by the way, is not a Big Ten university. TU is currently expanding its research and graduate student capacity. However, the majority of our assistants are master's students, students that are only with us for about 2 years. Even though they're with us for a short amount of time, it is important that faculty and students develop a professional mentoring relationship. Graduate assistants receive tuition, parking, and stipend benefits as part of their appointments. A growing number are also receiving health insurance on our campus. We value graduate students as important members of the university community, and through their interactions with us and meet and confer, TU has increased master students by stipends by 50% since spring of 2022, and increased our doctoral teaching assistants by 23% for the research assistants. TU awarded both state COLAs, 3% in July 2022, 4.5% in November 22 that were funded by the state only for faculty and staff to the graduate assistants as well. Between the increases in stipend levels, adding additional assistantship positions, and higher tuition waiver costs, TU has increased its yearly investment in our graduate assistants by over $2 million since spring of 2018. Overall, we have a strong working relationship with our graduate assistants and respectfully request an unfavorable report on this bill. Thank you.
Good afternoon, the Chair of Vital, Vice Chair Clausmeyer, members of the Finance Committee. My name is Ronnie Allen, and I have the privilege of serving as Provost and Vice President for Academic Affairs at the University of Maryland Eastern Shore. And thank you for the time to describe what shared governance looks like on our campus. We have been intentional about engaging faculty, staff, and students in the decision-making process, as we believe it bodes well for transparency and accountability. Currently, we have 8 monthly faculty meetings for our faculty that provide access to our senior administration. We also have monthly meetings for our undergraduate and our graduate students. Some of the benefits of the shared governance process include, but are not limited to, receiving campus input on strategic initiatives, such as our regional accreditation document, our student success plan, and our strategic plan. In an effort to show faculty that we're listening to them and addressing their needs, we're now providing professional development funds to help them maintain competence in their area of expertise, leadership training, mentoring programs, as well as workshops that aid with the promotion and tenure process, research, and also the sabbatical process. And recently, we increased the salary for our adjunct faculty. Lastly, we have a grievance process that we believe works for our faculty. So in summary, we believe the shared governance process is working well on our campus as it allows for collaborative decision-making, transparency, and inclusion, therefore obviating the need for Senate Bill 823.
Good afternoon, Madam Chair and member of the Senate Finance Committee. My name is Guy Aliamusu, and I'm the newly appointed Provost and Vice President for Academic Affairs at Bowie State University. I've been at Bowie State University for close to 10 years, and my previous role was to serve as the Associate Provost for Academic Affairs. And prior to me being on the East Coast, I was a faculty at Cal Poly Humboldt, which is part of the California State University, where we were in the collective bargaining environment. So I'm talking here with the experience of a faculty who serve in that environment. At Bowie State University, President Brewer is committed to shared governance with faculty at the table to contribute to the conversation as part of the University Council, which maintains a positive relationship with the administration. Bowie State University takes great pride in the positive relationship we have built between the administration and the faculty by working collaboratively and meeting monthly with the Faculty Senate to provide university update and respond to questions and issues at hand. As an institution that is working to strengthen its research infrastructure with the aspiration of becoming an R2 designated school, we are committed to attracting and maintaining the best faculty with very competitive salaries. These past 2 years, we have created 16 programs, and we are working to accelerate the creation of new doctoral programs that must be supported by high caliber faculty equipped to teach, but to also lead our research enterprise. For an institution of our size, with a unique identity, the proposed legislation will handcuff our ability to effectively grow and sustain our research infrastructure. For these reasons, I urge the committee to vote in favorable for Senate Bill 823.
Good afternoon, Madam Chair and committee members. I am Roger Ward, Provost and Executive Vice President at the University of Maryland, Baltimore. The faculty and leadership at UMB have invested a tremendous amount of time and effort strengthening our relationship with each other and enhancing shared governance at UMB. This effort goes back to 2010, when then President Pullman convened a shared governance summit involving faculty, staff, and students. 14 years later, we continue to build and thrive on the goodwill from that summit. Our faculty, regardless of rank or tenure status, are engaged in every aspect of university governance, from budgeting to strategic planning, even to serving on search committees to select the president, deans, and vice presidents. When leadership and faculty disagree, we have well-established, transparent, and inclusive policies and procedures for resolving our differences, including grievances. All faculty have the right to grieve anything, and they have multiple layers of rights and appeals at the department, school, and university level. This grievance process is available to tenured, tenure-track, and non-tenured faculty. I realize that SB 823 is only enabling legislation. My concern is that it opens the door and enables a small minority of faculty to push for an election at any time, potentially bypassing shared governance and diluting its authority. I worry that superimposing a one-size-fits-all collective bargaining model on a well-functioning shared governance process will erode the mutual trust, respect, strong connections we have established with our faculty over these past 14 years. For these reasons, I respectfully urge an unfavorable report on SB 823 as written.
Good afternoon, Chair Bidel, Vice Chair Kalsmeyer, members of the committee. Thank you for the opportunity to offer testimony in SB 823. My name is Sherry Rojas. I'm the Director of Labor for the USM office. I'd like to take this time just to provide a bit of context in response to some of the comments that have been made. While some may argue that this is just enabling legislation that will give certain groups the choice to organize or not, the issue is really more nuanced than that. The process for electing an exclusive representative is structured in such a way that the actions and interests of a minority could bind the entire bargaining unit. Signatures collected on showing of interest forms are valid for 18 months. If a union collects showing of interest forms signed by 30% of the eligible employees, an election will be held. The outcome of that election is based on the valid votes cast in the election, regardless of the size of the proposed unit. So if there are only 10 people who show up to vote at the election, the decision of those 10 individuals will bind all of the employees in that bargaining unit, regardless of whether those employees desire that outcome. If, on the other hand, a union collects showing of interest forms signed by more than 50%, the exclusive representative will be immediately recognized. No election will be held. Employees will have no opportunity to vote by secret ballot. This means that an employee is bound by a decision likely for the remainder of their career that they may have made 18 months ago without an opportunity to reevaluate. Additionally, I'd also like to note, while 2,100 signatures on cards is impressive and it's a lot, I'd like to remind everybody that there are nearly 17,000 faculty and over 6,100 GAs across the USM. It's a bit unclear to me why there's a focus on the Big Ten, particularly because that's an organization where the institutions within that organization change frequently, but only one of the institutions within the university system of Maryland is in the Big Ten. Contrary to that, there are approximately 5,900 post-secondary institutions in the US. About 2,600 of those are four-year institutions, and the vast majority of those do not provide collective bargaining rights to these groups. For all of the reasons that you've heard and as provided in our written testimony, the USM urges an unfavorable report. Thank you.
Senator Kramer.
Thank you, Madam Chair, and I'll try to move very quickly. I hope you and the committee will just indulge me very briefly. Ms. Wren?
Dr. Wren.
Dr. Wren, thank you. Dr. Wren, you indicated that you felt there was some confusion about what the Council of University System faculty had done. And I'm going to read the following to you. Please share with me if this is incorrect. The Council of University System faculty urges the Chancellor and the Board of Regents to support legislation extending the right to consider the alternative of collective bargaining to USM faculty. Is that statement accurate?
I believe so.
Okay, thank you very much. We're in the exact same place, no confusion whatsoever, Doctor. Thank you. Mr. Roth? Speaking about the graduate assistants, you indicated that the meet and confer process is working well. If that's the case, why is it you would think that the grad assistants had 2,100 cards sitting on that table indicating that it's not working out so well? And secondly, you indicated that this would adversely affect the mentorship relationship. Are you aware of any empirical documentation whatsoever that a university system that has afforded the right for their grad assistants to bargain collectively has seen a disruption in the employment mentorship relationship? Any empirical documentation at all, sir?
Thank you for the question, Senator.
Sure.
To the first point, I have not been part of the collection of the 2,100 cards. I don't know how those have been presented to students or what information has been provided to solicit those signatures.
Got it.
To the second point, I am aware, as Senator Mounts presented, the LA Times article about the University of California system, where we've seen significant reductions.
My question to you, sir, please, I'm just trying to move quickly. You stated that collective bargaining would have an adverse effect on the relationship between the employers and their mentorship with the grad assistants. You made that statement.
Yes.
Do you have any empirical documentation to support that assertion?
I think the empirical evidence is the reduction in the number of graduate assistants that end up being hired by faculty at these institutions. The one data point that I can share is that at the university, at Rutgers University, they're currently supporting 24% of their graduate students on assistantships. The University of Maryland, College Park, we are currently supporting 41% of our students on
And
graduate
you
assistants.
have documentation, empirical documentation, that would indicate that's a direct consequence of collective bargaining?
I do not. No.
Okay, thank you. I appreciate that.
Senator, thank you.
Thank you very much, Madam Chair.
I have one quick question. Oh, Senator Lane will take you first.
All right, thank you, Madam Chair. Just a quick question. I think as someone whose wife also had gone through UMB as a PhD student and understands some of the challenges that she had gone through, particularly with work hours and all the workload that she had to go through, I understand and recognize that faculty know, from my perspective, as a faculty member at Johns Hopkins, I recognize that graduate students are really workers and are workers at our state universities. And so I'm supportive of this legislation. Hopkins also had graduate students who just recently chose to organize through their vote. And so, when we look at these two institutions at Hopkins, where those PhD students will have the opportunity to organize, and now folks at graduate students at USM who will not, what prevents there being a brain drain from folks that will now choose to go to Hopkins because they have the right to organize and they don't here have the right at USM?
Question two, Senator. You get one person. Did you direct it to someone?
I didn't direct it to whoever would like to answer the question.
Senator Lam, I think the question presumes that that students pick institutions based on the working conditions at the institution. The students at UMB select UMB to study, pursue their PhD because of the quality of the faculty, the programs offered, and knowing that when they graduate, they would have received outstanding mentorship. I don't think they factor in the working conditions. I was the dean of the graduate school at UMB for a long time. I was vice dean before that I'm now provost. I work very closely through the meet and confer process. In fact, I oversee the meet and confer process. Our students have expressed no interest whatsoever in being represented by a collective bargaining unit. They have direct access anytime they want it, and frequently with myself as provost and the president and our chief business and finance officer.
Okay.
Senator, I have a lot of questions and we're allowed one. So I'm gonna kind of go off of your question, Senator Lamb. What's the tuition at Hopkins University? Anybody know the tuition at Hopkins University?
I don't know the exact number, but I will tell you that it is a lot more than the tuition at our institute.
Well, that's what I'm getting to. So University of Maryland, I was told USM's tuition is $11,000 a year. And reading this Los Angeles Times article today about what happened when the salaries got raised because of collective bargaining and graduate students were removed and staff was cut. If we want to keep our tuition reasonable for our students at University of Maryland, I don't know how we increase salaries without affecting programs. So if you can find out the tuition in Hopkins for me, Senator, since you asked the question, I'd appreciate that for comparison purposes. I have lots of other questions I'll take offline because I'm going to respect the one question per member. Are there any other questions for this panel? Thank you all very much for being here. We have a few more people to call up. 55,000, 65,000. Thank you. Big difference. Joshua Obzug, Gregory Carey, and Oksana Mishler. Are you all still here or did you give up and go home? Because that's what we'd like to do right about now. Thank you all. Again, closest person to the podium starts and we just go down the line. I appreciate that.
Good evening, committee chair and members of the committee. My name is Joshua Abzug, and I'm a professor at the University of Maryland, Baltimore in the School of Medicine. I'm an orthopedic surgeon who does a substantial amount of clinical work, education, and research. I am also the former president of the university's Faculty Senate, a component of the shared governance process. I can tell you firsthand that the faculty, via shared governance, have direct access to the university president and provost on a regular basis. Faculty at UMB also sit on funding committees, have been members of search committees for new deans, the provost himself that just spoke, and our university president. The process of shared governance at UMB is working, and passage of this bill would substantially disrupt that process. Furthermore, it is imperative to recognize that faculty across our university system are vastly different. As a clinical educator, I work overnight, on weekends, and on holidays. The students I teach are often by my side during these times. It is obvious that our hospitals, which this body funds, cannot close during these periods, and therefore clinical care and education will always occur during these periods. My compensation is tied to my teaching, my research, and clinical activities. Incentives are provided for increased clinical productivity and research efforts. Recognizing just these two differences, with many more differences present, it is obvious that faculty at UMB are quite distinct compared to other faculty across the university system, and it would not be possible for an individual to be able to effectively represent the faculty across all of the university system, as the differences are just too great. As such, I urge for an unfavorable report on Senate Bill 823. Thank you.
Good afternoon. Thank you for allowing me to be here. My name is Oksana Mishler, and I'm a clinical associate professor at the University of Maryland, Baltimore Dental School. And just to follow up on my colleague's testimony, why do we need collective bargaining when we already have an effective system in place, shared governance, with all constituents, faculty, staff, students, and administration participating in contributing to decision-making process? I can only speak from personal experience. In my 15 years teaching at UMB, I was a graduate assistant, then a part-time faculty before becoming a full-time faculty. I started as a clinical instructor. I was promoted to clinical assistant professor, then associate professor. And not even once in these 15 years, I thought that we needed anything else other than what we already had in place, shared governance. For this reason, I urge an unfavorable report on the Senate Bill 823. Thank you for your attention, consideration, and continued support.
Shall I start? Good afternoon, distinguished panel. Hello, my name is Greg Carey. I'm a tenured associate professor and assistant dean for student research education in the School of Medicine at UMB. I'm also executive director of community outreach and director of several funded education programs. I've been a graduate student, just like Dr. Mishler, and I completed 2 postdoc fellowships in cancer biology before I became a faculty member. So our trajectories are really similar. Most of my salary support comes from or is connected to grants and contracts. The hours are long, as Dr. Abzug said, in research and education training, and we acknowledge the work and education structures are very unique and they're different across the university system schools. So it's difficult to imagine a one-size-fits-all solution for the entire university system of Maryland. Shared governance works for us at UMB. Through shared governance, I enjoy professional and academic freedoms. I also get to positively impact faculty, student, and administrative spaces. In the interest of time, I want to stay close to the time here. I've also served in search committees for department chairs, provosts, et cetera, even as an associate professor. So I had access and influence at those position levels. As I rose in leadership at UMB, UMB itself gave me the tools, training, and opportunity to do this, to have the impact that I have. Through shared governance, all voices are already welcome. Individuals and representatives from the UMB community work together to consider individual and collective needs and come to consensus on the best paths forward. This is done in full transparency. Shared governance works for us, and this is why I urge an unfavorable report on Senate Bill 823. Thank you.
Thank you, Doctor. Do I have any questions? Senator Kramer.
Thank you, Madam Chair. Yes, on your statement just now about one size fits all, and that just doesn't work. Are you aware of what the bill provides in that each institution gets to do their own thing? And in fact, there would be multiple bargaining units at each USM institution, one for faculty, one for part-time, one for postdoc, one for grad assistants. No one size fits all. Each one gets to do what they deem appropriate, which may or may not be choosing to bargain collectively, but certainly not a one size fits all. Would you agree that that's the case? I mean, I don't know how familiar you are with the bill. I've read
the bill and I've read the materials in preparation for today. And I can tell you I'm not an expert in legal matters. What I can tell you is what I understand today is that a small group of persons have been pushing what we're here to talk about today. And so are my interests represented in what's being talked about here today? No.
Okay.
So therefore, so my response to your question in that respect would be, what is being proposed does not fit me.
And you didn't answer my question, but you did just go somewhere real fast with this, a small group.
Yes.
If it is your belief, sir, that this is just a small group, then why are you here testifying in opposition? Because it's going to take a lot more than just a small group of employees to be able to avail themselves of the opportunity to bargain collectively. If it is just a small group, sir, why are you here today?
So I'm here because I feel that our shared governance system works.
Okay.
I expressed what my thoughts were about
Thank you.
the decision being made by what I consider a small group of persons essentially dictating what I feel are going to be things that impact my career, the way I do
Thank
my
you,
work.
Madam Chair.
Thank you.
Do I have any other questions for this panel? Thank you very much. We have 3 virtual. I'm going to start with a favorable Epsilon Siddiqui. I probably got that wrong and I apologize.
No problem. Thank you so much, Madam Chair, Madam Vice Chair, members of the Senate Finance Committee. I am Marland Siddiqui, a graduate student at the University of Maryland and Vice President of Graduate Affairs for the University System of Maryland. As the representative of several thousands of graduate students across all the 15 universities and regional centers in the USM, I'm asking for your vote in favor of SB 0823. Graduate workers are indisputably essential workers, fulfilling crucial roles in teaching, research, and admin support, all fundamental to daily functioning of our universities. Despite our indispensable contributions, the USM have attempted to undermine our status, dismissing our contributions and concerns. The reality is that graduate workers face genuine and substantial challenges. These include low pay, exacerbated housing insecurity due to higher rents and inflation, inadequate healthcare, and a lack of recourse for potential discrimination and harassment. These are not trivial grievances. They profoundly impact our ability to thrive academically and personally. By dismissing our concerns as mere complaints, the university system demonstrates a profound lack of empathy and understanding of our experiences. Collective bargaining is essential to addressing these challenges, allowing us to negotiate for fair wages, benefits, and protections, including housing support to mitigate the effects of high rents and inflation. Collective bargaining represents a crucial mechanism through which graduate workers can assert their rights, address systemic injustices, and advocate for fair and equitable working conditions. By organizing collectively, we can negotiate for wages that reflect the values of our labor, secure adequate benefits and protections, and establish mechanisms for addressing grievances and ensuring accountability. Far from being divisive or confrontational, collective bargaining is a democratic process that empowers workers to collectively shape their working conditions and advocate for their rights. I respectfully urge the Senate Finance Committee to take action and please support this vote, support this bill. Thank you for considering.
Thank you. I actually have a question for you. So we heard earlier, if I heard this correctly, 41% of the University of Maryland UMD graduate students are funded. So that means 59% aren't funded. So with the collective bargaining would only apply to the 41% that are actually receiving a stipend and free tuition, correct?
Correct, yes.
Thank you. Next, we have Amanda Grant.
Yes, good afternoon. Good afternoon, Chair and members of the Finance Committee. Thank you for the opportunity to provide testimony regarding Senate Bill 823, which would authorize faculty, part-time faculty, postdoctoral associates, and graduate assistants to collectively bargain. Morgan State University respectfully opposes this legislation and urges the Senate Finance Committee for an unfavorable report. Morgan State University is a premier public urban research university in Maryland, known for its excellence in teaching, intensive research, effective public service, and community engagement. I am Armada Grant, Special Assistant to Dr. David Wilson, President of Morgan State University. Prior to holding this position, I served the university for several years as the Chief Human Resource Officer. As such, I have been involved in collective bargaining at Morgan since the enactment of collective bargaining for higher education in Maryland. I know firsthand what is involved in the process of collective bargaining. It will require an enormous financial impact on the university and the need to hire substantially more individuals to manage 4 additional bargaining units on top of the 2 bargaining units we now have. Faculty and graduate assistants have a role in the shared governance of Morgan with their participation on the University Council. This council acts as an advisory board to the president and the governance of the university. In addition, the faculty and graduate students have venues where they can assist the support they need to resolve problems or concerns. We believe collective bargaining would not only delay but hinder that process. For the reason provided, I urge an unfavorable report on Senate Bill 823. Thank you.
You can start.
Good evening, everyone. My name is Tahira Johnson, and I proudly serve as the president for the graduate student government at the University of Maryland Eastern Shore. Before I begin, I would like to thank Chair and Vice Chair for allowing me the opportunity to speak on behalf of the graduate students at UMES. Today, I stand before you to testify that our university has been actively seeking and providing more resources to the graduate students. One significant advancement in this establishment of a dedicated writing center that caters specifically to the needs of graduate students. The resources has been invaluable in supporting our academic endeavors. Furthermore, the graduate student government has regular meetings with Dr. Harris, the Dean of Graduate School. In these meetings, we address critical student concerns such as interinstitutional tuition issues and the development of workshops tailored to benefit graduate students. This partnership has been instrumental in enhancing the graduate student experience as well. One of the most impactful changes facilitated by Provost Allen was the establishment of a separate account for the graduate student government. Previously, we shared funds with the Undergraduate Student Government Association, which limited our ability to serve graduate students effectively. So with our own account, we can now allocate sources more efficiently and cater to the unique needs of our graduate student community. Additionally, graduate student government meets monthly with Provost Allen and President Anderson to provide updates on our progress and seek their continued support for hosting social and professional events. The administration's commitment to seeking feedback from the graduate students has resulted in intangible improvements over the years. As a 5-year graduate student at UMES, I've witnessed immense progress and positive changes, thanks to the collaborative efforts between the university administration and graduate students. Together, we are creating a more supportive and enriching environment for all graduate students at University of Maryland Eastern Shore. Thank you.
Thank you for your testimony. Do I have any questions from the committee? Thank you very much. That ends the hearing on this bill, and our last bill of the day is Senate Bill 987, Senator Lamb. Looks like you might have a panel, Kathleen Hoke and Dana Moncrief. Is that right? Thank you.
All right. Props. Here's our, okay. Good evening, Chair Vital, members of the Senate Finance Committee, here to introduce Senate Bill 987. This issue was brought to my attention when a constituent saw that a store in their neighborhood was selling a vaping product called an Elf Bar, which are currently prohibited from being sold based on an FDA rule. The constituent called the Alcohol, Tobacco, and Cannabis Commission here in the state and was told that there was nothing that they could do directly besides notifying the FDA that the illegal products were being sold. The FDA is currently engaged in a process of clearing vaping products, approving vaping products to be sold in the U.S. Currently, there are a small number of vaping products that have made it through the FDA clearance process. Although I do agree with advocates from the vaping industry that the clearance process has taken too long, I still think that we should have a conversation about whether we should be permitting the sale of these illegal vaping products in Maryland. This is especially important because many of these illegal products are the ones that are especially attractive to kids, such as some of these that I bought on West Street. The first one, this purple one, is called an Elf Bar, and its flavor is berry mix. According to the National Youth Tobacco Survey, Elf Bars are the most popular vape used by youths in grades 6 through 12, and approximately 57% of the market share. This vape is rechargeable using a USB cord that plugs into the bottom here. The second one is a disposable vape with a bright pink color and the flavor pink lemonade. And this third one is also disposable vape sold for $12 and is yellow and green, resembling a crayon. It's made by a company called Gummy, and its flavor is Sour Patch. I know that while SB 987 in its actual bill text looks long, its impact is fairly easy to explain. The bill is creating a public directory of vaping products that are legal to sell in the state of Maryland. Most of the requirements are just good business requirements, such as having a Maryland resident agent. The main requirement that is relevant to this discussion is that the vaping product can only be added to the registry if they have FDA pre-market clearance. The bill also ensures that the Attorney General has the power to ensure that only legal vaping devices are being sold in the state. This bill is based significantly on similar authority that the Attorney General has to limit the sale of illegal tobacco products in the state. The vaping industry advocates are going to point out that by passing this bill, we would be prohibiting the sale of the vast majority of vaping products. This may be potentially true, but as a condition of vaping license, all applicants are required to agree to follow all state and federal laws, which would include the FDA requirement not to sell an uncleared vaping product such as these. That said, I do agree that the FDA process has been slow and have requested an amendment to exempt products that are still waiting on an FDA decision while they're going through the clearance process. I am open to having a conversation about where exactly to draw the line on what is an illegal product, but I do not believe that we need to have a Maryland level enforcement process to ensure that illegal products, especially those that are attractive to kids, are not sold in the state. Also want to note that this bill is in no way competition to our good colleague Senator Kramer's Tobacco Retail Modernization Act. I strongly agree with everything in that bill, especially the requirement that vaping products be restricted to licensed vape shops. But I still believe that there should be some process to ensure that those vape shops are not selling illegal products such as these. I've been asked about the difference between Maryland businesses selling cannabis products versus selling uncleared vaping products. The big difference is that, as this committee knows, we have a very robust regulatory and commission process that regulates every part of the cannabis market, from growing plants to selling a finished product. This sort of state level control does not exist for vaping products or for tobacco. So we are more tied to what the FDA decides are appropriate for the market. With that, I'll ask for favorable consideration of this bill and turn it over to other members of the panel to take questions at the end. Thank you so much.
Good evening, Madam Chair, Madam Vice Chair, and members of the committee. Thank you very much for the opportunity to testify in support of Senate Bill 987. My name is Anna McCormick, and I'm an Assistant Attorney General in the Tobacco Enforcement Unit of the Attorney General's Office. Senate Bill 987 would significantly improve the laws for electronic smoking devices, or ESDs, and enable the state to bring some much-needed oversight to this industry. It does this in two ways: by requiring that only legal products are sold, and by reforming the system for selling these products. First, the bill would give the state tools to enforce existing laws that require ESDs have FDA authorization, or, as the recommended amendments include, a pending application for authorization. Right now, the state can't determine which products are being sold lawfully. The bill solves this problem by creating an ESD directory. Manufacturers would apply to the Attorney General for approval before they could sell ESDs in Maryland. The AG would get information from applicants, including whether they have applied for or received FDA authorization, and the process would be funded by fees paid by the manufacturer. An ESD directory would tell businesses what products are legal to sell in Maryland and keep out untested, unreviewed products. The second thing Senate Bill 987 does is revise the licensure system. It requires all entities get an ESD license, eliminating the current licensure exemption that prevents the state from knowing all businesses that are selling ESDs. The bill requires all sales be made by and to businesses with Maryland ESD licenses. It also eliminates the loophole that allows manufacturers to sell directly to consumers over the internet, reducing the opportunity for remote sales to youth. The bill also gives the Alcohol, Tobacco, and Cannabis Commission authority to conduct inspections, just like it does for cigarettes. Finally, the AG recommends amendments that would, 1, limit the sale of ESDs with pending applications to vape shops, require manufacturers make an escrow deposit before joining the directory to pay for the safe collection and disposal of delisted products, offer manufacturers a way to withdraw the product on their own, revise the penalty section by giving the state more tools to effectively enforce the law. I urge a favorable report on Senate Bill 987 with amendments, and I'm happy to answer any questions you may have. Thank you.
Good evening, Madam Chair, Madam Vice Chair, members of the committee. Thank you for this opportunity to testify in support of Senate Bill 987. Again, my name is Arvind Muthukrishnan. I'm also an Assistant Attorney General in the Tobacco Enforcement Unit of the Office of the Attorney General. The directory proposed by Senate Bill 987 is modeled off the cigarette directory that has been effectively enforced by the Office of the Attorney General for over 20 years. In fact, one of my primary duties in the Tobacco Enforcement Unit is to enforce the provisions of the cigarette directory statute, which requires that all cigarette manufacturers submit documentation identifying their products and verifying their compliance with a variety of state and federal laws before their products may be sold in the state. An ESD directory would be similarly effective in cleaning up the ESD marketplace of the thousands of products manufactured across the globe with little to no oversight. For the foregoing reasons, the Office of the Attorney General urges a favorable report on Senate Bill 987 with amendments. Thank you for your time, and I'm happy to answer any questions you may have.
Good evening, Chair Beidel and members of the committee. My name is Dana Moncrief, and I'm the Director for the Center for Tobacco Prevention and Control. Thank you for the opportunity to testify on behalf of the department in support of SB 987. This bill updates, as you've been hearing, this updates the licensing system for electronic smoking devices and better aligns state law with tobacco use best practices in tobacco control. The U.S. Surgeon General, CDC, and other organizations all recommend licensing retailers, including for electronic smoking devices. Right now, retailers, manufacturers, and wholesalers with cigarette and other tobacco product licenses are not required to obtain a separate license to make, distribute, or sell electronic smoking devices. This is concerning. First, these devices are widely available at gas stations and convenience stores and in direct-to-consumer sales through the internet. This is a major public health concern, as electronic smoking devices are the most popular tobacco product among our youth. Second, these differences in licensing requirements for electronic smoking devices can make it difficult to assess retailer compliance with youth access laws. The department is supportive of provisions of SB 987 requiring products having received authorization from the FDA before they can be listed on the directory, which is managed by the Office of the Attorney General. This is an important provision to protect our children from tobacco use, as the majority of youth who use electronic smoking devices use flavored products, and the FDA has authorized very few of these products. The department looks forward to working with members of this committee and the Office of the Attorney General on this important legislation. Thank you.
Good evening, Madam Chair, members of the committee. I'm Kathy Hoke, a professor at the University of Maryland, Carey School of Law, where I also direct the Legal Resource Center for Public Health Policy, and I'm glad I was not here on the previous bill. In any case, I was here a little bit ago on adding vaping to the Clean Indoor Air Act, and thank you for the favorable with amendments report on that. Love the amendment, Chair Beidel. Lots of you wanted to talk at that hearing about the crisis that you're experiencing, Senator Mounts, in your schools with youth vaping. I think others were asking about that question. And so it's clear you understand that we have a problem with youth and vaping. And so we have to tackle this problem from a supply and demand perspective, right? This bill addresses the supply side, that limiting the products lawfully on the market in Maryland and giving us tools to get out the illicit products that apparently are easily sold here in Annapolis will reduce on that supply side. We are working on that demand side. The Legal Resource Center's annual conference is in June this year, and we're going to have a whole panel on this youth vaping in schools issue. We're bringing in folks from the school boards and the local health department. And I'm going to follow up with you about it, Senator Mounts, because I still have your card from that hearing. So we hear you, that you understand this is a problem. Please hear us that there's multiple ways to solve this problem. This is the supply side. We heard earlier on Senator Kramer's SB 1056 on some other issues on supply side with vape shop vendors. I think these two provisions go together quite nicely. Honestly, the vape shop vending community is actually interested in complying with the law and reducing youth access, not even allowing youth into their establishments. So together, those provisions could really hammer down on this supply side. So for these reasons, I urge a favorable report on Senate Bill 987. Thank you.
Thank you. Do I have any questions for this panel? I don't see any questions. Thank you very much. We're going to go to our last panel of the evening. 6 unfavorables: Sarah Price, Scott Weber, Bruce Bariano, Tyler Bennett, Candace Scott, Melissa Hendricks. I hope some of you went to dinner by now. I don't see Bruce either. Okay, so Tyler, you're going to start and you're all going to go right down the row. Thank you.
Good evening, Madam Chair, members of the committee. I know it's been a very long day. For the record, my name is Tyler Bennett with Compass Advocacy on behalf of the Maryland Vapor Alliance. My two of my colleagues to the right, two of our members are going to speak a little bit about their perspective and on the perspective of their shops. I just wanted to comment on the proposed amendments to the bill. I appreciate the conversations that I've been able to have with Senator Lamb's office. I have seen them and I appreciate the intent. But we would urge, we would just like to specify that we would still resist those. I think there is such a problem at the federal level with the PMTA process in general that you've heard the proponents allude to about how ongoing it's been and how it's taking way too long. There's lots of pending litigation that are out there. We've had Circuit Court of Appeal, U.S. Circuit Court of Appeals cases that have thrown out some marketing denials and have been pretty scathing towards the FDA in terms of how this process has been undertaken, describing it as, quote, capricious and arbitrary. It's possible that they may have to essentially go back to the drawing board. I do think it's something it could potentially go to the Supreme Court, and we may have some much different landscape along those lines in the future. And I think at this point in time, we would respectfully urge an unfavorable on both the bill as written and the as amended as well. Thank you.
Good evening, committee and chair. My name is Candace Scott and I represent the Maryland Vapor Alliance. This bill is the big gift for big tobacco. This bill is being lobbied by big tobacco in all states across America, and for the most part, legislators have done a really excellent job at seeing right past the same old tactics used by big tobacco and their lobbying teams. This bill leaves 9 big tobacco products on the shelf and bans everything else. We are talking about the products from the same corporations who created an issue with teen use and then marketed their products unethically. I have owned my business for 10 years and there has never been an issue until big tobacco stepped in and sunk their claws into our industry. If this bill passes as is, there will be no more open system vapor products on the market. My customers using 3 milligrams of nicotine will be forced to use 50 milligrams of nicotine. That is, unless they decide to go back to smoking cigarettes. Another great big win for big tobacco. If they decide to get their products on the black market or from another state, there will be no taxes collected here in Maryland. In fact, a similar bill was introduced last year and the fiscal note on that was $90 million annually. And the state stands to lose about the same amount here. Small business vape shops and manufacturers sued the FDA for the shortcomings of the pre-market tobacco application, and the FDA lost. The Circuit Court issued an injunction to the FDA to allow products to continue to be sold. Then the final decision was handed down a few weeks ago, and the judge's decision included calling the FDA arbitrary and capricious towards small businesses and their handling of the pre-market tobacco applications, as well as saying the FDA sent these small business manufacturers on a wild goose chase. Therefore, the Circuit Court shot down the PMTA process while Maryland is here trying to make it the gold standard. This bill is bad for business, and we are asking for an unfavorable report. Thank you.
Good evening, Madam Chair and the members of the committee. My name, for the record, Scott Weber, founder of the Vaping Awareness Public Education Society. We are a nonprofit public research firm looking at the concept of vaping, trying to eliminate smoking. In your packet, I included a list of 100% of the items that have been approved by the FDA. I won't go all the details and statistics and numbers and vaping, but today I want to give you an example of what this would do to the vaping industry, for which we advocate is it's a necessary element of the equation to get people to stop smoking. What you have in front of you here would be the vaping restaurant that would be available to the entire, not only country, but certainly in Maryland. There are only 23 products on here, but some of them are also just the packaging, and every different cup is actually a different type of power supply, et cetera. But there are actually only like 6 to 8 products that they would be able to sell at this restaurant. And it's of course only one real product. It's whether it's tobacco or whether it's potato. We've got several different sizes of potato, and these two, even though they're exactly the same, they're a different size, so they're actually considered a different PMTA and they're a different product. And whether it's a golden Yukon or a sweet potato, or it's a sweet potato powder, it's all the same. Or whether it's a big one versus a little one, if it's a potato chip, this is actually twice the number of products that a restaurant could run on. And what I want you to consider then is if a restaurant could only sell one product, potato, and we're talking every restaurant in the entire state, only one product, and every competition is also only selling potatoes, and there are really only a couple different variations because the size is there, you would literally wipe out every single vape shop that is there. And the advantage of having vape shops that are closed, that are limited to only people who can come in for vaping for adults, we are all for that, and we were a proponent there. So I ask you to consider the fact this indeed would be the death knell of there. I was very involved with the PMTA process. There are approximately 6.7 million devices. This is all that's left. I have lots of answers to lots of any questions that may be there. I thank you for the time.
Right. Hello, committee members and chair. My name is Melissa Hendricks. Again, I'm with Maryland Vapors Alliance. Thank you for allowing me to speak today. I oppose SB 987 as this bill would shut down my business. I have a vape shop. It's Vape Loft in Edgewater, Maryland. I've been open since 2014. This bill only keeps big tobacco products and high nicotine devices on the shelves in stores in which nobody under the age of everybody can walk into those stores. All of my customers do not use big tobacco products, so this would push all of my customers to either go back to smoking, find another state that sells their products, go to the black market, or purchase online. This would also leave me little to no products to sell on my shelves. And then all the products that would be left would be where any age could enter the store. The FDA has been trying to regulate the ENDS products for a while. They haven't done a great job. There's a ton of products that still need to be approved. And as of right now, the only products that have been approved are big tobacco. Within the industry, some of the e-liquid companies have gone to court to be able to fight to keep their products on the markets. They were awarded a stay, but none of that matters because they're not part of the PMTA process. So it'd just be big tobacco. I have customers that are down to 3 milligrams and even some with no nicotine at all. With this bill, only high nicotine products would actually stay on the market from 18 milligrams all the way up to 60. Over the years, I have worked really hard with my customers whose only goal is to get completely off of everything. And I have been able to satisfy those goals. If this bill passes, people would not be able to work their way off nicotine, and they're stuck at the highest level of nicotine that's on the market. Thank you.
Good evening, Madam Chair and Honorable. Yes.
For the night. You are the last witness.
Happy to be here. Good evening, committee members. Thank you for your patience. Once again, I am Sarah Price here on behalf of the Maryland Retailers Alliance. We are opposed to this bill as introduced, but strongly in support of reducing youth use of these products. We actually were in support of a similar bill on the House side that it would create a directory, but it allows or requires for that directory to be updated to reflect products that receive approval from the FDA after this legislation goes into effect. Unfortunately, that bill does not have a cross file, although it sounds like there may be an amendment to this bill which could achieve a similar end. So if I could see a copy of the amendment, we would be happy to review that with our members and let you know if our position changes, but as introduced, unfavorable. Thank you.
One quick follow-up question to that. So the amendment would allow the vape shops to continue selling devices that are still in the FDA clearance process while they're still going through, and if there's pending litigation, so that those can still be sold. I presume that once FDA has made a determination that the product is illegal, you would be okay with us removing those from the shops, right?
My members would say yes.
Okay. So the amendment should satisfy that concern. Right?
Can I see it anyway?
Yes,
Thank you.
of course. Okay. Thank you.
Do I have any other questions for this panel? That ends the hearing on this bill and it ends our hearing for today. Thank you very much.